this philosophy in the much-loved Tree of Life. It resurrects the true meaning of a genuine doctor-patient relationship and highlights the philosophy Har ek jaan anmol, meaning each life is invaluable. That's why Medanta is not just a chain of multi-speciality hospitals, but a doctor-led model for the future of patient care. Medanta brings together multidisciplinary teams of experienced doctors and advanced medical technology in a safe environment. Our integrated tertiary care infrastructure and patient-centric building design aim to create a conducive environment for treatment and recovery.
So Medanta was created to bring to India advanced healthcare across all specialties on the same platform and deliver it at an affordable cost.
Medanta is one of the largest private multi-speciality tertiary care hospitals in North and East India, striving to deliver advanced healthcare and affordable medical services. Medanta leverages technology to enhance the quality of care it delivers. Our home care services and telemedicine solutions allow us to deliver the Medanta standard of care well beyond our hospital walls, because we believe that the quality of healthcare should not depend on where you live. Medanta stands for care, commitment, and high levels of integrity. From every treatment to every outcome, from every machine to every doctor, from little details to macro philosophy, Medanta strives to combine science with our culture, technology with our values, and passion with our resources to deliver advanced and affordable healthcare.
Ladies and gentlemen, while we are waiting for all our dignitaries to join us, may I once again inform all the participants that the Senior Care Conclave, which will be held at Regency 1, which is one level below this hall, from 12:30 hours onwards. All our participants who would be interested to join the Senior Care Conclave from 12:30 hours onwards may kindly proceed at that time towards Regency 1, which is one level below this hall, and the healthcare sessions will be conducted in the ballroom itself. Thank you. Once again, requesting everyone to join us inside the hall, be seated with their mobile phones kept on to silent mode. We are waiting the arrival of our dignitaries to go ahead with the proceedings of the summit. Thank you. Ladies and gentlemen, we are now going to go ahead with the proceedings of our inaugural plenary session. May I request everyone to kindly be seated. Ladies and gentlemen, we are ready to go ahead with the proceedings of the summit, requesting everyone to be seated, all mobile phones kept on to silent mode. Distinguished thought leaders, policy makers, healthcare providers, and industry innovators, distinguished participants and stakeholders, respected members of the press and media, ladies and gentlemen, a very warm welcome to the 22nd CII Annual Health Summit 2025, a marquee thought leadership platform and annual policy forum that shapes the future of healthcare in India. This year's theme, Adding Life to Years in the Age of Artificial Intelligence, reflects a profound shift in our approach to health as AI transforms disease prediction, diagnosis, personalized care, and public health delivery. The conversation is no longer about simply increasing lifespan. It is about enhancing health span, the quality, dignity, and joy in the years we live. The summit brings together visionaries, policymakers, healthcare leaders, clinicians, AI innovators, industry experts, and global thinkers, all united by a shared purpose to explore how technology can not just extend the length of life, but enhance the quality of life. Together, we aspire to shape India's healthcare landscape towards building Viksit Bharat 2047, redefining what it means to add life to years. The Confederation of Indian Industry, CII, has been at the forefront of driving the transformative healthcare initiatives in India, aligning with the vision of a healthier and more inclusive region through its National Healthcare Council. Ladies and gentlemen, we begin the proceedings with the inaugural plenary titled Healthcare at the Cutting Edge. Is India setting global benchmarks? And to lead this dialogue, we are privileged to have with us an exceptional panel of thought leaders representing policy, clinical excellence, innovation, and global collaboration. And our distinguished moderator for this session is Ms. Amita Sarkar, Deputy Director General, Confederation of Indian Industry. Let's put our hands together to welcome ma'am onto the stage. We also welcome our distinguished Dr. Naresh Trehan, Chairman, CII Steering Group on Health, and CMD Medanta the Medicity, a globally acclaimed cardiac surgeon and a champion of high-quality, patient-centric healthcare. A very warm welcome to you, sir. We welcome Ms. Sunita Reddy, Managing Director, Apollo Hospitals, a pioneer of private healthcare in India, leading initiatives that combine compassion with world-class clinical outcomes. Let's put our hands together to welcome ma'am. We welcome Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan, an international leader bringing global best practices to healthcare, innovation, cross-country collaboration. A round of applause to welcome, sir. We also welcome Dr. Shabnam Singh, Principal Advisor, Healthcare, CII. And now, ladies and gentlemen, I hand over the stage to our distinguished moderator, Ms. Amita Sarkar, to lead the conversation. Over to you, ma'am.
Very warm welcome to each and every one of you on behalf of CII to the 22nd Annual Health Summit of CII, especially to the Japanese delegation who've come in large numbers today. I think all of us are aware of the unfortunate blast that happened in Delhi last evening, and there are lives that those were lost. May I request each one of you to kindly stand up as a mark of respect for 1 minute of silence. Thank you very much. Thank you very much. I think the two healthcare stalwarts of India on the dais don't need an introduction, but just to say that Dr. Naresh Trihan, who had foundational years in the US and is a practicing physician, additionally, of course, he has been guiding us as the chairman of CII Steering Group on Health, the CII Healthcare Council, and chairman and managing director of Medanta, the Medicity, that is deepening its footprint across the country. I think very recently you had plans to open up in Guwahati as well. So thank you, Dr. Trihan. I think the sector looks up to your guidance at every stage. Ms. Sunita Reddy, I think Managing Director, Apollo Hospitals. Sunita, you belong to, if I may say, the first family of healthcare, which Dr. Reddy pioneered the establishing of an organized healthcare, the cutting-edge healthcare in the country. And I think all of you all the four sisters are day and night working to really promote the accessibility of healthcare and the latest in healthcare. I know personally you are very, very passionate about the AI and technology piece. Thank you, Sunita, for making time and flying into Delhi last evening to join the conference today. A very warm welcome also to Dr. Kenji Shibuya, the CEO of the Medical Excellence Japan, who's come to India with a very strong Japanese team. And all of you all must take advantage of this to have a lot of B2B conversations with the Japanese delegates to the conference today. Once again, very good morning and warm welcome to everyone at the 22nd CII Annual Health Summit. It's heartening to see this forum evolve into one of India's most respected platforms for shaping the healthcare agenda, bringing together government, industry, academia, development partners. Each edition has reflected the priorities of this time, from quality and access to digital transformation, resilience, and now the integration of artificial intelligence into care delivery. Through its Healthcare Council and now the Center for Health, CII has consistently worked towards building an ecosystem that supports innovation, policy dialogue, and partnership, enabling India's healthcare system to become the equitable, efficient, and future-ready. Yeah, sorry, I forgot. My apologies. We have on stage also Dr. Shabnam Singh. A big round of applause to Shabnam. She spent a lifetime with healthcare and now she is advisor to CII. This year's theme, adding life to years in the age of artificial intelligence, is both visionary and urgent. It captures the promise of technology to not just extend life, but to improve the quality and dignity of those additional years. AI and digital tools are redefining diagnosis, research, and patient engagement. But the true test lies in how intelligently and inclusively we apply them to strengthen our healthcare systems and empower our people. So as I already told you, nearly 50 delegates from leading Japanese healthcare organizations are present with here today. And we welcome not only Dr. Kenji Shibuya, but also the Chief Operating Officer of the ERIA, Economic Research Institute for ASEAN and East Asia, Dr. Takayuki Yamanaka, if I pronounced that well, and also each one of you who've taken the trouble to fly into India and have very fruitful conversations with us. What began last year as an idea of mutual learning and exchange has today evolved into a structured engagement encompassing the B2B's Joint Innovation Showcase and institutional partnerships. And as also many of you would be aware, we had taken a delegation of the Indian healthcare stakeholders to Japan in this June also. So thank you very much, ladies and gentlemen. And now over to Dr. Shabnam for a conversation on how India is emerging as the best of global healthcare in terms of our technology and practices, as well as circling into conversations of looking east and towards Japan for a very fruitful partnership with the Indian healthcare and the Japanese healthcare. Thank you.
Thank you, Amita, for putting the context and making my work much easier. I'm used to bullets and shots, not unfortunately like the ones that happened last night, for which there are no words to express one's anguish. But given the fact that it's the morning and I can see a lot of fixated, interested, and driven people in this room, I don't want to take much time to just let yourselves shut your eyes and listen to their words of wisdom as we all love to dream. This is the era, given the entire world is totally disrupted by the great generative AI. How do we dream? How do we reimagine healthcare which truly fits the purpose of societal needs? So with that, Dr. Trehan, you have been not only a thought leader, a pioneer, an entrepreneur, and a fantastic clinician who really feels the soul of a patient. As we realize Viksit Bharat, how do you imagine, reimagine, going away from the past, what healthcare in India will look going forward? Over to you, sir.
Thank you. Thank you, Shabnam. So as you know, the basic idea of Viksit Bharat is that we must provide quality healthcare to all our citizens in India across the full country. Now, if you look at the background of healthcare provided by different countries to their citizens, nobody has really been able to master the whole gamut in the sense that if you look at even the Western countries, Europe and all that, there's a challenge that many people are finding it very difficult to access healthcare because of long waiting lines. People even have serious complications waiting. People have died. So it's a challenge. It's a challenge especially for us when we are 1.4 billion people. But I must say, given that background, the government schemes along with the private sector and along with the government's provision of healthcare, we are doing much better than most countries because the coverage has become quite widespread and quite deep. So that is why I think that what the subject of today being that how can AI be leveraged to deliver healthcare not only to treat disease but to also keep people healthy and well. Now, if you look at the background, when we became doctors, became doctors to treat disease, and when you said, why let people get so sick, so let's do early detection, and that's when all the MRIs and the CTs and all that came to actually be able to enhance our ability to detect disease early. But then we said, why let people get ill at all? So we started this preventive movement, which is about a decade or so more, that we find that we gave a full prescription to society around the world, saying don't eat this, don't do that, and exercise, do. So all those, avoid obesity, diabetes, all these things. But to our great disappointment, the adoption around the world is less than 5%. So what we are seeing today is that obesity is increasing, heart disease is increasing, diabetes is increasing, and worst of all is cancer is actually going through the roof. So we have a huge challenge in front of us, and AI is not new to healthcare. We have been using machine learning and primitive forms of AI in creating algorithms to see early warning systems and stuff like that. So it's not an alien fact for us to master. I think that one thing is going to happen, and that is that AI is going to incrementally take over many tasks to our benefit, basically, to be able to provide healthcare to a much larger base, because as you know, in the background of India and the world today, there is an acute shortage of beds, doctors, nurses, and paramedical personnel. And if we can leverage AI to multiply expertise, we will be able to serve many more people at a lower cost and higher efficiency. So we are all working on it. There are many applications that have already come. So in other words, there is the naysayers should stop, because they must realize that there is not, you cannot stop this wave, and you should not stop this wave, because it can be used for the benefit of humanity. Yet we always have that fear that where is it going to lead us if it is unbridled. So I think welcome to the idea that AI will play a huge role in healthcare. It will enable us to serve much better. And I welcome our Japanese friends, led by Dr. Kenji Shubaya, to actually bring together the technology that Japan has, the human capital that we have, and there is a win-win situation for all of us, because of the fact that innovation, a lot of work is done in India, and then it goes and gets converted into a product overseas. Now, Japan would be an ideal partner for that, and I think that this meeting today is going to start the beginning. The beginning was started by Dr. Kenji last year in our summit, and we sent a delegation to Tokyo and other parts of Japan to actually connect with people. And I hope today's interaction between the product people, the delegation that has come, and that B2B meetings that are going to take place are going to be very productive. And I encourage everybody, wherever CII can play a role, we'll be happy to do that. Thank you very much.
Thank you. Thank you very much, sir, for that. Taking it forward from what you said, of embracing AI and all the goodness in it instead of being naysayers, Sunita, you represent the pioneering family in Indian healthcare. Chairman Reddy, he's been like a forefather for all of us, the entire industry. Given the fact that two very important pieces have emerged. Number one, health is now no longer just healthcare, but it's part of a larger ecosystem which is affected by climate change, social security issues, housing, infrastructure. There are so many different elements to it. When you see, as Dr. Trehan said, the exponential rise and need of beds, do you see the way healthcare as an industry, I hate to use the word because it is not a business, it's a social good that people are providing. Do you see there will be a change in the way we deliver healthcare from its traditional hospital-based, or do you see it more and more in preventive health, behavioral change, and people's homes? Where do you see this going? Over to you, Sunita.
Thank you, Shabnam. So let me use the word change as a fulcrum for this conversation. If we look at, and usually when you have these deep conversations, I want to go back to the beginning where we started from, because that defines who we are. So we've actually evolved from a single cell organism to a multi-organ human being that has the ability to think, that has consciousness, And more important, it has the ability to adapt. And that's who we are as human beings. But beyond that, if you think of the history of mankind, the anthropology of mankind, the difference between us and a chimpanzee is a delta of 1.86%. What does that delta represent? It represents the best of human beings in the ability to be smart and adapt. And that probably is the genesis of how we've progressed, of how we think of new technology, and how India maybe stays ahead in terms of cutting-edge technology and becomes ahead of the world. As part of this process, let me go back to 45 years ago when my father came to India. And later on, Dr. Trehan and Devi Shetty, all of them started these organizations. Here were 3 doctors, a trifecta of technology, skills, infrastructure that changed the human dynamics and how we measured. So life expectancy at that time was 56. Today, 40 years later, it's 75 in the urban cities. Infant mortality is improved by a factor of 4. Maternal mortality is improved by a factor of 10. Now, it's not easy to improve these indices, but they did this by, what India really did well at that time was an innovation and process innovation. We became low cost. We were 1/10 of international cost. And with this, 80% of the Indians who were going abroad for treatment started coming back, stayed in India. And beyond that, people from 140 different countries came to India. So this was process innovation, best-in-class process innovation that extended life expectancy. And that, I think, is, the first step. We are now ready for the second step. And in doing so, we're working with the government. Dr. Trehan mentioned what, a part of what we're doing, but I'd really like to extend it to the next level, because our Honorable Minister Anupriya Patel is not here to speak on behalf of the government. But the government by itself has done a remarkable job. All of us only, we know about Ayushman Bharat, but there are 79 crore ABBA IDs that have been created. They are just taking what Aadhaar has done. No other country in the world has been able to establish a system where everyone has a unique identification, a single window, unique identification process. And that's what UHEI has done. Today we have 750 million UHID identifications for people across India. And added to that, we have 250 million patient records. So you can see the potential for the transformation that will happen in the future using this pipeline, that is the digital pipeline that has already been established in this country. It is a tremendous foundation for growth. If you add this layer of AI on top of that, I think it is the ability to leverage the intellectual property that, that you find in the urban cities, that you find in a Medanta and in Apollo, in so many other, in AIIMS, in so many other places, we're able to leverage this using digital technology. So I also want to bring in, at this time, because India has always, we are the NCD capital of the world. We are more prone to heart attacks, and Dr. Trehan knows that much better than I do. But definitely cancer, growing at 18%, cardiac, the susceptibility to all this, it is actually the perfect storm to create an insurance system that protects Indians, that provides access, that cuts waiting time, and make sure that we have heterogeneous care. So this is an area that Apollo has studied deeply, that Indians are different from the rest of the world. So when you look at different markers, it's not one size fits all. In fact, even in India, every state is so different. But if you look at our ability to understand, the cardiac space, we have worked and its population. And then I think the next step is to really leverage this across what the government has built, which is the digital platform. And I think that with this, we'll be able to do, the next level of keeping people healthy, making sure that we catch diabetics, which you catch it very early so that we're able to make sure. This is what AI can currently do. And I think there is so much more that we can do. I really want to end by saying I'm really happy that we have a Japanese delegation with us today. We have much to learn from Japan, and I think the rest of the world has much to learn from India. India's integration with Ayurveda is going to change the way we look at preventive healthcare and chronic disease. And I think our learning from Japan, your creation of blue zones where people live to, live for 100 years, and they do so with the spirit of Ikigai, which is really understanding the purpose and meaning of life. It's life extension at its very best. So thank you for inviting me here. I think, while we're in a perfect storm, we also have the ability to provide a perfect solution. Thank you.
Thank you. Thank you, Sunita, for those very encouraging words. The ability to think before an individual thinks. He thought of a phone in your hand which would connect you and tell you everything about yourself even before you could feel it. So today everybody is inseparable from their phones. That's the bottom line. So going by what Sunita said as far as the digital world is concerned, and you see where India, with the largest population of data scientists, English speaking, in the first phase of artificial intelligence, while we service the world, did things for the rest of the world. The GCCs are very much there as evidence of our prowess in that. If you were to see AI, Kenji-san, in the second phase, moving forward from generative AI, into the application phase, given by what Sunita said, 250 million digital data points that we have, the complexity, the geography, your experience in this, and how should India leverage both our strengths to move forward?
Great. That's a very fundamental question. But before answering your question, I just want to say that I'm so excited to be back here. Yeah, because thanks to the CII Health team, Dr. Shin, Dr. Teran, sitting all of you here. I was invited last year, and then CII delegation came to Japan this April. And we had huge success thanks to the passion of an Indian counterpart. So that really motivated the Japanese companies. And today, I'm happy to say that more than nearly 60 representatives from Japanese companies and government institutions here with us. So we have to be very proud of this. So this is not a coincidence. I think this is a momentum for us to work together. And one more thing, update from Japan is that we have a first female prime minister finally, which is great, no? Now, female first prime minister, Sane Takaichi, has reaffirmed the importance of free and open Indo-Pacific initiative. It's as a cornerstone of the Japanese foreign policy. So it is reflected by the passion and vision of Prime Minister Abe. And probably some of you may remember that when Prime Minister Abe was here in Delhi, he emphasized the importance of confluence of the two seas. So we have a Pacific Ocean, we have an Indian Ocean, two big seas. These two seas are coming together to set a broader Asia. And India and Japan are located on the edges of this confluence of the two seas. And now, Japanese new Prime Minister emphasized that AI, bioinnovation, and healthcare are no longer just about well-being. They are pillars of prosperity, and Dr. Singh mentioned ikigai, and more importantly, economic security. So, answering your AI question about the message from Japan on how we are going to use it. So just I'm thinking about what Japan has done for the past couple of years, but first of all, I think it's extremely important to balance innovation with governance through soft law flexibility. So AI is a driver of growth and social problem solving, but at the time, strict and too rigid guideline would damage the process. Of course, we need to have a very proper governance, but we need to have some flexibility. And secondly, I'd like to touch upon some of the issues which Dr. Reddy mentioned about the Japanese strengths and India's strengths as well. So I think it's extremely important for particularly both ends, in particular for working on AI machinery, on hospital care. I think integrating Japanese precision medical AI with India's digital health ecosystem would be the way to go. For example, we have a very good preventive healthcare system and cancer diagnostic, and you have fantastic ventures ecosystem, and working together will make a huge difference. And I'm thinking about expanding MEJ's activity not just in India, working with India and to go to Middle East or Africa together, because there are huge needs there. So I'm seeing the future of the very bright South-South collaboration in this space, and India and Japan should play a very important role. And also, I'm a big fan of Ayurveda, seriously. I came to Kerala. I went to Sri Lanka sometimes for staying in Ayurvedic clinic for a couple of weeks because I need to detox from daily stresses. But it works. And I think I'm hoping, and I'm asking my companies and staff that expanding Japanese experience in health screening and early detection is great. But integrating AI-based preventive system with India's traditional knowledge, such as Ayurveda, would be very, very beneficial. Because think about the GLP-1. That drug shows that it's not just obesity. It's all about chronic inflammation, right? Chronic inflammation, you cannot tackle chronic inflammation by just treating one piece of science or just focusing on organs. We need to look at whole system of body and mind. That's what Indian Ayurvedic approach tells us. And now we have tools. So what we need to ask the patient is not like, what's the matter with you? But more about what matters to you? What matters to in your life? And this is why we are using the power of AI or recent technology to help them out, to make their life better than now, particularly for those who are disadvantaged. That's why we are here today, and I'm hoping that India and Japan have a very good position to do that together. So I will stop here. Thank you.
Thank you so much all for setting the tone beautifully for what promises to be a very wonderful day. Over to you, Amita.
Come to the close of this opening session. It's my pleasure that today we, as a joint commitment to forge collaborative ties between India and Japan, CII and MEJ have today expanded into a robust partnership framework, and we would be exchanging a tripartite MOU between CII, MEJ, and IRIA. May I call Dr. Takayuki up on the dais as well, and we will have a very short exchange of MOUs, marking a new chapter of collaboration in healthcare technology, policy research, and capacity building across the Indo-Pacific. request everyone for a photo opportunity coming right ahead, and as we mark the beginning of a structured beginning of this entire relationship. Sunita, Dr. Trihan, please kindly open and show the MOU. Little bit of token of our appreciation. May we request Dr. Trihan as chairman to hand over the gifts to everybody who's joined us. There is a little gift in the bag as well, is what I presume. Thank you very much, Sunita, for flying in. Of course, to Dr. Kenji. Shabnam, to always be the person to go to if things start going wrong, and even if they are going right. Yeah. Thank you very much. We go to a very exciting session of showcasing Japanese innovations in healthcare.
Thank you very much indeed, ma'am, and a huge round of applause, ladies and gentlemen, for all our dignitaries for that wonderful start to the summit. And we now move ahead to the next session, which is the second MEJ India seminar showcasing the Japan healthcare innovations. This session will be moderated by Dr. Shabnam Singh, Principal Advisor, Healthcare, CII. Once again, a warm welcome to you, ma'am. Also requesting Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan, to kindly stay back with us for the next session. And inviting on stage Dr. Takayuki Yamanaka, Economic Research Institute for ASEAN and East Asia area, and Mr. Takashi Ariyoshi, Minister and Deputy Chief of Mission, Embassy of Japan in India. So, ladies and gentlemen, warm welcome to the next segment of the summit, the second MEJ India seminar, which is titled Showcasing Japan Healthcare Innovation, and also has some business presentations. This session is a testament to the growing India-Japan collaboration in healthcare, where innovation, technology, and advanced medical solutions converge to address the real-world challenges and to enable accessible, efficient, and high-quality care. To moderate this seminar, we are privileged to have with us Dr. Shabnam Singh, Principal Advisor, Healthcare, CII. A warm welcome to you, ma'am. Inviting Dr. Takayuki Yamanaka, Chief Operating Officer, Economic Research Institute for ASEAN and East Asia, Mr. Takashi Ariyoshi, Minister and Deputy Chief of Mission, Embassy of Japan in India, and Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan. And may I hand over I now hand over to Dr. Shabnam Singh, Principal Advisor, Healthcare, CII, who is a respected leader with over 4 decades of experience in hospital strategy, healthcare and transformation, and clinical governance, to kindly take over the proceedings of the session. Over to you, ma'am.
Thank you. So I think the tone was very well set by our seniors, and a very, very warm welcome. Good morning, all my colleagues in the audience and our guests from Japan here. So I think we are all gathered here together today for one purpose, and that is to push the boundaries of healthcare. And that is with a combined goal that it has to be done in a meaningful manner. And I think Kenji-san, in his opening remarks, when he brought out Ayurveda, Sunita brought out the beauty of the Ikigai system in Japan, and Dr. Trehan showed the potential that we have here. If you look at the kind of transformation healthcare is undergoing just now, it's unprecedented the way there is a convergence of ideas. Not only is there a convergence of ideas, but its global transformation and sharing of information is an extremely important part. And for that to happen, for you to share something with somebody, the principal point there is, do you trust that somebody? And I think over the years, we have been exceedingly fortunate to have that trust-based relationship with Japan evolving. And for us, it would be a moment to lose if we do not use this trust-based relationship to have a meaningful solution. As Dr. Trehan pointed out, challenges in healthcare are not unique, or it is not limited to a particular country. It is global in nature. So if we have that perspective of a fabulous trust-based relationship, meaning to service humanity, I think the future definitely looks very bright. So we are exceedingly grateful for you being with us, and we hope it will be meaningful as much as it is for us too.
Thank you very much indeed, ma'am, for that wonderful start to this session. I now invite for the opening remarks Dr. Takayuki Yamanaka, Chief Operating Officer, Economic Research Institute for ASEAN and East Asia, who is an influential leader working at the interaction of research policy and economic cooperation across the India-Pacific region, for the opening remarks. Let's put our hands together to welcome sir.
Thank you. Your Excellencies, distinguished guests, ladies and gentlemen, good morning. My name is Takayuki Yamanaka, and I serve as the Chief Operating Officer at the Economic Research Institute for ASEAN and East Asia area. On behalf of area, I'd like to express my sincere gratitude to the Confederation of Indian Industry for your invaluable support and continued partnerships. As institutional partners, CII and area have been working together to advance economic integration and promote inclusive and sustainable development across the region. I'd like to also extend our appreciation to Dr. Kenji Shibuya and the delegation from Medical Excellence Japan, MEJ, for their invaluable work in making this event possible. I'm grateful to all the speakers and the participants for this unique opportunity of mutual learning and knowledge sharing that focuses on cross-border collaboration and partnerships in the medical and healthcare sectors. AREA is an institutional research organization and a policy think tank headquartered in Jakarta, Indonesia. We work closely with ASEAN Secretariat, governmental agencies, and research institutions across Asia to provide innovative research and policy recommendations. Over the past few years, in partnership with Government of Japan and MEJ, area has been fostering a unique multi-sectoral and action-driven initiative called Medical Excellence in Asia, MEXX. Signing of the tripartite MOU between CII, MEJ, and area this morning is a testament to our championing efforts and shared commitment to fostering an inclusive and sustainable health system in India and across Asia. We are immensely grateful and delighted to be part of this special occasion to celebrate the commencement of our strategic collaboration to enhance and strengthen healthcare industry in the region, particularly through public-private partnerships with primary focus on health and well-being. Area believes that healthcare is an opportunity for growth and a driver for innovation. We envision a world in which all people will be able to gain access to safe, effective, and quality healthcare services, and ultimately improve the quality of their lives. I truly hope today's second Medical Excellence India seminar under the regional initiative will be a stepping stone to a healthier future and robust healthcare industry development in India, Japan, and beyond. Once again, my sincere gratitude to all distinguished speakers and participants for your contributions to this meaningful agenda. I wish you all a successful and fruitful session. Thank you very much.
Thank you so much. May I now invite Ms. Prabjot Kaur, Project Manager, Karna Medical Database, to present, please. May we have the presentation?
Right. Sorry. Thank you. Right. Good morning, everyone. Esteemed guests and industry leaders. I am truly honored to be here today, and I'm grateful for the opportunity to introduce my company and its products. My name is Prabjot Kaur, and I represent Karna Medical Database Private Limited. At Karna Medical, we provide data-driven solutions, regulatory support, and market entry services to facilitate the introduction of unique and innovative Japanese medical and food products in the Indian market. We are proud to be part of Konoike Group. While Konoike Group operates 6 companies across diverse industries, Karna Medical focuses exclusively on advancing efficiency and innovation in the medical sector. I am especially excited to introduce products from Asahi Kasei Medical, a company that holds the highest market share of apheresis machines in Japan. Established in July 1974, Asahi Kasei has been at the forefront of developing, manufacturing, and marketing innovative medical devices with the current market share of 3 billion yen. We are proud to be the first company to introduce complete range of DFPP treatment, including plasma flow OP, cascade flow EC, they are both type of apheresis filters, Plazoto, CRRT and apheresis machine, and cassette tubing set. In Japan, apheresis is a major treatment, and DFPP is widely used for treatment of 28 diseases, including intractable diseases. We plan to introduce DFPP filters and apheresis machines as a new therapeutic treatment option in nephrology, cardiology, and neurology departments. As mentioned earlier, we are the first company to offer a complete DFPP solution. The benefits of using DFPP include improved therapeutic efficiency, reduced treatment risk, and most importantly, the introduction of an alternate therapy using advanced Japanese technology without side effects of associated drug therapies. To end, please visit our booth for more detailed discussion about our products. Thank you, everyone, for your attention. Thank you very much.
Thank you, Prabjot, for keeping it short. And I'd urge everybody to interact at the booth with you.
Thank you so much.
May we invite Mr. Hitesh Mehta, CEO, SPD India Healthcare Private Limited next. Hello, Hitesh.
Hello. Good morning, everyone. First, I want to thank CII and MEJ for this opportunity. My name is Hitesh Mehta. I am CEO, SPD India Healthcare Private Limited. We established in year 2017, and we provide comprehensive sterilization solutions for hospitals, both government and private sectors. We are India's first company to start an off-site sterilization center in Delhi and currently empaneled with 150 plus hospitals with sole objective to improve quality of sterilization services and uplifting the sterilization practices in India. With reduced HAI, the length of stay of the patient is reduced and improves the quality of healthcare delivery. This is the sole objective of SPD India. In year 2024, we joined Konoike Group with a group with a legacy of 140 plus years and have 30 years of market experience in establishing outsourced sterilization in Japan with 1,000 plus hospitals. Once again, I want to use this platform to initiate a discussion with hospitals, both government and private sectors, where we can discuss about collaboration to achieve a common goal, that is upliftment of healthcare delivery system. Thank you.
Thank you, Hitesh. Next, we have Mr. Nakajima, Chief Executive Officer, CarbGem Inc. Welcome.
Good morning, everyone. Namaste, Sabi Ko Shibu Prabhat. My name is Masa Nakajima, CEO and co-founder of CarbGem. This is a healthcare AI startup from Japan. It's a great honor to be here to introduce how Japan and India can co-create innovation in healthcare through AI, cloud, and collaboration. CarbGem was founded in 2021 in Tokyo. Our mission is to make healthcare and research more efficient, standardized, and connected across borders. A product obtained approval from Japan PMDA, so our technology is being tested under Japan's strict regulatory standards for clinical usages. We believe this credibility and technical foundation can help accelerate healthcare transformation not only in Japan, but also globally, especially here in India. Let me start with the first product. This is Bitte, i.e. This is an AI software that automates ground staining processes, which is very important, but labor-intensive and experience-dependent steps in the infectious disease ID diagnostic processes. Traditionally, this task requires experienced and professional microbiologists, but our system makes it faster, easier, and affordable. We know more than a few million people have been died everywhere because of ID, infectious disease, only in India every year. But taking just a picture by using a smartphone, we can identify the bacteria and recommend the antibiotics within 10 seconds turnaround time for less than $1 expense. The next innovation is Carb Connect. This is a secure, cloud-based, browser-based platform where professionals can upload, share, and analyze images by using our built-in AI applications. on this platform, we can also easily create training datasets for AI developed and AI modeling and deploy and go to market quickly. We are trying to develop as many AI applications as possible with like-minded partners and deploy go-to-market. So looking ahead, we are very eager to partner with Indian companies and institutions. India has world-class engineers, scientists, and dynamic healthcare ecosystems. So together we can co-develop AI applications, run pilot projects in India, and build Made in India AI. So we are very much looking forward to collaborating with many of you during this event and beyond. This is the contact information, so please feel free to reach us anytime for collaborations. Thank you very much.
Thank you. May I now invite Ms. Makiko, General Manager, B. Medical Inc. Welcome.
It's great honor for me to be here. Thank you for inviting us. I am Makiko Taketani, General Manager of B. Medical. And B. Medical is a medical startup company. As you know, it's founded in Tokyo in 2017 with core mission of proton for everyone. So proton therapy is a kind of radiation cancer therapy. It offers superior tumor targeting while minimizing the damages on the healthy tissues. And it's backed by decades of clinical results. Yet millions of people, patients who need this treatment, cannot have access to this treatment. The barriers are clear. The huge capital cost for the hospital, usually it's about 85 to 100 million US dollars, arising from the size of the conventional system. B. Medical will break this status quo. We are spun out of National Institute of Radiological Science in Japan, and our president got the Minister's Award for his scanning technology, and we bridge this technological expertise into our product. Our product tackles two major market pain points. Number one, the size of the equipment. Our proprietary magnetic gantry is based on superconducting technology and successfully reduced the height from 12 meters to 4 meters. It's 1/3, and the result is a significant reduction in construction cost. And number two, efficiency. We made the moving treatment couch, and we came up with a totally new, brand new workflow that can treat double the number of customers, patients. We can treat 2 times more patients in the same room. The result is very compelling economics for the hospitals, and our payback period is half of the conventional ones. Our solution got the traction already. We got approval from Japanese government, and we got the firm order from a hospital in Tokyo, and we are actively negotiating in our key markets. Our business model is structured for sustained growth. The long-term maintenance contract is of a strategic advantage, and that ensures further investment into our technology. And our unique strategy is secured by robust IP portfolio around the world. So I'm here to connect with you, people in India. We are searching for investors and also the business partners. If our vision about this life-saving technology resonates, if it resonates with you, then I'd be very happy to connect with you. Thank you.
Thank you. I can see from the number of screenshots being taken, there'll be plenty coming to your booth. May I invite Mr. Jagjit Singh now, please, Managing Director, DigiReha India Private Limited. Over to you.
Good morning, everyone. Excellencies and distinguished guests. Thank you. Yeah. So it's an honor to be here today, representing DigiReha, Japan-born health tech company that began in Tokyo 2021, and today operates in Japan, of course, India, and the USA. Our story did not begin in the boardroom. It began in the therapy room. In Japan, a young girl with muscular dystrophy used to cry during her therapy session. Our CEO, Yukioka, saw that and said, let's make therapy fun so kids smile while getting better. That simple thought changed everything. In March 2024, I was in Japan and I saw a little boy, maybe around 5 years of age, struggling to lift his arm during physiotherapy. His mother sat beside him. After minutes of efforts, he managed to lift it, but a few inches. But in that moment, his eyes lit up, mother smiled, a therapist clapped. That small moment meant what? Hope, progress, possibility. As I left that room, I thought this technology must reach my country. And that's how DigiReha India began. So elephant in the room is, across India, what I've realized is thousands of children never get the chance. Therapists are few, mostly in big cities. Parents feel lost, and children, especially children with special needs. Last year, through MEJ, we began a small pilot project with 15 special schools of Delhi, Bangalore, and Pune. And that small step has now become a movement for inclusion and early childhood development. Together with CII this year and UNICEF, we conducted sessions on inclusive early childhood development. We also partnered with Special Olympics Bharat to bring digital rehabilitation to children and athletes for intellectual disabilities or capacity building program. And this year, we launched India's first DigiReha studio at Yashoda Hospital, Ghaziabad, inaugurated by Dr. Malika Nadda, Chairperson, Special Olympics Bharat, a space where technology, compassion, and care comes together. We also pitched our idea to Apollo Hyderabad, and we are positive that we'll be joining hands with them soon. And let's make inclusion not just a goal, but the way, because together we can help every child move, one small step, one joyful play, one DigiReha at a time. Thank you so much, everyone.
Thank you. May I now invite Mr. Kanazawa, Managing Director, Asia Pacific Region, Cyberdyne Inc.
Good morning, everyone. I'm Norio from the Cyberdyne. Today, so they relate the scope of this meeting. So I want to introduce our product, hybrid assisted limb. Okay, so this is the technology. I want to go through very quickly, and if you are interested in, please come to our booth. And now this is the normal people's let's say the brain signal, the network. Once so the people think the move, the brain will be sending the signal to target the muscle. But with some damage by stroke or the spinal cord injury, the nerve system will have the damage. That kind of signal cannot come to the target muscle. That's the reason why so some disabled person, they cannot move by even their intention to move. With this, we found out that we developed the technology to capture the very small signal from the surface of the skin, the intention to move. Then the capture about the signal, how our system can support the patient to movement. So this is the technology. And according to the target parts of the people, patient, we divided the three type of the how. The system is the technology is the same, but the lower limb and the single joint and also lumbar type, according to the target part of body, and also the couple of the size. Okay, so this is our technology. Please come to our booth. And also the last thing, so we don't believe the one single company can contribute everything. With this, so we decided to invest 30 plus the small startup company, not only money, but also there's some technology and also experience. If in future you are interested in that kind of technology field, we are happy to connect in future. Thank you very much.
Mr. Kotaro Ando, co-founder and CSO, I'm Beside You, Inc.
Namaste, everyone. One quick question. How many of you feel stressed daily? Okay. Have you ever talked to an LLM about how mentally exhausted you are? No. Okay. So a little bit about my background. I am a severe depression in the past, and unfortunately, I'm a suicide survivor. And at that time, I needed to help and monitor myself, so built AI. And I wanted to introduce that we are providing our AI solution, which helped me to enhancing the students' mental health through AI. So a little bit about background. We are tackling that stigma and the fact that lots of suicide commitments happened in India across the top universities. So we made a solution that create apps the students can talk and also monitor their mental states, which is scientifically proven. And then we also combined our clinic, which is an Indian therapist, and support together to the user. We started our activity in this March, and within 6 months, we expand 50+ universities, and we see the huge demands here. And we saved 16 lives, which is severe. And why we are now providing as a Japanese startup, we have a strong partnership with IIT Hyderabad, Professor Mahati, and also we have a collaboration with Japanese therapists, also provide the care along with the Indian therapists, and we saw the effectiveness. Yes, so the personalized cultural sensitivity with the AI. We provide not only Japan, India, and also US. Thank you for listening us, and then please come to our booth. Thank you.
Thank you. May I now invite Mr. Yasushiro, Regenerative Medicine Business Department, Biometric Sympathies, Inc. Over to you.
Hello, namaste everyone. My name is Yasuhiro Nose. I'm a scientist from the company named Biomimetic Sympathies, BMS for short, from Japan. Our company, BMS, is a pioneer in the field of regenerative medicine. Actually, we are the first one to confirm or establish the technology named AOF, Animal Origin Free. That means, the products of the cell culture medium, stem cells, and the supernatant free from infectious viruses and proteins, and also free from animal allergies. And we established the very first clinic in Japan focusing on the regenerative medicine. So we have given patients 3,000 stem cell therapies. Not only stem cells, but also supernatant is safe and very effective. So now many clinics in Japan adopt our supernatant. So now they are giving patients 4 million shots and without any severe adverse events. So if you are interested in the state-of-the-art regenerative medicine, then please come to me, and I'm happy to collaborate with you. Thank you.
Thank you. And our last company to be represented by Mr. Mito, Chief Executive Officer, Toa Optics Company Limited. Over to you, sir.
Hi, everyone. I'm Mito from Japanese startup company producing a diagnostic device for lymphoedema. The lymphoedema is progressive swelling of the extremity that is irreversible and very severe. It happens 30% of the after gynecologic cancer treatment patient. And this lymphoedema is not just a chronic swelling, but it makes severe deformity of extremity, so it destroys patient's quality of life. A long-lasting pain or cellulitis resulted in hospitalization and destroys self-image patient itself and social isolation, and many patients cannot work as before. So stop this swelling, surgeons perform some bypass surgery. And for this surgery, our device is needed. Surgeons can know where to cut or where the lymphatic flow is stacked. There's some existing product already, but they are all expensive and heavy and large. So we aimed at L&D about this ICZ imaging technology and achieved high signal noise ratio imaging using optical system optimization. So this is our comparison of our products and existing products without sacrificing the quality of imaging. 10% of size, weight, and price we can achieve. The why compact and affordable matters is here. So this is a staging photograph of lymphedema. As I mentioned before, this lymphedema is very progressive and irreversible. So it is said that early staging surgery is most effective for these patients. So the camera device is more lower and more portable. The device make the diagnostic barriers lower. So we start making this device 14 years, and many surgeons is attractive. And so far, 24 countries are using this device as an experimental. So we are now thinking about going to this Indian market, so looking for some distributors. Thank you.
Thank you. With that, may I turn to the Minister and Deputy Chief of Mission or Embassy of Japan, Mr. Takashi, for his closing remarks, please.
Good morning, ladies and gentlemen. I would like to express my gratitude to Shibuya-san and Yamanaka-san for bringing such an excellent Japanese company together today for this 22nd CII Summit today. I'm so impressed to see excellent presentations. Japan and India share fundamental values such as democracy, market economies, and the rule of law, and both countries have collaborated as important partners across numerous fields. And within the domain of healthcare, various companies are already active in both nations to enhance public healthcare. However, given India's substantial human resources, manufacturing capabilities, and cutting-edge IT skills, alongside with Japan's technological prowess and extensive expertise in healthcare and service senior care, I believe there is considerable scope for even greater, deeper, and more diverse collaboration and cooperation. Today marks a memorable occasion within the signaling of MOU between the area MEJ and CII. It represents a commitment to actively improve healthcare systems and services, strengthen economic and commercial cooperation, and promote the development of medical sector between our countries through public-private collaboration. Today, over 20 Japanese companies are participating, in addition to the 8 presented earlier. Each possesses extensive expertise, innovation, and outstanding technology, holding significant potential to impact the healthcare environment, and is actively seeking partners in India. So let us make this summit a place to foster deeper, more meaningful partnership that leads to sustainable growth and improved healthcare for all, not only India, but also beyond, including Africa, as Shibuya-san mentioned. So thank you very much for your attention, and I really look forward to fruitful exchanges and collaboration emerging from today's event. Thank you very much.
Thank you. Thank you, sir. With this, we move in, we close the session and we move into the next one, please.
Thank you very much indeed. Close this session. Ladies and gentlemen, Honorable Minister Sir is here, and we will be straight away moving into the next session, which is a special plenary session on the care, equality, and CMD Medanta, the Medicity, Ms. Sunita Reddy, Managing Director, Apollo Hospitals, and our distinguished moderator for this session, Ms. Amita Sarkar, Deputy Director General, Confederation of Indian Industry. Ladies and gentlemen, a very warm welcome to this special plenary session on Care Economy Ka Naya Daur, empowering the senior care, and I hand over to Ms. Amita Sarkar, Deputy Director CII, to kindly take over the proceedings of this session. Over to you, ma'am.
Yeah, may I request everyone to please settle down? Just to say that alongside the main healthcare summit, we are also organizing a series of discussions on senior care. While this is the inaugural of the senior care seminar, the discussions are going on in one floor below this. So those of you who are really interested in the subject may join the discussions there. We welcome a very, very hearty welcome to Dr. Jitendra Singh, the Union Minister of State Independent in Charge for Science and Technology and Earth Sciences, Minister of State in PMO, Minister of State in the Department of Atomic Energy and Space, and also Minister of State for Personnel, Public Grievances and Pensions of India, a trained doctor himself, diabetes specialist, and of course he's extremely passionate about healthcare, and we are fortunate that he always comes for the CII Healthcare Summit. Let's give him a big hand, ladies and gentlemen. Dr. Vinod Paul.
There are 11 million plus
Ladies and gentlemen, let's put our hands together to welcome on stage our guest of honor, Ms. Punya S. Srivastava, Honorable Secretary, Ministry of Health and Family Welfare, Government of India. We once again welcome on stage Dr. Vinod K. Paul, Honorable Member, Niti Aayog, our distinguished moderator for this session, Dr. Randeep Guleria, Chairperson, Steering Group, CII Center for Health, Chairman, Internal Medicine, Respiratory and Sleep Medicine, Medanta, the Medicity, Dr. Naresh Trehan, Chairman, CII Steering Group on Health and Healthcare Council, and CMD, Medanta, the Medicity, Mr. Shikhar Malhotra, CEO and Vice Chairman, HCL Healthcare, and Mr. Special guests, distinguished speakers, ladies and gentlemen. It is an honor to welcome you all to plenary session 1 of the 22nd CII Annual Healthcare Summit, which is titled Living Longer and Healthier, Role of Policy and Innovation. And ladies and gentlemen, we are privileged to have this session chaired and moderated by Dr. Randeep Guleria, who is a distinguished clinician and one of India's foremost experts in respiratory medicine and critical care, is a respected thought leader and has played a pivotal role in shaping national health discourse. And I have the pleasure of inviting our first speaker for the special remarks, Dr. Vinod K. Paul, Member, Niti Aayog, who is a driving force behind India's landmark healthcare reforms, including Ayushman Bharat, strengthening health systems and building a preventive care ecosystem. Let's put our hands together to welcome Dr. Paul for the special remarks. He's not here. Ladies and gentlemen, we have the privilege of having here with us Ms. Punya S. Srivastava, Honorable Secretary, Ministry of Health and Family Welfare, Government of India, who is steering India's national health programs with a strong focus on digital health, preventive care, and system efficiency. Please join me in welcoming ma'am for the special remarks with a round of applause.
So, dignitaries on the dais and dear delegates, a good afternoon and namaskar to all of you. Since today's discussion is on the role of policy, that is the part that I would like to focus on in my remarks to you. So if we trace the arc of India's health journey since independence, it is a story of our collective courage, effort, and the quiet transformation from a nation which was battling epidemics and malnutrition to one which is now building the world's largest digital and preventive health ecosystem. So we began in this country, as many of you would be aware, with the basics: eradicating polio, expanding immunization, saving mothers and newborns. And the results speak for themselves. The life expectancy has risen from 59 years in 1990 to nearly 71 years today. And what I'm happy about is longevity alone is not the goal anymore. The question before us today is deeper. How do we ensure that every added year is lived in good health with dignity, productivity, and purpose? And this, I believe, is the true measure of national progress and what our vision of Viksit Bharat is. What has been pivotal has been our national health policy of 2017, which turned the system from treating illness to creating wellness. And I'm sure many of you have gone through it, but it basically envisioned a preventive, promotive, and participatory healthcare which is accessible, affordable, and equitable. And this vision was crystallized through what we call the Ayushman Bharat concept. And the reason I'm mentioning Ayushman Bharat is that Many of us think that Ayushman Bharat just refers to the Pradhan Mantri Ayushman Bharat Yojana, which many hospitals are participating in. But basically, the concept of Ayushman Bharat rests on 4 pillars, and which is why I mention it in many of my deliberations, even in the CII. One pillar is the comprehensive primary health care through our 1.8 lakh health and wellness centers, the Ayushman Arogya Mandirs. The second part, which refers to your topic as well, is the financial protection to the citizens through the Pradhan Mantri Jan Arogya Yojana. The third part is the Ayushman Bharat Digital Mission, which is the digital empowerment, which I have requested all CII members to be a part of. And the fourth part is the resilient infrastructure through the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. And together, in my view, in our view, these pillars represent not incremental reform, but a complete reimagination of the public health in this world's most populous nation. And behind these systems are millions of quiet success stories. Our ASHA workers, our ANMs and health workers who have brought health and hope to every village and city. And this is something I realize every time I go to remote parts of the country and visit the health and wellness centers. Not only are our health workers ready to do, but they are using virtual assessment tools to assess where they are and where they need to go, whether it is in terms of the National Quality Assurance Standards or in terms of Indian public health standards. One of the stories that reflects this transformation is the maternal and child health. India has achieved 86% reduction in maternal mortality since 1990, double the global average. Our under 5 mortality has also fallen, neonatal mortality has also fallen, and it is digital innovations like UWIN, which now track nearly 13 crore beneficiaries and around 60 crore vaccination doses, ensuring full immunization coverage of nearly 98%. Many of you would have used the CoWIN app during the COVID, and it is this CoWIN app which we have now converted into the UWIN app, which is helping us track all kinds of immunization. At our Ayushman Arogya Mandir, the 1.8 lakh which we have, we are redefining primary health care by providing screening in addition to treatment, yoga, physiotherapy, nutrition counseling and wellness session. And the numbers have increased tremendously. The footfall in these Ayushman Arogya Mandirs, whether it is 3.87 crore citizens for hypertension, similar number for diabetes, screenings of over 55 crores for cancers, oral, breast and cervical. These are all, each and every screener I feel is a quiet act of prevention, a step towards living healthier and not merely longer. And with each doorstep visit, with each wellness session, it moves us closer to the dream of a Swasth Bharat. Many of you, at least CII, did participate in the Swasth Nari Sashakt Parivar Abhiyan, which was actually manned by these, to a large extent, by our Ayushman Arogya Mandirs. And we had been able to organize around 19.7 lakh camps with a footfall of over 11 crore, which shows that the awareness of the average citizen towards wellness, towards screening is growing. And I'm only mentioning the 3 Guinness Health Records because it shows that we are committed. There could have been many more, but we restricted ourselves to 3 just to display the commitment of the country as a whole towards this task of living healthier and living longer. Many of you are aware of the financial protection, the health assurance for every family that the Pradhan Mantri Jan Arogya Yojana has provided. And till today, the scheme has supported 10.5 crore hospitalization and over 1.52 lakh crores in claims have been disbursed, with nearly 50% being of women, which again brings in the issue of gender equity in access to care. And this reinforces our earlier commitment, that is Swasth Nari. If you have a healthy family, you will have an empowered family, and we will contribute to living longer and healthier. We've also expanded this scheme. I think the previous session was on healthy aging, but in terms of care, it has been extended to all citizens above the age of 70, regardless of their socio-economic status. The great part about Pradhan Mantri Jan Arogya Yojana and the digital platform on which it runs is that it also provides portability in healthcare. And this really benefits the migrant labor of our country, because regardless of the city they go to, they can avail of the benefit under the scheme. Under the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which is a 64,000 crore scheme, we are not just strengthening the health and wellness centers, but we are basically targeting a resilient health system which is geared towards pandemic preparedness, biosecurity preparedness, and emergency response. The fourth revolution is digital. As I mentioned earlier, the Ayushman Bharat Digital Mission has built the architecture of a connected, citizen-centric health ecosystems. Over 82 crore citizens now have the digital health ID, the Abha ID, with 77 crore health records linked to it, 4.3 lakh health facilities, and 7.2 lakh healthcare professionals have been onboarded. And let me tell you, if we want our citizens to live longer and healthier, it is again my request to all the delegates here that please do join the Ayushman Bharat Digital Mission. And we do have more than 350 entrepreneurs who have sandboxed their creations with Ayushman Bharat Digital Mission. The unified health interface which is being developed with METI will make health services as seamless as digital payments, and this is what we are targeting at the moment. Many of you may be aware of eSanjeevani, which is again at the heart of our digital care, India's teleconsultation platform that has crossed over 40 crore consultations. Through this, Dr. Guleria is here. Citizens from remote villages in Nagaland or the tribal belts in Chhattisgarh can speak to specialists in AIMS Delhi or PGI Chandigarh at no cost, no travel, no delay. This is what we are working towards, true health inclusion, where distance, geography, and income no longer decide who gets care. We have seen a lot of innovations in diagnostics, AI, and early detection here, and it is our belief that innovation is our new infrastructure. The AI-driven diagnostic devices are now even operating in our rural health centers. The clinical decision support system is supporting the HMIs there. ICMR, in collaboration with the innovators here, is bringing AI-enabled, open source AI-enabled X-rays to our TB Mukt Bharat Abhiyan. The Integrated Health Information Platform, the erstwhile IDSP, is now providing real-time disease surveillance in all 36 states and UTs. It is tracking 50+ epidemic-prone diseases with AI tools that flag early outbreaks. In 2024 alone, 2,300 potential outbreaks were detected and mitigated. So this is a powerful demonstration of how innovation safeguards live. I would request again, in case healthcare providers are here, please do join our integrated health information platform. As non-communicable diseases rise, we are simultaneously strengthening the fight against communicable diseases as well as non-communicable diseases. I've already spoken about what we are doing for screening NCDs at Ayushman Bharat Health Infrastructure Mission. In communicable diseases, the TB Mukt Bharat Abhiyan is going on. and we are bringing more and more advanced diagnostics to our healthcare facilities, and we are sure with your support we will move towards TB elimination. This dual focus on infection control and lifestyle disease prevention is, I think, what makes our health system holistic and future ready. You are all aware about the clarion call given by the Honorable Prime Minister, in which he mentioned that we need to cut the oil consumption by 10% in our diets, and I think preventive healthcare is the way forward. Under the FSSAI, we are doing Eat Right and Eat Smart India movement, but what was very supportive was the way CII and other stakeholders came forward to support this clarion call of Honorable PM. And I'm sure if the message goes, each and every citizen will become more aware about how to make themselves healthy and become an active participant in our movement for preventive health care. Right now, we are in the midst of a tobacco-free youth campaign. We have Mera Pledge, Mera Sehat initiative, which are inspiring millions of young Indians to take charge of their health. The school health and wellness ambassadors, the My Bharat volunteers, I'm mentioning these words because these are all initiatives where each and every youth is being involved. In the recent Swasth Nari Sashakt Parivar Abhiyan, over 1 lakh youth joined to become Nikshay Mitras, that is volunteers who will help provide psychosocial and nutritional support to TB patients. So this is the power of youth. Our school health and wellness ambassadors are spreading the message of fitness across our schools. Healthy aging has already been discussed in detail in the previous session, so I will not spend much time on that. But I would just like to draw your attention to the other aspect that our Honorable Prime Minister has been emphasizing, which is the inclusive vision of One Health. Our vision of One Health speaks of realizing that the ecosystem, the entire ecosystem is what we have to pay attention to, whether it is the environment, whether it is the animals, whether it is the plants, and this is what we are working on while combating antimicrobial resistance. We are about to launch next week our National Action Plan on AMR 2.0, and we do hope that all of you are active participants in this endeavor. So as we look ahead, the ministry sees CII and the Industry Association as indispensable partners in this mission. You have been coming forward for all our campaigns, whether it is TB Mukt Bharat Abhiyan or Swasth Nari Sashakt Parivar Abhiyan. We look to you to co-develop affordable diagnostic devices and indigenous technologies, invest in preventive infrastructure and digital innovation, design well-linked insurance products, and champion workplace wellness programs that protect our most valuable resource, our people. Together, I think government and industry can make wellness not a cost, but a national investment. By 2047, when India marks 100 years of independence, we envision a nation where health is not the absence of disease, but the presence of well-being, where policy is not measured by the hospital's built, but by the hospital beds empty, and where every citizen, urban or rural or in any remote part of the country, can access care anytime, anywhere. A system that is predictive, preventive, and participatory, powered by technology, and most importantly, driven by trust. My best wishes to all of you. I wish all of you live healthier and longer. Thank you.
Thank you very much indeed, ma'am, for sharing the government's vision for enabling a healthier, aging and proactive care systems. And ladies and gentlemen, we now move to the panel discussion, and I have the privilege in handing over to our distinguished chair and moderator of this session for the opening remarks and to lead the discussions, Dr. Randeep Guleria. Over to you, sir.
Thank you very much, and good afternoon to everybody. we have this session which is on living longer and healthier, the role of policy and innovations. And I'd like to start by really thanking the Honorable Secretary, Ms. Punya Srivastava, for a special address. We will have the concluding address by Dr. Vinod Paul and by Dr. Naresh Turain. I'll just set the tone of the discussion, and then I'll ask the other panelists, Mr. Shekhar and Shashank, to give their introductory talk and or their points, and then we'll have a panel discussion. So what I would really like to say is that longevity is rising, but health and life expectancy lags behind.
Clinical Establishment Conference.
Thank you very much.
Thank you. Sorry, I have one more conference. The state secretaries are there of clinical establishments, so I'll take your lead. Thank you. Thank you so much.
So as the Honorable Secretary said, life expectancy is increasing globally, and so is it in our own country. If you look at the time of independence, the average life expectancy of an Indian was around 32 years. That's gone up to more than 70 years now, as far as 2025 is concerned. But the issue is, are we also living healthy years? And if we look at the data, the number of years that we're spending as healthy years is much smaller than longevity. So it's not only about living longer, it's about living healthier and also living productively. And that's why we have this discussion on the triple helix, that is policy, insurance and innovations. How can all of this help us as a nation to live longer, live healthier, and live a productive life? And I think if we were to ask all of you in this hall, what would you mean by successful aging? Would it mean increasing lifespan, or would it mean increasing health span? I think most of you would actually want to have a better health span rather than a lifespan. So I think this is the key point as far as this panel discussion is concerned. The other important issue that I'd just like to stress upon is that the burden of disease in our country has changed dramatically. There was a very interesting paper published in the Lancet a few years ago, Nations Within a Nation, looking at the transition that happened in our country from 1990 to 2016. And the burden of disease now is shifted to non-communicable diseases. The bulk of the burden of disease is actually linked to diabetes, heart disease, cancers, chronic respiratory disease, chronic kidney diseases. These are all diseases which are actually happening because of urbanization, pollution, sedentary lifestyle. And therefore, if we are going to look at longevity and healthier living, we need to see how can we decrease the burden of disease which is linked to our lifestyle per se. And there have been a lot of policy frameworks by the Government of India. The Health Secretary mentioned that. The Ayushman Bharat, the National Program for Health Care of the Elderly, the National Policy for Senior Citizens. But I think more importantly, we need to look at it in a multi-sectorial manner. How can we involve urban planners? How can we involve the health sector or the insurance sector to really see that we have a healthier and productive life? So I'll stop here and I'll ask Mr. Shekhar Malhotra to give his opening remarks, and then Shashank.
Thank you, Dr. Galeria. I think it's a very prudent topic and panel, and I agree with many of your opening remarks and comments. I suppose the question is, do people want to live long or people want to live healthier? It depends on who you ask and at what stage in life they're at. So if you ask me, certainly I want to try to live healthier, and if you ask my grandmother, she may want to add a few more years to her life as well. So there's no right answer. Certainly both answers are extremely important. For a long time, and I think for good reasons, the way that India has unfolded over many years and decades is largely been a rainy day mindset. And that's rightly so because of the communicable diseases that we had in our past. And so the rainy day mindset was the systems were geared towards hospitals, insurance policies are geared towards hospitalization, but there has been a dramatic shift in the last, I'd say 5 years, and I think the trajectory that we're looking at, it's going to be a lot more towards prevention. I think it'll be really good for the panel to discuss today as to what does it take to move that needle. And the biggest obstacle there actually is not really systems, but it's mindset, in my experience, and the mindset to to incorporate new thinking, new systems, new people, new incentives, quite frankly, in order for that disease burden in India to significantly reduce and for the country to have a far more productive, economical, and a much more happier outlook to life as well. Thank you.
Thank you. Shashank.
Good afternoon. Thank you, Dr. Guleria. I think the discussion so far has very clearly laid it out that it's about health span. The unfortunate truth is that when it comes to health span, it's primary care and prevention that can lead to better health. Unfortunately, there are no incentives for this, to put it very crudely. And the simple reason for that is that prevention as well as primary care don't fit the current healthcare business models that are currently there. The current business models are around curative, and this also includes the insurance paradigm, because insurance, one would hope would solve for primary care and preventive, but their business model as well is built on premiums, which change as the costs go up. So there's really no, so there's really no incentive for any industry player today to reduce costs because it fits the business models of both insurance and curative. In which case, there needs to be a debate on what are the right business models for the primary care as well as for the preventive care, because these are the two industries which could actually help solve for the health span. So looking forward to the discussion today to address these two.
Thank you. Thank you for your opening comments. Let's start the panel discussion, and I'll ask the first question to Dr. Vinod Paul. What policy innovations do you foresee would be critical actually in transforming our own center that we have from what is an illness-based treatment model to one which is grounded in prevention and health promotion?
Thank you. Thank you very much. I think we heard very succinctly that healthy lifespan is about prevention. Primary prevention for disorder that we can primarily prevent, and this tomorrow could include influenza and pneumococcal vaccine to prevent these two major morbidities and so on. Secondary prevention, if there is an early detection of, say, osteoporosis, how do we handle? Or early detection of dementia, how do you handle, and so on. So primary prevention, secondary prevention, and so on is fundamentally important. Our current healthy life expectancy is 60 years. Life expectancy at birth, otherwise 71 years. We are at 60 years as healthy life expectancy. The goal for Viksit Bharat for life expectancy from 71 to 85 and for healthy life expectancy from 60 to 75. This is the journey that we are going to undertake, and we therefore should set our sights on elderly being healthy. Everybody being healthy, including the elderly being healthy. Here, I would like to highlight one aspect, because a lot has been spoken, the previous and the current session as well. I think focus on mental health and emotional health is extremely important. What are the other methods, additional interventions that are required compared to the rest of the population, including adolescents and children? What is it that we should do extra for the optimum positive mental health of the elderly individual, the senior citizens? And this indeed is a lot about handling the emotional stresses that would happen. It's indeed a lot about how to handle loneliness and how to create opportunities for communication and companionship. So I like to highlight that the way, as we move forward, you said, what more? I think the aspect that needs to be highlighted is this. Number two, in our classical clinical teaching for doctors and nurses and so on, the approach to clinical decision making is taught is still, it does still not include the approach that we should take to assess the elderly. If you talk to the geriatric specialists and their paradigm, the assessment goes through a frailty check, ability to balance, mobility, mental, loneliness. We don't train ourselves, we don't train our students so far, systematically at undergraduate level and more, to approach the health of the elderly in that paradigm. We don't teach, say early detection of dementia, which means a checklist to be gone through, frailty assessment, balance assessment and so on. So Dr. Guleria, one of the aspects from there, to be moving as a generic adult care. When we move toward the elderly population, the science and the clinical training that requires to be done should be embraced in the undergraduate and postgraduate internal medicine, gastroenterology and so on, so that the assessment takes into account not just organ system problems, but unique problems of the elderly, and that would require a look at the curriculum. Not rocket science, it's just a matter of now getting used to seeing that population of our nation through that light, and I think the work needs to be done in that regard. Thank you.
So, but don't you think that when you look at the population per se, we should intervene early in terms of lifestyle changes and in terms of physical activity, diet, at a younger age rather than looking at it for the older age group, and therefore intervention should probably be started way earlier in the younger generation rather than in the older group, because by that time comorbidities have already developed.
Absolutely right, because major disorders that afflict the old age, the classical organ system based, do have origin much earlier, and some of the lifestyle issues and practices we mostly learn during adolescence, and therefore the life course interventions become important. Positive interventions from the very beginning become important. And if you heard Secretary Ma'am, and you noticed that there is a program for hypertension detection systematically, detection of diabetes, and also screening for mental health through primary care system, etc. So your point is very valid. You can't be ready when you already are at the doorstep of that age, no. But then the conditions that appear uniquely at that time, they are currently not being appreciated. For example, osteoporosis or postmenopausal issues are not yet a public health narrative. We may need to do that. Dementia is still something esoteric for our generation of providers. So there we need to do more work in that direction.
So I think we have a separate set of problems which are for the elderly, which need to be looked at. At the same time, a large number of diseases which we see at older age group, and especially with the burden of disease shifting towards non-communicable diseases, need intervention very, very early. And that's where preventive and promotive health needs to come in aggressively in the younger generation. I'm going to now ask Dr. Trehan, from the clinical and governance perspective, what do you think are the biggest barriers in integrating predictive and preventive healthcare in our system nowadays?
So, Randeep, we are coming from a background where India's disease burden is dual. So we know that the infective or communicable diseases are still prevalent, and non-communicable has only added burden to that. So I think the starting point is actually Swachh Bharat, which was declared many years ago by the Prime Minister, but I don't know how much we have actually accomplished from the fact that civic amenities, which are responsible for a lot of the communicable diseases, have across the nation been able to be tackled. That's one. Two, the point is that the seeds of some of the illnesses that we experience in older age are already sown, like you rightfully said, from many, many years of or decades of neglecting yourself and not understanding what is healthy and what's unhealthy. I'll give you the example. Clinically, we have, because I deal with cardiac diseases mainly, our advice always includes the reduction in fat consumption, what type of diet, all that, exercise, everything. But what is disappointing is that I don't think more than 5% of the people actually practice what you are telling them to do. At the end of it, I'll tell you, I get a lot of patients from Punjab, and you tell them that, maybe eat a little fewer panotis and all that. More often than not, they will make that statement that, Doctor Sahab, assi te Punjabi hain, panoti te khani hai. Then what do you say? What do you say to that attitude? So I'm saying that we need a massive education at the school level, at indoctrination into health at the school level, and then it will translate itself in the coming years, because the children can stop their parents and grandparents from being the way they are and maybe help. So I think that there is a huge resource there, and the younger generation, where we can actually make effect into changing the sort of mental state of people, because and I'll give you, it's not easy what we preach. If you have a samosa sitting in front of you, and you're told that if you eat it, you're going to live 5 minutes less at the end of your life, and you can forego it whether today or live for that time when 5 minutes less, I'm sure you're going to gratify yourself now. So I think that the challenges are huge, especially in India, where we are celebrating every day. Either somebody is born, or somebody is getting married, or getting engaged, or passed. So the traps are many in our lives. And I think to be able to steer yourself healthily towards an older age, there are two things, I think. One, of course, inculcate that whole thing that if you are going to get older and sicker, it's not worth living. That is one. And the second is the point that you're not really depriving yourself by using judicial dietary habits and exercise habits. The third thing I would say is retirement is a very, very bad or negative incentive to living healthy. So if you need to, even if you are in a service where you're going to be forced to retire, always think of afterlife before you retire. I think that will help.
Thank you very much. I think very, very important, and it's something which is really of crucial importance, that we need to intervene early and look at lifestyle-related changes, whether it be Swachh Bharat, whether it be the diet that we take, whether the exercise that we do. Many years ago, we did a study where we were looking at sleep apnea in children, and we looked at obese children from school, who came from school, and found that already features of metabolic syndrome, deranged lipid profile, high blood sugars, has started happening in children who were overweight or obese. So I think the issue here is that we need to really look at how we can change our lifestyle and pattern as far as healthy living is concerned, or if we want to live longer. It's more looking at preventive health rather than looking at curative health. And I think that becomes very, very important. I'll just ask Mr. Shikhar Malhotra to give his comments as far as how multi-sectorial partnership can really be useful. And then we're running out of time because we have the next session, which is to be started in 5 minutes. So quick discussion then, and then we'll have the final comments.
So I agree with what Dr. Trehan is saying, but I would just like to also emphasize, while these are, philosophically, I don't think there's any disagreement there, but on the ground, if you look at it in India, I can get a free heart surgery, but I can't get a free weight loss plan. And so you can try searching it on your phone. I tried doing it this morning. In a country, you've got 100 million diabetics, and, at the risk of getting wrestled by Dr. Trehan here. But I think the incentives, of course, have always been very much towards tertiary. And of course, all the hospitals are now also talking about how prevention is paramount for a successful society. So we've got a diabetes problem. We've got, sometimes a problem of obviously awareness. So it's not it's not a health issue, really. It's actually an awareness issue. And so we have to come at it with an angle of education. And the body keeps score. So if you're abusing your body over over 50 years and then you expect to sort of turn it around, right, towards a retirement age, it's a very hard advice for anyone really to swallow, because that habit gets formulated over many, many decades. There is tremendous scope for employers especially. I believe I read that the Karnataka government was tabling a bill to have health screenings be done mandatory by all employers in Karnataka, which I think would be extremely significant, because that would, when you start it, obviously there'll be some teething issues, but once that's settled, you will realize that for one, awareness, advocacy, and access becomes arrives at the fingertips. It will change habits. It will change their outlook onto things. Other states will follow it. So I think that's certainly one great example of a multi-sectoral partnership. Another is, I would certainly encourage insurance companies to take a harder look towards experimenting with some products, more towards prevention and more on the OPD side. I know it has begun, but there is a long way to go over there. And that could really emerge as a huge industry for India, given the amount of consumption that already takes place outside of the hospital environment. So I think, these are the two things, and I think largely for the government, coming back down to, the point that Dr. Thiran was saying about awareness, is that if you were to build awareness right from the school age population. So today, it's like a nugget or a module that gets taught in a couple of periods and then it is forgotten. But the way that we celebrate surgeons in the country, as the number of record surgeries and things like that, why not recognize schools with the best health plans? Why not recognize organizations with the best meal plans and things like that? Actually, which brings a certain amount of credence, credibility, and also elevates it to the same level of importance, and that gives prevention the same playing field as hospitalization.
Yeah, thank you very much. Shank, what would you say as far as how could digital health tools and AI-driven platforms be harnessed as far as preventive health is concerned?
Yeah, thank you, Dr. Guleria. I think the biggest aspect here is technology. Technology for secondary care and tertiary care, have been evolving over the last, I would say, more than 100 plus years. But technology around the primary care and prevention is still very young. What I mean by this is, when you look at the kind of things that have happened in robotics, the things that have happened in, it's emerging in secondary and tertiary care, and the role that technology can play in primary care and prevention is still very young. But if given the right nudge by all stakeholders, I think it'll move fast. And technology's role is to show value to the consumer. And if the consumer or people like you and I can experience it and we find value in it, it will push the technology forward, making roads for more investments. And those investments will create the industry. I think there are early signs of this technology emerging in prevention. When we look at the full body MRI scan, when you look at DEXA, when you look at these new emerging technologies, just a show of hands here, I don't know how many people have ever done a DEXA scan or an MRI scan, in a full body MRI scan as a prevention. So a very few hands in the room. I think this will be very different 10 years from now. That's because this technology is still evolving. It's still not as affordable as it should be. But once affordable, prevention would become an aspect that everyone will do. Ignoring the samosa is hard, but once you have some data with you about your own health, you maybe can be able to reduce that urge with data. So I feel that with these emerging technologies, prevention will get a boost. And when it comes to primary, we're already seeing it with telemedicine. We're seeing it with other OPD solutions, where primary care is starting on your phone now and not really starting at a physical center. But of course, a hybrid model is what probably provides the best results. With these new emerging technologies, Dr. Guleria, I am very confident that 10 years from today, we'll be seeing a far more healthier India. I think these technologies will show people the value, and there'll be a very large set of adoption.
Thank you very much. I'll just ask Dr. Paul to give the concluding comments.
Thank you very much. This panel has elaborated on many, many important aspects of healthy late years senior years. I'll only like to make one request as a way forwards, because these meetings should lead to discussion around how we can collectively work. I suggest that we look at creating models, affordable models, for home care of those who are senior citizens who are restricted in mobility or bedridden. किसी हद तक जैसे भी बताया, मैम ने भी बताया, मैंने भी कहा कि through our comprehensive primary health care, there is that effort being made, which will happen. But I think those who have some resources, if we have a system where a care provider can come, engage with the family, and do the basic checkups and so on periodically, such a model, and provide guidance. And then, of course, there's another level where more support is needed, as I mentioned earlier. So creating these home-based models of elderly caregiving and health care, combining traditional medicine as well, Ayush, I think, will be very, very apt. That's a very important part. There's a huge possibility out there with the modality that can help with the skin care and various organ systems. So मैं चाहूँगा कि इसके ऊपर क्या मॉडल बन सकता है which fits into the business shall we say paradigm of our esteemed private sector. इसके बारे में बात होनी चाहिए. I'm sure there must already be some efforts in this regard, and such a model aided by telemedicine and aided by technologies is perhaps very importantly a way forward. And I think that space should be captured, because elderly should be at home or in a given situation in age-assisted living, but providing care periodically, which is expert care, high quality, comprehensive assessment and care, which is essentially primary care, outreach, that we've so all of us have highlighted. Such models, if we can start working, or if they are once we start popularizing them in the affordable space, aided by technology, would be a very important area of work, keeping in mind that women's health will have some additional aspects to be looked after, to be cared for, and their sensitivity should be borne in mind. This is my humble submission. I'd like us to consider this. We'll be happy to work together in this. Thank you.
Thank you very much, sir, and thank you. I'd like to thank the panelists, and I hope we can all move towards adding life to years rather than years to our life. Thank you very much.
Thank you very much indeed, ladies and gentlemen. A huge round of applause for all our dignitaries. As I request everyone to kindly come forward for a group photograph, please. And ladies and gentlemen, we now announce a quick lunch break. Unfortunately, we have only 25 minutes left for the lunch break, as the Honorable Minister for Commerce and Industry, Shri Piyush Goyalji, will be here with us sharp at 2 o'clock. And we would request everyone to kindly join us back 10 minutes to 2 and be seated inside the hall for the next plenary session. Once again, ladies and gentlemen, I would like to inform the lunch is being served in the lawns outside the terrace, and please join us for lunch.
Medicines delivered in 19 minutes from Apollo 24/7. Download now.
Who do you call first when you feel unwell? Your mom? Your wife? Your friends? The doctor in the family? What if your familiar support system is not readily available? What if you are new in the city? What if the fever won't go away or the pain won't stop? What if you're left with more questions than answers? Then, who would you ask for help? Ask Apollo. Introducing a smart and innovative healthcare ecosystem that revolutionizes patient care. It is powered by India's first AI platform to leverage 40 years of patient data and Apollo's global clinical expertise. Using patients' past health records and real-time data, it offers accurate personalized care, predictive insights, tailored recommendations, enabling unparalleled precision in diagnosis. With seamless voice, text and image interactions, Ask Apollo's intuitive platform ensures patients receive advanced healthcare from the very first step of their health journey. So go ahead, ask Apollo. What can I have for my nagging headache?
Can you help me understand my lab report?
Who are the best cardiologists in the country?
Why do doctors have bad handwriting?
What is real healthcare? Is it just a noble profession? Or a much larger opportunity to serve and heal? Is it just science? Or also an art dedicated to life? When Dr. Naresh Trehan, our founder and world-renowned cardiac surgeon, envisioned an example of clinical excellence in India, a group of skilled and experienced doctors came together and created an institution that focuses on delivering high standards of healthcare towards treating every life as invaluable. As you enter Medanta, the first thing you see is an expression of this philosophy in the much-loved Tree of Life. It resurrects the true meaning of a genuine doctor-patient relationship and highlights the philosophy Har Ek Jaan Anmol, meaning each life is invaluable. That's why Medanta is not just a chain of multi-speciality hospitals, but a doctor-led model for the future of patient care. Medanta brings together multidisciplinary teams of experienced doctors and advanced medical technology in a safe environment. Our integrated tertiary care infrastructure and patient-centric building design aim to create a conducive environment for treatment and recovery.
So Medanta was created to bring to India advanced healthcare across all specialties on the same platform and deliver it at an affordable cost.
Medanta is one of the largest private multi-speciality tertiary care hospitals in North and East India, striving to deliver advanced healthcare and affordable medical services. Medanta leverages technology to enhance the quality of care it delivers. Our home care services and telemedicine solutions allow us to deliver the Medanta standard of care well beyond our hospital walls, because we believe that the quality of healthcare should not depend on where you live. Medanta stands for care, commitment, and high levels of integrity. From every treatment to every outcome, from every machine to every doctor, from little details to macro philosophy, Medanta strives to combine science with our culture, technology with our values, and passion with our resources to deliver advanced and affordable healthcare. Vedanta by Global Health Limited.
Medicines delivered in 19 minutes from Apollo 24/7. Download now.
Who do you call first when you feel unwell? Your mom? Your wife? Your friends? The doctor in the family? What if your familiar support system is not readily available? What if you are new in the city? What if the fever won't go away or the pain won't stop? What if you're left with more questions than answers? Then, who would you ask for help? Ask Apollo. Introducing a smart and innovative healthcare ecosystem that revolutionizes patient care. It is powered by India's first AI platform to leverage 40 years of patient data and Apollo's global clinical expertise. Using patients' past health records and real-time data, it offers accurate personalized care, predictive insights, tailored recommendations, enabling unparalleled precision in diagnosis. With seamless voice, text and image interactions, Ask Apollo's intuitive platform ensures patients receive advanced healthcare from the very first step of their health journey. So go ahead, ask Apollo. What can I have for my nagging headache?
Can you help me understand my lab report?
Who are the best cardiologists in the country?
Why do doctors have bad handwriting?
What is real healthcare? Is it just a noble profession? Or a much larger opportunity to serve and heal? Is it just science? Or also an art dedicated to life? When Dr. Naresh Trehan, our founder and world-renowned cardiac surgeon, envisioned an example of clinical excellence in India, a group of skilled and experienced doctors came together and created an institution that focuses on delivering high standards of healthcare towards treating every life as invaluable. Medanta. As you enter Medanta, the first thing you see is an expression of this philosophy in the much-loved Tree of Life. It resurrects the true meaning of a genuine doctor-patient relationship and highlights the philosophy Har Ek Jaan Anmol, meaning each life is invaluable. That's why Medanta is not just a chain of multi-speciality hospitals, but a doctor-led model for the future of patient care. Medanta brings together multidisciplinary teams of experienced doctors and advanced medical technology in a safe environment. Our integrated tertiary care infrastructure and patient-centric building design aim to create a conducive environment for treatment and recovery.
So Medanta was created to bring to India advanced healthcare across all specialties on the same platform and deliver it at an affordable cost.
Medanta is one of the largest private multi-speciality tertiary care hospitals in North and East India, striving to deliver advanced healthcare and affordable medical services. Medanta leverages technology to enhance the quality of care it delivers. Our home care services and telemedicine solutions allow us to deliver the Medanta standard of care well beyond our hospital walls, because we believe that the quality of healthcare should not depend on where you live. Medanta stands for care, commitment, and high levels of integrity. From every treatment to every outcome, from every machine to every doctor, from little details to macro philosophy, Medanta strives to combine science with our culture, technology with our values, and passion with our resources to deliver advanced and affordable healthcare. Medanta by Global Health Limited.
Medicines delivered in 19 minutes from Apollo 24/7. Download now.
Who do you call first when you feel unwell? Your mom? Your wife? Your friends? The doctor in the family? What if your familiar support system is not readily available? What if you are new in the city? What if the fever won't go away or the pain won't stop? What if you're left with more questions than answers? Then, who would you ask for help? Ask Apollo. Introducing a smart and innovative healthcare ecosystem that revolutionizes patient care. It is powered by India's first AI platform to leverage 40 years of patient data and Apollo's global clinical expertise. Using patients' past health records and real-time data, it offers accurate, personalized care, predictive insights, tailored recommendations, enabling unparalleled precision in diagnosis. With seamless voice, text, and image interactions, Ask Apollo's intuitive platform ensures patients receive advanced healthcare from the very first step of their health journey. So go ahead, ask Apollo. What can I have for my...
Good afternoon, ladies and gentlemen. May we have your kind attention? We request everyone to kindly be seated as soon as possible. Honorable Minister Sir, Shri Piyush Goyal ji has left his office, will be joining us any moment now. We request once again for everyone to kindly be seated inside the hall. Thank you. Ladies and gentlemen, Honorable Minister Sir is here. We would request everyone to kindly be seated. And once again requesting for all mobile phones to be kept on to silent mode. Thank you. And we hope you all enjoyed the sumptuous lunch and the warm winter sun outside. And now getting back to work, we request everyone to kindly be seated as soon as possible. Honorable Minister Sir, Shri Piyush Goyal ji is here with us. And we would like to go ahead with the proceedings of our next special plenary session. Ladies and gentlemen, let's put our hands together to welcome Shri Piyush Goyal ji, Honorable Minister for Commerce Industry, Government of India. I invite Honorable Minister Sir to kindly come up and be seated. We also invite Shri Vaidya Rajesh Kotecha ji, Secretary Ministry of Ayush. Dr. Naresh Trehan, he's on his way, would be joining us any moment now. I once again invite Dr. Naresh Trehan, Chairman, CII Steering Group on Health and Healthcare Council, and CMD Medanta the Medicity, Ms. Sunita Reddy, Managing Director, Apollo Hospitals, and Mr. Pramod Alagaru, Regional Chief Operating Officer, Manipal Health Enterprises. Namaskar and good afternoon. Shri Piyush Goyal ji, Honorable Minister for Commerce and Industry, Government of India, esteemed dignitaries on the dais, distinguished participants and stakeholders, respected members of the press and media, ladies and gentlemen, a very warm welcome to the special plenary session on India's medical value travel at the 22nd CII Annual Health Summit 2025. Ladies and gentlemen, today we have the honor of having the august presence of Shri Piyush Goyal ji, who is a driving force behind India's global trade and investment vision. He leads India's transformation Heal in India, Heal by India initiative. Under his leadership, India is simplifying the visa systems for medical travelers, expanding international outreach, and positioning healthcare as a strategic export sector. I now request Ms. Sunita Reddy, Managing Director, Apollo Hospitals, to kindly. And ladies and gentlemen, let's put our hands together to welcome Honorable Minister Sir, Shri Piyush Goyal ji, for the inaugural address. And before we invite the Minister, I would invite Ms. Sunita Reddy to kindly set the context for this session. Over to you, ma'am.
Namaste and good afternoon. Very warm welcome to the man of the moment, Mr. Piyush Goyal, our Honorable Minister Piyush Goyal. Thank you very much for making time to be here. We know that he's in the middle of trade talks. He's in the middle of of meeting of several ministers that he has planned for today, but he still made time for CII, and he made time for this very important subject, which is medical value travel. Just to set the context, I think, I have to outline the scope of medical value travel. If you look at medical value travel today, it is a $100 billion industry. In that $100 billion, Thailand gets 25% of that. And really my question to all of you and my challenge to myself is how much of this $100 billion do we deserve to get? And I say deserve to get because I think India has the best medical systems. We're at 1/10 of the international cost. We have an integrated health system with Ayurveda. So in terms of dealing with chronic, in terms of dealing with wellness, we have a value proposition that no one else can beat. As we look at the rest of the world, we know 3 reasons why people are coming to us. 1, shortage of beds, and therefore all of the African countries and our surrounding neighbors. The second, the potential, is the waiting times in UK, the cost of care in US and the Western countries. These are 3 primary reasons why people should come to India for care. Now to look at how we will make sure, what is the strategy ahead, and how we can work with the Indian government to achieve the goals not only of Heal in India, but to make sure that India is on the path of Viksit Bharat by galvanizing this economy, which means not bringing just $10 billion of revenue to medical value travel, to Heal in India, but also creating an ecosystem with a multiplier effect that will create jobs, that will create more travel and tourism, and will benefit the population at large, because this, I believe, is just the beginning, and we are truly honored to have the minister here. So with this, let me hand over to Dr. Naresh Trehan for his remarks.
Ladies and gentlemen, I now invite Dr. Naresh Trehan for the welcome address. Over to you, sir.
Thank you. Good afternoon. And I must thank our dynamic Minister for Commerce, Mr. Piyush Goyal, to really take out the 20-25 minutes and out of his schedule, because there are meetings before, after, tonight. So I know how hard he works. So I'm not going to give a big introduction, but because he doesn't need any. But I'm just going to make a couple of remarks that we all know that India is poised in the best position to be the destination for medical value travel. Unfortunately, because of various disconnects, we have not achieved the potential that we can. And we need to actually get a champion for us from the government who can iron out all the little kinks that are coming in the way. And we also on our side as the providers must actually connect ourselves in a way that only the patients who do come do not suffer in unrecognized places, because right now it's a very chaotic system and not everybody is getting the best experience that they should with the value that they can get from India. So let me request the Minister to please enlighten us. And the second thing I wanted to say was that I have spoken to the Minister and he's kindly agreed that he will be the champion for medical value travel from now on. So you have your task cut out. Thank you so much.
Thank you very much, Dr. Trehan, Chairman of the CII Healthcare Council, and of course, somebody we all look up to as one of the finest doctors in India, one of the finest surgeons in India, and truly a champion of India's medical sector, a person who even at his age, which probably looking at him, very difficult to imagine. And if you shake hands with him, you've got to be worried कि हाथ ठीक ठाक है कि नहीं बाद में. He still has a military handshake. Truly wonderful human being. I've seen him work during COVID. I've seen him work through very, very tough, trying times. And I'm glad that he's taking so much interest in this subject, something which is dear to all of us and truly holds tremendous potential. Ms. Sunita Reddy, of course, has been at the forefront of serving this cause over the years. The Apollo Hospitals has been an iconic brand in India. They're well entrenched across the country to lead this charge to promote medical tourism. And I have no doubt that with this kind of leadership, we'll be able to achieve some wonderful results. Mr. Pramod Alaguru from the Manipal Health Enterprises, my good friend and colleague in the government, Vaidya Rajesh Kotecha, Secretary of Ministry of Ayush, which looks after traditional medicines and the scientific validation that's required to promote our traditional medicines across the world. All the distinguished participants of this 22nd Annual Health Summit 2025, friends from the media, ladies and gentlemen, truly a very, very difficult day, yet very prophetic to be meeting all the medical professionals today. Only yesterday we had this tragic bomb blast at Red Fort, where we lost 10 lives. Many of our brothers and sisters are injured. Shows us that we all have to be very conscious about the safety and security of our environments. We've got to be very careful about terrorism rearing its head again. And there are these last-ditch efforts that these terrorists do to try and show their relevance. We as citizens, we have as 140 crore Indians, I think are duty-bound to really give a very, very responsible yet firm answer to such characters. I'm told you've had a condolence message in the morning. You all already stood in silence for conveying the condolences of all of us collectively to the families of the deceased, and our prayers for those who are injured so that they recover fast. But in that context, if one sees and we see the contribution of all the doctors, the medical profession, to ameliorate some of these problems, you really are playing a very important role. In fact, even yesterday, it was the doctors who gave immediate emergency care at the Loknaik Jayaprakash Narayan Hospital where the injured were shifted. And therefore, this kind of first responder critical care service that you give is something that really the nation and all of us are very, very proud of. We cannot forget the COVID period where, of course, the profession really shown outstanding performance. You outperformed, in fact, even everybody's expectations, putting your own lives to risk, yet were ready to make sure that you could save every single life that was possible in the circumstances. So as a nation, I want to tell you that we are all very grateful and convey the gratitude of 1.4 billion Indians to the medical profession for the yeoman service that you are doing to the nation, to society, and to all of us. In fact, Prime Minister Modi had said, and I'd like to quote, "Good health is the foundation of every thriving society." And if India has to become Viksit Bharat 2047, a developed nation, a prosperous nation, when we celebrate 100 years of independence, the role of our doctors, the role of the medical profession as a whole, nurses, technicians, all the ecosystem, the medical devices manufacturers, our traditional medicine professionals, the entire ecosystem is going to play a very important role. And therefore, we will have to provide vision and leadership. And no better persons than the illustrious team sitting on the dais today and all of you to provide that leadership so that India provides world-class healthcare, becomes a global benchmark for quality care, for quality surgeries, for quality pre and post medical care, for quality preventive healthcare, and of course high-quality traditional healthcare. Towards that end, we are finding that India's consumer healthcare spending is also going up. The government's healthcare spending is also going up. I don't know if you have noticed that when this government came in 2014, we had only 7 All India Institutes of Medical Sciences. And across the country, we had only 387 medical colleges. In the last decade, we have been able to grow this to 23 All India Institutes of Medical Sciences. So 16 added in a decade against 7 set up over so many decades. At the same time, 387 medical colleges have almost doubled to 706 medical colleges today. Because we recognize that we need more doctors. We recognize that India is also providing a talent pool of highly qualified professionals for other parts of the world. And we also recognize that our own requirement as a large nation is so large that we'll need more and more doctors. In fact, last year, from the ramparts of the Red Fort, the Honorable Prime Minister announced that we'll be creating a very significant number of medical seats in the next 5 years until 2029, so that the output of doctors who come out of medical colleges can increase significantly, and we can utilize our medical infrastructure smarter and better. Many of you are aware we have Ayushman Bharat, almost 700 million people eligible for free healthcare. Every senior citizen above the age of 70 is eligible for free healthcare irrespective of income. And I remember asking the Prime Minister, why should we be doing it for everybody? The rich people can kind of take care of themselves. You don't need to do it for everybody. And see the compassion in the man. He told me, nowadays we find a lot of cases of even rich families who don't care for their elders at home, as we used to have in traditional India. And there are some very bad examples which have even come out in newspapers and reported, where people have not looked after their parents or the elderly in the families, as India was known to do for centuries. And therefore he said everybody above 70 should have this social security net, or the comfort that he or she will be taken care of. Even Jan Aushadhi stores have been a grand success. 10,000 of them and growing, providing generic medicines at very affordable prices. Even sanitary pads for our less privileged sections of society at barely 1.5 rupee each. So that for $1, only $1, a woman will get menstrual facility of sanitary pads throughout the year. And I think it is these small, subtle interventions that really are impacting the healthcare of the citizens in rural India, of the people, less privileged people, the people at the bottom of the pyramid. And one think that why am I giving this context when we are here to discuss India's medical value tourism? I think it's important to recognize that we can't have such a chalk and cheese system where the local people will not be eligible for healthcare and our health facilities will be focused only on international medical value proposition. And therefore it's important that we ensure that 1.4 billion Indians get quality healthcare, get access to affordable healthcare. So that when we look at medical tourism or medical facilities being available for international people to come and take the service in India, also add to India's GDP, add to India's foreign exchange income, our exports, it's only possible because we have been able to create this foundation of affordable and quality healthcare for every citizen of India first. Given that we have created this foundation, given that today India's healthcare credentials as a fit nation, as a nation which recognizes the importance of providing healthcare to every citizen, a nation where you have seen in the recent GST cuts, a focus has been on health insurance, life insurance from 18 to 0, a number of medical devices brought down to 5%, a number of medicines brought down to 0 or 5%, cancer care, drugs and other things like that. Ms. Reddy was just telling me maybe we should look at some more medicines being available at affordable prices through reduction in any other duties or cesses. We'll be happy to hear more specific details from you so that we can give it a consideration. I can assure you, friends, this is a listening government. And we are happy to listen to your voice, to listen to your suggestions, to listen to your ideas, because all of these will cumulatively help us both to serve the Indian people and to promote medical value travel. Also, the idea about visa on arrival that you have been articulating, Dr. Trayan has been at the forefront, Ms. Reddy, is a good idea. We'll pursue that. It's, of course, one will have to look at what the certifications will be and which are the countries where we can allow that. So I'm happy to tell you that many countries we allow visa on arrival, or we allow e-visas where you just apply online and within 24 or 48 hours you get your visa. Both these can be considered, let's say, for the United States, for most of the European countries, not all by the way, for most of the countries where we have a fair amount of comfort, where detailed investigations or inquiries are not required. So let us prepare collectively. And these are the areas where maximum, or at least let's say reasonably value-based tourism can come in, or medical tourism can come in. So let's work together. CII could put a team together and study the market. You said it's a $100 billion market. My figures suggest that it could be over $800 billion market and expected to become a $1 trillion market, including wellness, medical wellness, or health fitness, or health precautionary preventive care. Now you are really looking at a huge, colossal business possibility, with India's share being minuscule. And let's aspire to go big on this. Of course, we've not been able to achieve that as yet, because possibly the infrastructure is not good enough. Possibly we may need to make some amendments to our regulatory practices. Another thought that came up was whether we could allow NRI doctors to come and also work in Indian hospitals. Very often patients are very comfortable to have their own doctor to be operating on them, or to be available when the operation is taking place, or any health intervention is taking place. Again, we are open to that, but you will need to first get your Indian Medical Association, the IMA, on board. That's something that all of you should really be collectively working on, to get IMA to give this proposal. Because all these professions are regulated by, like chartered accountants, we are regulated by our institute, you are regulated by IMA. And I think they will have to, or the medical council, they will have to come to terms and come to accept this. Each profession, the lawyers don't accept foreign lawyers to come into India, except for fly in and fly out. I don't know about doctors. Possibly we could start with fly in, operate and fly out to begin with. So we need you and leaders from the industry to help us work with your regulatory body. And I can assure you the government will not be found wanting if the profession is on board. And if you need our help to try to bring consensus, we are happy to even attempt that. At the same time, one must recognize we have a great advantage of 2 or 3 things. Young population. So we have a lot of youthful talent and skill which we can offer to foreigners coming into India for medical treatments, both preventive, wellness or curative. We have an advantage of huge skill sets of our doctors, our technicians, our nurses, our caregivers. In fact, some of our nurses and caregivers have a very high premium value. There are countries who are willing to take in our nurses and caregivers at phenomenal salaries. We need to upgrade the nursing programs. We need to upgrade the number of nurses that are prepared in the country. In fact, I would urge as many hospitals in the country of repute, Manipal, Apollo, Medanta, Fortis, Max, all of you all. In Mumbai, the Harkishan Das, Kokila Ben, Bleach Candy. I think you need to get all the hospitals on board. Maybe you need to have the administrators or the trustees of these hospitals sit down, the main hospitals, and work out how can we increase the nurses' output by maybe 100,000 nurses a year. Because that's the level of demand in the world for our nurses. And I suspect if we are able to develop medical tourism in India, we will need that level of nurses and high quality nursing care for expanding our medical tourism. We already have a shortage of nurses and caregivers. And given the aging populations in the rest of the world, some parts of the country, some parts of the world have 47, 50-year-old average age of population and growing older. Can you imagine what a massive opportunity awaits us? Then we have countries where medical treatment is given as a part of the social welfare spend, but there are huge waiting times. So even to get a dental appointment may take you 6 months. It's probably easier to fly in, get the treatment and go back. Faster, less cost, and possibly better. And there lies an opportunity. So let us, I hope this health summit that you're holding today will come up with an action agenda. Some of which you have mentioned, some more may come out in the course of discussions. What infrastructure facilities, what stay facilities. For example, every treatment may not be in the hospital. I'm sure hospitals wouldn't like to just clog themselves and book up all the rooms for foreigners so that we Indians don't have a place to go. We'll have to have some kind of balance between the needs of India and what we are able to offer to the world. We can't have an open sesame that whoever pays the highest money has the right to the hospital facilities. Because those hospitals are built on India, Indian land, Indian infrastructure is being used. Doctors who studied here, who on home government and country, and the people of India have spent crores of rupees to train. We can't have all of them only treating the foreigners. So that right balance will have to be thought through. And you will have to come up with a cogent proposal that, okay, can hospitals be allowed up to 10% of foreign patients? And against that, what will be the benefit that will be given to the poor patients? Will all of these hospitals approve or agree to be a part of Ayushman Bharat program? Will they all agree to give the poor as a part of CSR or whatever formulas are there? Will they be allowed to give, or will they assure that they will share a part of the higher earnings from foreign medical treatments to serve the less privileged sections of Indian society? And it'll have to be some balance that we will have to create. And then I can assure you, given the good high quality that India has, the affordability, possibly a treatment here would be done at 1/4 or 1/3 the price that would be required anywhere else in the world, possibly even less in some cases. You said 1/6. I think our competitiveness is there, our quality is there, our competence is there, our skills are there. Few more enablers, some from the government, some from your medical council or medical association, some from collectively the doctors and hospitals working to partner in this initiative. If we all work together in this, I think there's a huge value proposition awaiting us. I can assure you the government is very committed to supporting this program that you have taken up. I think Heal in India could also combine yoga, Ayurveda, yoga with meditation, pranayams. Possibly we could also look at a mix where modern treatment coupled with traditional medicine can help patients recover faster. I still remember I was in New Zealand last week and they were explaining to me Maruka honey. And they were explaining to me the health benefits of Maruka honey. Not just when you consume it, but for surgeries. I believe it's excellent as an antiseptic. And then I remembered that way back in 2008, I had undergone a serious surgery which went wrong at the first stage. And somewhere along the line there was some goof up and it was getting very, very bad. And I landed up at Dr. Udwadia's place. Somehow, for some reason, the surgery was done somewhere else, and it created problems. And then I had to go to Breach Candy Hospital and come under the care of Tempton Udwadia, not Farooq, who's the late Tempton Udwadia. And he started treating me, and he gave a list of things to be brought for alternate day, or probably initially every day and then alternate day, bandage. And amongst the things was honey. And he specified Australian honey. He didn't use the word Manuka. I remembered all this only last week, so it's fresh in my mind. And we got some honey. And there were some other ingredients. Cow's ghee, I think, was one of them. Cow's ghee and honey and whatnot. And when we got the ingredients, he looked at the honey, said, there's no good. And he gave some other specifications. So we had to get another bottle of honey. All of that was sent to, I think, Parsi General Hospital, or a Parsi hospital in Breach Candy. Near Breach Candy Hospital, there's another hospital, probably women's or children's hospital, where he sent all of these ingredients. They made out gauges with all of these ingredients, which we got in a bread. I had also to take a bread basket, bread box, in which these gauges were put. They were lying in my refrigerator, and every 2 or 3 days he would come and, I would go to the hospital and he would change my bandage. And that's what cured me. So a mix of modern and traditional can do wonders. And guys in New Zealand are selling me Maruka honey, telling me it's very good for your doctors, as we were finalizing our free trade agreement. So that is the potential that India holds. I think Shushruth was the person who probably invented surgery originally in the world. So, and because I remember Dr. Tempton giving me all this gyan and saying this is how Shushruth used to treat patients and cure them after post-surgery. So I think there's so much that we have in India. We need to leverage it. We need to link also possibly a medical tourism idea, a medical value proposition idea, with spiritual tourism, where we could have meditation and Ayurveda and yoga and all of these things thrown in. So we can really package India very smartly. We can position India as a country where the basic ethos of healthcare is not new. It's been there for generations, for centuries. I mean, I'm not going back to Hanuman getting the jadi booties to treat Lakshman. So for us, it's something which comes naturally to all of us. And I have no doubt in my mind that let's take this project up swiftly. Let's take this project up in a smart manner. Let's take it seamlessly across the country. And let's keep it simple. So this is truly an area where you have our full support. We have the clinical prowess. We have the wellness heritage in India. We have a lot of talent. And we have that culture of hospitality. I think the right heady mix that is required to make India the #1 wellness destination of the world. My best wishes to your deliberations during the course of the day. And I'm sure I'll hear back from all of you with a full program of how we are going to take this in a mission mode, in a time-bound manner, and what are the critical interventions that we as government can do to partner you in this very, very wonderful initiative. Thank you very much, ladies and gentlemen.
Ladies and gentlemen, as already announced, Honorable Minister Sir has to leave. I would request Dr. Trehan to present a small memento, sir, a token of gratitude to the Honorable Minister Sir. Ladies and gentlemen, once again a huge round of applause for Shri Piyush Goyal ji. Honorable Minister Sir's commitment is clear. India must evolve from being a medical treatment provider to being the world's most trusted healthcare partner. Thank you very much indeed once again, sir. And ladies and gentlemen, we are honored to have with us today Honorable Secretary, Ministry of Ayush, Government of India, Shri Vaidya Rajesh Kotecha ji, who is a distinguished Ayurveda expert and administrator, has led India's global Ayush outreach. Under his leadership, India has signed multiple international MOUs, created the WHO Global Center for Traditional Medicine in India, and elevated Ayurveda and Yoga as the trusted global healing systems. He embodies the idea of medical wellness integration, which is the hallmark of India's value propositions. And let's put our hands together to welcome Shri Vaidya Rajesh Kotecha ji for his address.
Thank you so much for inviting me for this wonderful session. I see a lot of leaders and so many of you I am aware, I know, not all of you but so many of you. Thank you for coming over. Sri Pramod ji, and just I am receiving Sunita ji, and Dr. Naresh Trehan is also arriving. Colleagues from the government, industry, healthcare providers, and friends, a very good afternoon to you all. It's my privilege to address this special session on India's medical will travel at CII's 22nd Annual Health Summit 25. It is dedicated to, sir, आप चेयर पर आइए sir, Trehan साहब. Okay, sir. Okay, sir. That's why I was thinking. Yes, sir. I am also happy to share the dais with the stalwarts. I know Dr. Trehan ji, just before I assumed office in 2017, we had several interactions, and I want to specifically mention two important things that would be interested for the participants, because we are talking about medical value travel. Dr. Trehan is the first who has implemented integrative care in Medanta. If you are not aware, he is the first in country, and then there is a separate department of integrative medicine in Medanta, where the best thing of East and West is coming together, and there is a system of cross-referrals. And he has made a benchmark how integrative healthcare is possible into high-end hospitals. The another example I want to cite with my another colleague here who is sharing the dais, Dr. Sunita Reddy. Recently, Apollo Group has, taken over Ayurveda hospitals. So now it's known as Apollo Ayurveda. And Apollo Ayurveda is progressing in the direction into this integrative healthcare model, where Apollo is also engaging into a lot of Ayurveda-based Panchakarma hospitals and opening integrative healthcare in Apollo hospitals. Why it is important that this model of Ayurveda hospitals group is also a wonderful model of our country, where medical will travel can be offered with high-end integrative care models, evidence-based, in different areas like cancer care or geriatric care or post-surgery rehabilitative care. Honorable Minister was just mentioning that इतने सारे लोग हॉस्पिटल में तो नहीं रह सकते, तो after the main intervention, the patient has to go somewhere. So this model is also wonderful where patient can go to this Ayurvedic care, get some good panchakarma and therapeutic rehabilitation, and then that's a 360-degree care of a person. So that kind of model is only available in our country, and it is also possible to have it scalable. This is one thing that I want to mention. The other thing, that the stalwarts are here. We all know that for medical value travel, for mainstream healthcare, people are coming from middle income group or low income group countries. But for the holistic wellness, for the therapeutic care from Ayurveda and yoga, people are coming from high-end countries, and they stay here for several weeks. And look at this potential, that it is a win-win situation for India, because India is positioned as the only country who is able to provide this much of high-end care for wellness and therapeutic wellness or traditional medicine, through traditional medicine. So that potential is also there. And I am aware that this potential is being capitalized by our entrepreneurs at a very large scale. And then, the day will come that this therapeutic wellness area will be almost the similar size of the medical will travel of mainstream healthcare. Why I am mentioning this? I have some interesting statistics, sir. That in our country, the pharma sector, which we are considered as the world's provider of pharmacy. So pharma sector is valued at $66 to $67 billion. And out of that, 24 billion is domestic size and rest is export. The Ayush sector, through a study by RIS, is also having $23 billion of domestic size. So 23 billion of pharma, 23 billion of Ayush manufacturing is the same. So we are actually underestimating this sector, the potential of this sector. There is another example that recently NSSO did survey on Ayush, and that survey outcome is very interesting, and it also showcases the very strong undercurrent of the demand of this sector. One of the inferences is that 96% of urban population and 95% of rural population, they are aware about Ayurveda, Yoga and other Ayush system. Out of them, 50% are using these systems for their health care, for their preventive care or promotion of care, 50% plus. And there was another criteria, how much they are spending. And the benchmark was that, do you spend more than 1,000 rupees per year? So the respondent, 50% respondents say yes. All of these 50% respondents say yes, we are spending 1,000 rupee plus. It becomes 70,000 crore rupee when you actually collate this data to the actual possibility of the spending. So my urge to all of you is to look at this possibility of this sector. Government is really there to help you, to support, and as mentioned by Honorable Minister, we are looking forward for the outcome in the form of a suggestions for medical level travel to the government. I am also aware that CII is actually engaged into, the Ayush vertical of CII is engaged into creating such inputs, and we look forward to receive such inputs. There are a couple of information I want to mention is very interesting for the sector. One is that we have this Pharma MedTech scheme. This Pharma MedTech scheme is having size of 5,000 crore rupee. Recently, the Ayush sector has also been added into this scope of this sector, scope of this scheme. It supports the entrepreneurs and industry for new drug development and medical technology, MedTech. So look at this possibility. There is a kitty of 4,200 crore. Remaining 800 crores goes to the NIPERS, but at least 4,200 crore rupee scheme is available for Ayush sector also. Recently, Government of India, with the support of DPIIT, has also released guidelines for processing patent applications of Ayush systems and related inventions. So this is to ease the filing IPR and getting IPR into this sector, which is also a landmark thing, because there is a narrative that getting patent in this sector is very complicated. It is no more complicated, because CGPTDM, our Patents Journal of India, has provided the facilitation of consultants at Patents Office who understands Ayush, from Ayush. So this is also a new facilitation that I want to share with you. Our Honorable Minister has briefly mentioned about another area of scope which is having very high value. If we consider this as a medical value travel, is a spiritual tourism, the yoga tourism. Thousands of people are coming every year, and they come, they stay here for several days, they get yoga training and they're well acquainted about spirituality. Lot of institutions are doing this. So to facilitate this, we have Government of India at Ministry of Ayush, we have created an ecosystem of yoga certification board. And we have also recognized several institutes as a premier institute providing this facilitation. And this yoga certification board is now coming up in a big way, because we are proposing to make it, globally recognized accreditation body. So at a global level, yoga certification board is now coming up. The another area is Ayurveda Training Accreditation Board. We know that Ayurveda is one of the brand India which is very high value and which is high in demand. There are a lot of providers for training. There is a commission, National Commission of Indian Medicine, regulating these affairs, but they regulate only graduation, post-graduation and other courses, but small courses, certificate courses, courses for medical professionals about Ayurveda is not regulated. So we have created this accreditation body. It's not regulatory body, accreditation body, which is also coming up very nicely. So these are the facilitation for medical value travel. And friends, this untapped potential is very, very big, and I urge all of you to look at this possibility of having either integrative care to be opened in our hospitals, and then taking that facility onboarded for rehabilitation of our patients, or for mainstream care or therapeutic wellness, or like Apollo Ayurveda, you look at the possibility of taking over some big hospitals and become big. Thank you.
Thank you very much indeed, sir, for demonstrating how integrative medicine can redefine India's MVT narrative. And now, ladies and gentlemen, I once again hand over to our distinguished moderator and chairperson of this session, Ms. Sunita Reddy, ma'am. Over to you.
Sure. We seem to have just 5 minutes, and so much has been said. I think if you just look at the numbers, we've given some big numbers there. So, in terms of medical value travel, we've said this is a $100 billion market. And what we really didn't emphasize is what you spoke about, sir, which is a $950 billion wellness market. And so just keeping these numbers in mind, I would like to ask the panelists, what would you do to, if you could do 2 things, what would those 2 things be to really help us reach that goal of at least getting 10% of this $1 trillion market? Because the minister also spoke about it.
First thing, you mentioned about 2 things. First thing that, the government and sector should come together and think big. Unless we think big, nothing will happen. So, as mentioned by the minister, that this government is listening. So, let us know what is to be done by the government, and then we are there. There is a facilitation of Ayush Export Promotion Council. Is not looking after the products, but also services. So maybe this platform can help to make the things big. And the second, what was your second question? This is
no,
first.
No, I said, what are the 2 things you would do to reach this goal of at least 10%?
Yes, and second thing is that, our country is coming up with a large infra projects, and we are having all road connectivities, our IT backbones are very good, and our infrastructure is happening at a very fast pace. So we need to match with this fast-paced development. I am aware that this primary area of this summit is AI in healthcare. So just citing that example, that Ministry of Ayush is having this Ayush Grid project working with Baisa again, who has created the PM Gati Shakti. So we are creating, already beta version is launched, we are creating a master application about Ayush, wellness and medical value travel and all other areas of Ayush. And we are creating an AI chatbot which is, it is already under development. We have launched, but it is, as you know, that as we train the AI, it becomes more and more perfect. So what we are doing is that we are translating this ancient text like Charak Samhita, Susu Samhita with the help of AI. If I am not an Ayurveda person, I can decode that knowledge and then apply it. And then last thing is that we are also working through these digital applications with the help of WHO, integration of ICD-11 into the morbidity codes of Ayurveda and Unani and Siddha. So taking this to a scalable thing, we need to take all routes of infrastructure development, digital area, so that things can be scaled up in a very fast manner. Thank you.
Thank you. Those are very good points. We've not really given Mr. Pramod Alagaru, who is the Regional Chief Operating Officer of Manipal Health Enterprises, to really voice his views. So I have the same questions for you. If you look at the size of the opportunity, what are the two things you would do? And I would like to say that amongst these, if this was the third question to you, I know there's a lot of FDI coming into your enterprise, especially Manipal. How would you use FDI to accelerate medical value travel in India?
Dr. Reddy, sometime back, it was very nice to hear some large numbers being thrown by our Honorable Minister, Shri Piyush Goyal ji. And I really, buy that thought. In fact, India is steadily moving from curative care to actually wellness and a very comprehensive care, be it domestically or internationally. And in that direction, we are very well known both for our clinical depth, talent, also for our clinical governance and outcomes. Since our focus is now moving from curative to wellness and comprehensive care, there are two things that we could look at. One, can we look at this entire program being positioned just like what Incredible India was for tourism? Can we do Heal in India as a subset to Incredible India and start positioning ourselves? That could actually give us a greater visibility. Number two, could we have a unified portal system where we could, where you have both the domestic audience as well as the international audience coming to that particular portal, maybe under the aegis of the Ministry of Commerce, which can actually unite different departments together and make it very easy for the end patient to make a choice, patient and the patient family, whether the services are in a right hospital, whether the quality standards are unified and standardized. And these are two things that come to my mind which can actually take us to the next jump, in fact.
So how would you use FDI which has come into your enterprise to really make sure that we accelerate medical value travel, get more foreign patients to India?
We will have to actually jointly work along with the government on this particular aspect and ensure that some of these funds that are coming in are routed and channeled separately towards the wellness and comprehensive plan. So it'll have to be looked at a little differently, as a different vertical.
Okay. So Dr. Trehan stepped off the panel, but I think he has deep knowledge of the troubles of this sector. So Dr. Trehan, I'm going to ask you, what are our pain points? Why are we not able to achieve this?
So, Sunita, the problems that exists are all well known. It's not that these are unknown factors. First of all, the problem is from within. Within, I mean, is all of us as providers. Because we have never organized our thought process around the fact that how are we functioning? We are functioning like with the help of touts. That's the worst way to do anything in life. We need to free ourselves and come together and have a common program where we say to the government that these are the standardizations that we recommend should be done for hospitals, because what happens is half the people who come to India are taken to back or beyond places which are not even certified by any standards, and they have poor experiences. So the word gets around that there is uneven level of medical care available in India. So if we come together, take a minimum platform to say these are the minimum criteria for being able to approach medical value travel by the government's standardized or endorsement, I think then things will work. So there will be two things. One, when a certificate of need goes for a patient from an institution which is not well recognized, it takes a long time to get that visa circulated, and we are actually suffering because of that also, because although they know that there is a Medanta, but the process has been made that it has to go through different channels to actually be able to grant the visa, and I have uncoded the whole system, we'll share with you. And the point is, if we can make that white paper to standardization, how the process has got to be done, the government actually, every government agency overseas should be able to project it. Second, we have to have campaigns like all other countries are doing. So there are 3, 4, 5 things we need to do together. And once we are able to do that, I think there is no stopping people from traveling here. So I think the disease starts with us. We first straighten ourselves out, and then we will progressively get the government involved, and they're all willing. Thank you.
That coming from the words of a doctor himself. So, are there any questions from the audience before we close? Yes, go ahead.
Good afternoon, ma'am. I represent a private equity firm from New York. We have a capital call base of $350 billion. The financing which is required for such a improvement from wellness perspective, I believe if we can be supported with some bonds like IMPCL, sir, could be a PSU which can issue bonds to us. We can finance that. Similarly, we have been financing senior citizen housing in the US, also in Mexico and Brazil. So there are some regulatory challenges which we need your support from, both from the healthcare ministry as well as wellness. So that will clear a lot of pathway for us to consider that as a asset class, which can be heavily invested into. So this regulatory support, we've been told that Niti Aayog is working on some reforms. If you could guide us from the ministry side, that will help a lot. Thank you so much.
Thank you. I think that was more of an addition to what we can do. Last question, I think we really have to close now. Yes. Gentleman on the right.
थैंक यू मैम। मुझे एक क्वेश्चन था कि अभी हमने वेलनेस के बारे में बात किया, लेकिन मुझे लगता है कि एक वेलनेस की पॉलिसी लाने के अगर लाते हैं तो मुझे लगता है कि इंडिया अक्रॉस द वर्ल्ड हम वेलनेस के मेडिकल वैल्यू डेवलपमेंट के हाई वैल्यू में भी बढ़ा सकते हैं और टूरिस्ट को भी बढ़ा सकते हैं और अपने इंडिया की इकोनॉमी को भी ग्रोथ कर सकते हैं। तो एक वेलनेस पॉलिसी को प्रॉपर लाने का मुझे ऐसा लगता है।
Yes, so thank you. I think, we've had a lot of suggestions. So let me just close the session with, what the minister said. He said when he was sick, he had to get honey from Australia. India is a land of ashwagandha and turmeric. I think we have solutions for not just for India but the rest of the world. And together we will put together a policy, a paper on medical value travel to make India not just the destination for the rest of the world, but to make sure we deliver the best in India. Thank you, ladies and gentlemen, for your time and attention and participation.
Thank you very much indeed, ma'am, for wonderfully chairing and moderating this session. I would request you to kindly do the honors of presenting a token of gratitude and appreciation on behalf of CII to Shri Vaidya Rajesh Kotecha ji, Secretary, Ministry of Ayush. Thank you. And we present a token of gratitude and appreciation to Mr. Pramod Alagaru, Regional Chief Operating Officer, Manipal Health Enterprises. Thank you very much indeed. And ladies and gentlemen, may I request for a group photograph. Dr. Trehan also joining us back on the panel. So let's once again have a round of applause for that wonderful session we had, beginning with Honorable Minister, sir. Wonderful address by Secretary Ayush and a very nice interactive session at the end of the closing of the session. So ladies and gentlemen, I request everyone to kindly remain seated as we straight away move to the next session on building the future of Indian healthcare, investable opportunities. Just give us a moment while we arrange the top table for the next session. Please remain seated. Good afternoon, ladies and gentlemen. Oh, okay. Ladies and gentlemen, kindly remain seated for the next session, Building the Future of Indian Healthcare, Investable Opportunities and Systems for 2047. Ladies and gentlemen, kindly stay back with us. We are inviting the panelists onto the stage very shortly. Namaskar and good afternoon, ladies and gentlemen. Welcome to plenary session 3 of the 22nd CII Annual Health Summit, a session that looks ahead not just to the next few years, but to the next 2 decades of India's healthcare journey. This session is on the theme of building the future of Indian healthcare, investable opportunities and systems for 2047. The session is led This session is led by someone who understands the pulse of the global healthcare investment landscape. Ladies and gentlemen, let's welcome on stage our distinguished moderator for the session, Mr. Viksit Bharat, partner and senior leader healthcare practice, McKinsey & Company. Ladies and gentlemen, a round of applause to welcome him. With over 20 years of experience in advising governments, global health institutions, and Fortune 500 healthcare companies, he has led large-scale strategy and transformation programs across India and Southeast Asia. We are joined by an extraordinary group of leaders representing hospitals, health tech, insurance, capital, and innovation ecosystem. I invite eminent panelists, Mr. Krishnan Ramachandran, Co-Chairman CII Committee on Insurance and Pension, Chairman CII Task Force on Health Insurance, Managing Director and Chief Executive Officer, Niva Bupa Health Insurance. He's a thought leader in India's health insurance evolution and pioneering a shift from hospitalization-based coverage to holistic wellness and preventive care financing. Warm welcome to you, sir. I invite our eminent panelist, Mr. Joy Chakraborty. He is Chief Operating Officer, PD Hinduja Hospital and Medical Research Center. He's a senior hospital operations leader known for championing patient experience, clinical governance, and operational excellence while enabling world-class care delivery. Warm welcome, sir. Inviting distinguished panelists, Mr. Vishal Bali, Executive Chairman, Asia Healthcare Holdings. He's a visionary healthcare entrepreneur and investor, has built multiple specialized healthcare platforms from oncology to IVF, creating scalable, investable healthcare businesses across Asia. Warm welcome, sir. Inviting Mr. Rajan Anandan, Managing Director, Peak XV Partners from Sequoia Capital India and SEA. He is one of India's most influential investors in disruptive, high-growth startups, known for backing bold entrepreneurial ideas in digital health, AI, and tech-enabled care. He is shaping India's next generation of unicorns. And with that, ladies and gentlemen, these are the minds sharing healthcare delivery, financing, investment, and innovation for 2047. I now hand over the session to our moderator, Mr. Viksit Bharat, to kindly lead this dynamic conversation. And I would request you, sir, to kindly close the proceedings of the session, latest by 4 p.m. Over to you, sir.
Thank you. Good afternoon, everyone. I hope everybody had a good break and good coffee. It's an exciting, probably a timely topic. The horizon is long, 2 decades, right? A lot happens in 2 decades. Just by way of a little bit of introduction, I thought it might be worthwhile quickly recapping what the last couple of decades have been like in healthcare in India, right? So it's been a couple of decades of remarkable progress, really, if you look at it. Most indicators of health in the country have been on an upward trajectory. Life expectancy has gone up by 7-8 years, perhaps, in this time. Infant mortality is, down almost 2/3, if you will. Insurance penetration is up 5-6 times compared to 22 years ago. Out-of-pocket expenditure is probably now half, if you will, of what it was back then. Still high, but on the way down. If you look at the access to healthcare in terms of the capacity in the system, quality beds, if you want to use that metrics, right? That's grown by 5-6 times in the last couple of decades. So by all measures, it's been real, tangible progress on all counts, right? Now, if you look ahead these couple of decades, it will also be a time of significant change. On the one hand, if you on the debit side of this, if you will, the country is aging. As all of you know, the over 60 population will roughly double between now and 2047. Non-communicable diseases or lifestyle diseases are already a majority, right? Over 50% of the incidents today. They will account for over 3/4 of mortality by 2047. And we'll have new challenges, I'm sure, and when I say this, I recognize, breathing in the crisp Delhi air. So there will be challenges that we don't know of. On the credit side of this, at the same time, there's, the economy is growing. It'll be, we were a 1/10 of this size 20 years ago. So if you project it forward, we'll be a much larger economy. Technology is at the cusp of another S-curve style growth, whether it's AI or digital or robotics or, biotech, if you will. So in many ways, no matter which way you look at it, all this, all this progress aside, this is still day zero. The vast majority of India's healthcare system is yet to be built and matured, right? And that is the work that will happen really over the next couple of decades. So how do we tap into all of this? There are many angles to this, and I think we couldn't have put together a better panel, right, to explore various facets of this topic. So let me start then with how do we, in some ways, 10x the access to healthcare, quality healthcare in the country, without necessarily building 10x the infrastructure we have now, right? And what would that look like over the next couple of decades, Joy? I know it's a topic you've spent some time thinking about.
So thank you. And when you say 10x, I personally come from a not-for-profit. So for us, 10x is a taboo. But I have others who are working on 10x, 20x. What is going on in last maybe 10 to 15 years in Indian healthcare, that we have seen there is a huge growth, and growths are driven by the private equity and private funds and investment. If we really need to take it forward, and you have used a very important component of quality in this, what you are seeing that infrastructures have been created, physical infrastructure where we have added beds, but few things in that bed, the capacity what we have created are lacking, like qualified workforce, whether it is clinical, non-clinical, and kind of people who need to be part of that ecosystem. That is not happening. Now coming straight to your question, what we can do. Some of the solutions probably have been tested in last 1 decade and which are working well. How do you take care away from the hospital? You give it at the home care kind of setup, and which is a huge market. But again, unfortunately, I can tell you, very less number of credible providers or other home care service providers are there who are able to meet that expectations. Secondly, even if it is happening, it is not happening maybe in tier 2, tier 3 cities, mostly in the metro where demand is high, affordability is good. Those are the people who are taking it. The second huge thing, and some of the stalls, what you can see outside, the digital health, the kind of AI-based solution which can take care of health screening, primary health, care of primary health care, whatever can be given. All these are going to take away your patients. And today morning, we are part of a session downstairs for the senior care. So today, if you see close to 14 crores population are above 60, and they are suffering with different diseases and all, which not necessarily need to be managed in a hospital setup. And the population in that particular segment is going to touch to 30 crores plus in next 15 years. So if that is the shift in our demographics, then probably some of these plan by the provider or by a separate vertical from the healthcare sector can be created, that how do you manage them at their home? How do you plan geriatric medicine better? How do you manage the lifestyle diseases, which are a huge burden and taking away a lot of hospital beds? And investment in that can strengthen and can make 10 times better access for the population of this country.
Thank you, Joy. There was a lot there, right? So new ways of delivering care, taking care outside of the hospital, better using technology, new kinds of care providers even, right? So somebody's got to pay for all of this, and maybe we'll explore it from a couple of angles. If I can bring in Krishnan on this topic, right? It's been, fantastic growth on the private insurance side over the past couple of decades, but I know that this is a topic you've thought about as well in terms of how insurance, health insurance can become a force for reform or innovation, if you will, on healthcare delivery side. What does that look like over the next couple of decades? What do you think are the possibilities?
Thank you, Venkat. I was just reflecting specifically with respect to not just the next few decades, but perhaps in the more immediate future. There's opportunity, but ultimately for us to scale our respective business models, we need to make sure that there's also sustainability. And today, in my mind, the path that health financing and health delivery are going on is, at some level, from a country standpoint, not necessarily a sustainable path, right? So, and lots of potential solutions, but I just thought I'd zero in on one, which can perhaps provide the ingredient for us to build a more sustainable, economically valuable ecosystem, as opposed to one industry, being disproportionately partaking of the profit pool, or one way or another. And I've sort of seen this pendulum swing both ways across the world, being part of the Bupa ecosystem. And I think the one thing that India is missing today, as far as private healthcare and private insurance is concerned, is actually the consumer. We do have the patient. I have a customer, Joy has a customer, but we don't have a consumer, who's actually acting basis quality, price, signals, right? So I think that we need to figure out how we bring that centrality back for us to have a more functioning, effective, sustainable ecosystem marketplace, if you will, right? So, and on that, I think systemically we can probably do two things. One is, and wherever this has worked better, I can't think of an example which I can say that, look, this is working well, and therefore, is sort of the end goal. But wherever this has worked better, I think one important ingredient has been how pricing works between insurance and provision. And today the pricing in India is essentially about misaligned incentives. Largely it's fee for service. I don't know what the India answer is, but clearly it cannot be only fee for service, or fee for service has to be a smaller part of what happens in the financial flows between insurance and hospitals. So I think that's one. Second is, as I said, in most functioning markets, price, quality signals, allow consumers to make informed choices. I think both on the insurance and perhaps more so on the provision side, we need to figure out how we make price and quality a signal for how consumers, actually consume healthcare, which is too confusing, complex, or entirely absent, as things stand today. I also think there's things that insurance companies can do, and perhaps other large, purchases of insurance, example corporations, which is that the basis of competition in India today is on open products, right? So on the corporate side, there is benefit inflation. Companies choose to inflate benefits, believing that is more attractive from an employer brand standpoint. Our basis of competition has been openness on product, has been openness on network. I really do think we need to go back to the drawing board and look through design elements so that we bring in the consumer, right? So when the consumer sees the bill, as opposed to saying that, hey, my insurance company is going to pay for this. I think the behavior change, and this is again something that's globally validated, is quite dramatic, right? So I think the simple step we as an industry should take. I think on the hospital side, you know, I hear a lot of my hospital friends, and I use the word friends deliberately, say that, look, everything is unique, we can't do this, we can't do that. But the reality is that medicine is a science. And again, I know from how Bupa operates in many, many parts of the world, and my earlier employee, Munich, you know, there are care pathways, there are appropriateness measures of what's the right standard of care for a particular presenting diagnosis. And I'm not a fan of saying that, you know, the healthcare industry requires regulation, but I do think it requires much more robust self-supervision, self-regulation. And I think each time that the healthcare industry got together to do this, to build out a more sustainable ecosystem for ourselves. And last, and I'll pause after this, or I'll stop after this, I think for any industry to progress and scale, you know, it has to do so on a bedrock of standards. You know, financial services is an incredible example in India and elsewhere in the world. But today, whether it's technology standards, standards around data capture, you know, the whole handshake and consumer experience is quite broken. And I do feel it's a lot easier for us as insurers to do that because there's only 27 of us who write the health business. But a lot more complex, I understand, for our friends in the healthcare industry. But that movement has to start in right earnest and much more seriously than perhaps the case today.
Wonderful. Thanks, Krishnan. But in a way, what you've articulated is this end vision, right? That is quality and outcomes at the center. That would make it more consumer-centric. That would align incentives better. But that would require some level of self-regulation and standards and so on and so forth. But the end goal is this kind of different way of competing and different way of focusing the industry. You know? That's great. Maybe let me go to you, Vishal. You uniquely straddle two sides of this world, right? But I'd first love to hear your take on, you know, you yourself have had a thesis on where healthcare should go, and you've leaned into it. I'd love to hear from you anything you would add to, you know, what Joy articulated. How do we go from here to 2 decades from now, where access has to be a lot more, you know, in the way that Krishnan articulated, number one. And then I'd love to hear from you on, as an investor now, where would you put the money? Obviously, the last decade or so has been a lot of consolidation, the specialty and so on. What else is new? Where else would you push, right, over the next couple of decades?
Thanks, Venkat. Thank you for the invite, and CII for this invite. Always a pleasure to be here amongst friends. So let's just take a look at the trajectory that we've covered till now, and also on the back of all the capital that has been invested behind healthcare enterprises and the healthcare sector across the entire ecosystem, right? So we've come a long way, given the fact that our public healthcare spending is relatively low. Demand-supply gap of healthcare is high. How do you sort of bridge the gap? And that's where the capital allocation coming on the private side sort of took on the mantle and created growth, right? So there is no exception to any healthcare ecosystem today on the private side in this country, which is actually not funded by a private equity or a venture capital fund, right? So that's the good side of it, that there is so much of interest in the overall healthcare ecosystem of the country, that there is enough and more capital that is being put behind it for its future trajectory and growth. I think where we started from a sector perspective, obviously all allocation was largely getting oriented towards the big format, multi-specialty healthcare enterprises, and rightly so because of the demand-supply gap on the number of beds in the country. I think what we've seen over the last decade is that almost every healthcare enterprise has used capital to sort of grow in scale, size, breadth across the country. And what started as 1 or 2 or 3 different healthcare systems is now clearly almost 7 to 8 large multi-specialty healthcare provider groups that have sort of pushed themselves across the country, and that's again very positive to see. India has taken a total of about $10 odd billion of invested capital behind healthcare over the last 7 to 8 years. When I look at the allocation of that capital, obviously a large portion of that capital, which is almost about 63 to 62%, has gone behind the multi-specialty healthcare. But an area which I have been very, very passionate about, which is on the single specialty side, we are now seeing the maturity of that with about almost like a 37% of this 10 billion going behind the single specialty healthcare enterprises, which is also demonstrated in the rapid growth that we are now seeing behind the single specialty healthcare enterprises around the country. Now, whether it is ophthalmology, mother and child, IVF, nephrology, urology, we're seeing a whole bunch of specialties come out of the large format and become standalone large healthcare enterprises in itself, which is good. Venkat, as we have also chatted in the past, at AHH, we are now in 63 cities in this country. I don't see any multi-specialty provider which could have gone beyond the top 10 or top 15 cities in this country. So one big area of creating breadth, of creating deeper impact is obviously on the single specialty side. And I'm a big believer that even as we move forward from here, over the next 10 to 15 years or even 20 years, we will see a large proportion of capital pushed behind the single specialty healthcare enterprises. As India transforms into the tier 2, tier 3 cities, we see a big consumption pattern sort of emerging over there for healthcare services, and that's going to be a very powerful opportunity to sort of grow and scale. Out of hospital healthcare ecosystem, Joy spoke about some of this stuff. In my personal capacity in the past, I've tried to build a home healthcare company. Till the time insurance does not become a big play for many of these models to sort of get strength and grow, I don't think that these models will grow. I think that's the job of the insurer. That's the job of creating innovative healthcare products on the insurance side so that these models can actually get some heft. Because India, if you sort of look at the area which is always stifling, is that a large portion of the Indian population still pays out of cash rather than out of insurance. And globally, healthcare has grown on the back of good health insurance products. So I see that to be a big opportunity as we take the trajectory forward, that if the innovation comes on the insurance side, I think there are a lot of other innovative models that will happen. Outpatient healthcare in this country is waiting to get transformed. Like it is in many of the other countries around the world, particularly, while the US is not the greatest of all examples, but because of the fact that they spend 17% of their GDP on healthcare. But if you start picking out models that have sort of worked well over there, I think one of the big and the disruptive one is the way that outpatient healthcare has sort of transformed itself over the years. And I see India needs that kind of a structure. So I think that's where I would actually go and put more capital behind, as long as I see the tailwinds of new insurance products, pushing for innovation, pushing for sustainability. This entire conflict zone that often happens between the health insurance providers and the healthcare providers in this country. And when cost becomes the only way to sort of grow, I don't think that's sustainable too, because when you start looking at healthcare inflation, and on the other side, you don't see any kind of inflationary trends as far as your reimbursement rates are concerned, then it's a lose-lose situation for everybody. So that's another area that we need to really focus a lot more on. So if I were to put it all together, the opportunity that I see in terms of overall deployment of capital in future, I see medtech as another very big one. India has taken close to about, I think, $3.94 odd billion of FDI as far as the medtech sector is concerned. I see that opportunity to almost be 5x of where we are today. Because India needs a lot, and this whole thing around the Make It in India initiative, that should give us a lot more on the medtech side. Single specialty definitely, as I said, will grow. Diagnostics, particularly around niche play, we'll see a lot more of genomics coming into the play. That's an area that I'm, again, very focused on in terms of that seems to be a good play for the future. And then, of course, the traditional multi-specialty hospital chains will obviously continue to get a lot more capital behind them.
Thank you, Vishal. Let me get Rajan. And Rajan, in many ways, you represent the bleeding edge of all these innovations, right? That's where you put the money. Would love to hear from you, hearing all these ideas about where, the real value for the health system is going to come from. What are you seeing at the edges now? But more importantly, what would you like to see, right, come from the entrepreneurs over the next couple of decades to aid these kinds of improvements?
Yeah, no, great to be here. First time at the CII Health Summit. So thank you for inviting me. Look, so, for Indian, as venture capitalists, we are investing in either disruptive technology or new technology or very new business models. I wish we could have invested in these multi-specialty hospitals. I think they made a killing. But that's not sort of what we do, right? We invest sort of idea through IPO, but really we like to invest very early in the life of a company. And as we think about healthcare, so today, for any technology entrepreneur, so let's specifically focus on AI, starting up in healthcare, actually the number one opportunity is not Indian healthcare, right? So we probably have 8 or 9 companies that we've invested in, Indian entrepreneurs building AI companies for US healthcare. And one of the reason I bring that up is I'm hoping that will change over the next few years. And I'll tell you what the constraint is. So we are early investors in companies like Cure.ai, which is in AI for radiology. We are early investors in a company called Twin Health, which has digital twins for diabetes disease management. Companies like Arinthra, which basically uses AI to automate medical coding and so on, right? So our view, by the way, is that over the next 5, 7, 8 years, we will have at least $10 billion Indian startups that are basically building AI startups for US healthcare, because the spending is very large and so on. So I think that's the first big theme. It's not relevant, to this audience, but I thought I'd start with that because it is a massively exciting theme. I mean, I'd put 30% of our next fund into US AI companies if we can find the right opportunities. That then brings to sort of the India set of opportunities from a venture landscape. And by the way, the reason that every AI entrepreneur would rather build for US healthcare than Indian healthcare is because it's very hard to get paid here. You just can't. In fact, I met an entrepreneur outside who's basically providing the entire EHR systems for one of India's top 3 hospitals. And they have a grand total of 2.5 crores of annual revenue. That's like some small clinic in Boston. I can make $500,000 of ACV, right? So I think as the Indian hospital healthcare ecosystem evolves, I'm hoping that the large systems will actually be much more open to investing in technology, investing in state-of-the-art technology. So where are the opportunities in India as we look at it? Firstly, we look at sort of healthcare, life sciences broadly. I would say the first big area is that we've started getting quite excited about is single specialty. Now, it's very hard as a venture capitalist because we can't invest 50 million or 100 million, but we look at things where maybe with $5, $10, $20 million you can get going. We were early investors in Cloud9. Now we've got a few investments. We have a company called Luma, which is a new sort of IVF chain that's being built out of Bombay. The IVF for modern Indian wooden sort of premiumized experience. So we think there's a set of opportunities there. Although, because of the way we kind of like to invest, we want sort of innovative models. We don't want to invest $50, $100 million first checks. There won't be that many, but we think that's a pretty interesting set of opportunities. The second is, new delivery models. So we are investors in a company called Cloud Physician, which is remote ICU, tele-ICU. We'd love to see more of those kinds of models. I think to your question about how do you really take world-class healthcare, deliver it to every Indian who's in every single panchayat, every single village, I think you need models like that. Again, I think the affordability constraint, is a challenge for a company like that. So, guess what? They are now running around in the US trying to get Mayo Clinic and others as customers. But I think those are the second type of models, any kind of technology-enabled remote models. We have looked at a bunch of these home health type companies, but I think to the point that you made, it's just hard to build a large company. You know, it's because maybe that comes back to insurance. So I'd say that's sort of the second model. The third is, as we look at the entire life sciences, medical tech value chain, we think there's going to be tremendous opportunities. We have not yet invested in a medtech company, but we've met 100 of them because we're trying to find, you know, as a firm, we don't want to invest in what we call a local maxima company. We want a global maxima company, right? Like a company that is from India, that can win India, but will at least win half the world, right? Because it's just not that interesting if it's only going to win India over a long period of time, especially if you're a tech company, right? But we think that medical devices, we will start, I think there are already a few, we will start seeing sort of very innovative companies that will meet the needs of India, but also will be able to scale globally. So we think that's a pretty interesting. And then an area where we don't have any expertise as a firm, but I think India has tremendous potential, is just discovery, biotech. You know, BIRAC, I think a few months ago, launched the 100th incubator, BIRAC incubator in India. So there are thousands of companies, but that's a segment where there's not enough capital, follow-on capital, because you actually need deep expertise to invest in biotech. And we as a firm don't have it. And, you know, we will wait until there are a few biotech breakouts before we hire a GP who can actually invest in biotech. So that's sort of what we've seen. I'd say, you know, first and second generation of pure digital companies in Indian healthcare have not delivered the promise, right? And I think there's a bunch of reasons for that. So that's sort of where we see it. But we do see, you know, if you sort of think about fintech, you know, from a venture standpoint and a technology-led innovation standpoint, I'm not talking about delivery models, technology-led. In many ways, you know, in 2015, if you look at fintech, India was not in the top 100 companies on fintech in the world. Okay, and 10 years later, 2025, we account for 60% of real-time digital payments. We are the most advanced digital payments ecosystem in the world. And I sort of see, when I think about it, when I take a technology lens, an AI lens, a technology lens, technology broadly defined, including sort of medtech and so on, I think we're more like 2015, where fintech was. So what that really means is in a decade, you know, we will see dramatic change, right? And we've seen that. By the way, 2015, India had 2 space tech startups. Today, we have 220 space tech startups, right? So a decade is a long time for Indian innovation. And I think we're at the beginning of what we're hoping will be a very, very interesting super cycle for a real innovation in Indian healthcare.
It's wonderful. No, thank you, Rajan. Let me pick up on one thing. Maybe we have time for just 2 short questions. On this question of technology and AI-led innovation in healthcare and how to make it sustainable for India, right? You know, a question to you, Joy, perhaps, and also Vishal, I'd love to hear, is one reason, you know, many of these businesses are not sustainable today, is one reason for that, that currently the, you know, hospitals, players in general are not ambitious enough, taking enough risk in terms of how to use technology for many of these things, whereas global players are, and hence people are chasing after those. Whether yes or not, what can be done to move the needle on becoming more ambitious in non-linear ways of changing healthcare?
So I think I'll not completely agree that providers are not embracing or welcoming this change or technology. In fact, I can tell you from our own hospital example, we have got several of those. I'm not getting into high-end medical technology, but if I talk about AI and other you know, technologies which are helping in terms of diagnosis as well as treatment and even in the non-clinical side operations, we have used many of them. And whatever we have taken forward, those have become very successful also, not only in our hospital, but for the rest of the country. And to give example, out of 7 or 8 of them, 3 of those just entered as a startup, and today they have next series of funding and they may have changed the hand. So that is the kind of growth we have seen. But coming to your question that what needs to be done and what needs to be done to get that further, you know, enhanced, some of the areas I think still we have fear that from the user that it may replace their role. It may lead to a situation where they are role is going to be questioned. If you think about diagnosis in radiology and imaging areas, so there is a fear that if it comes, then we may lose our job. It comes in terms of pathology, that if the slides are checked through AI, then our requirement is going to be less. So the change management, anywhere you get any of this change, you see there is always a resistance, and that resistance comes from a fear factor. So that needs to be explained, that needs to be not only explained, that probably has to be demonstrated by the leaders, that it is just to enhance and augment the human resource capabilities through these technologies rather than making them replaced through these technologies. So I think that is one part of it. Second, sometimes we have a very short-term goal to see this investment, how soon I am going to get the return, how soon I am going to get the payback. We have to have a little longer horizon in our mind, and we need to see that may not be in a year or two, but subsequently it may give us a huge momentum, it may give us huge amount of benefit. So considering these two, if we can consider, probably things will be much better off.
Thank you.
So yeah, Venkat, I think obviously there is a lot that one can do in the AI world, and there is a lot that's happening, I'm sure, and globally there is tremendous amount of impact that AI is creating in healthcare. Two clear areas where we see an opportunity. One is obviously on the ops side. So Agentic AI, which is the way that our call centers are going to operate. We are already trying to implement something over there. I see a great opportunity of automating that. I see a great opportunity of standardizing that entire ecosystem using AI tools, fundamentally because if you want a seamless customer experience, I think that's a great opportunity. As you know, we run the second largest IVF chain in the country in Nova. We now have about 124 odd centers in 63 cities. We just implemented AI on the embryo selection side because that's a big play, right? In terms of how do you sort of go and create the right embryo for an IVF procedure. And I'm hoping to see massive amount of clinical impact based on that technology. So I see the opportunity on either side. I see the opportunity on the clinical side. I see opportunity on the operational side. And of course, as the entire ecosystem of AI evolves and grows, I think it will be more a west to the east phenomena because a lot of that change will first happen in the developed world and particularly in the United States.
No, thank you, Vishal. Then maybe last word, Krishnan, right, to pick up on one of the earlier points about all these innovative care models and so on will not really take off unless there's insurance support for this, right? So what will it take for the industry as a whole to be more open, more experimenting of these new reimbursement models, reimbursing new kinds of care and so on?
So look, broadly on the topic, the two things that Vishal alluded to, example, home health care, and more broadly, outpatient. Until quite recently, one of the big challenges has been GST. Historically, healthcare was exempt, insurance was 18% GST. So our ability to build a customer value proposition fighting against GST plus customer acquisition cost just wasn't there. Having said that, I think we put a lot of effort with your earlier firm, Vishal, as well as with Portia Health. Specifically on this topic of home health. And there, at least in our learning, the biggest challenge was not so much that, look, for us it makes sense. A day in the hospital is more expensive than a day at home. And frankly, we were even willing to say that, look, we'll make it economically neutral for the hospital. But there, the clinician's willingness to take the risk, I'm not sure what it quite boiled down to. I mean, we invested a lot of time with all these companies, right, to make this model work. And I know that it wasn't just us, it was many other operators as well. But for largely, one is of course the GST, which I think was less of an issue there, but more because of, the willingness of the clinician. And we did go clinician by clinician in some of the hospitals, right? But somehow it didn't work. But perhaps now is the time to go back to the drawing board. You've rekindled that thought, in me. And more broadly, I think outpatient is certainly an opportunity that we'd look at quite keenly because we're not battling GST anymore. Having said that, I do think there are other challenges that we need to solve for. One of them being technology. Today, as we all know, it's quite easy to get a prescription for quote-unquote prescription drugs. It's quite easy to get one. And so building a risk, ultimately I have to provide value, and that value comes from when it is a risk-based product as opposed to a discounted product, which I guess is a lot easier to do. But there I think we have to solve for some of these, let me call it lack of technology, lack of, organized players. So I think as we solve for that, our ability to look at outpatient in a much more meaningful way will certainly be there. It is something that we are certainly looking at very, very closely, Vishal.
No, I think, Krishnan, that's where, and as I've always said, that, the opportunity of creating new models for healthcare in India, if we have to just go westwards, it all happened with the power of insurance at the back end. They innovated, Optum, as you know, from United, was almost like a hotbed of innovation around new delivery models. And that sort of took so much of root. While I do understand that there are issues in India which are related to governance, billing system, to quote unquote, not so good practices, but I think we've got to create that ecosystem. If we create that ecosystem, and with the kind of innovation and entrepreneurship that we have in this country, I think we will see multiple new models coming in. And that is really what India also needs, right? Because from an affordability perspective, from a reach point of view, hospital is not the best destination of care. So I think that's really something that we should all collectively drive towards.
Wonderful. No, thank you. On that note, we'll wrap it up. I'm told we're out of time as well, but that's actually a pretty good summary of the discussion. There's a lot of work to do. It will not happen linearly, right? It's an iterative process. You gain some scale, then you can try some new things, and then you can do some more work. But like all of you, I'm looking forward to these next couple of decades of growth, innovation, and change in Indian healthcare. Thank you all for being a great audience, and thank you to all of you for the great discussion.
Thank you, Venkat.
Thank you very much indeed for that wonderful session. May I request all our dignitaries to kindly come forward for a group photograph. Thank you. Ladies and gentlemen, let's put our hands together to thank all our distinguished dignitaries for that wonderful session, interactive session we had. And would request everyone to kindly remain seated as we straightaway move forward with a very exciting session, which is a fireside chat on impact of DPDP Act on care delivery. Give us a moment while we arrange the top table for the next session. And ladies and gentlemen, sorry for the inconvenience, but we would request everyone to kindly move forward and occupy the seats in the front. All those seated at the back are kindly requested to move up and occupy the seats in the front. Thank you. So namaskar and good afternoon, ladies and gentlemen. We now move into a very important and timely conversation, a fireside chat on impact on the digital personal digital protection DPDP Act on care delivery. In today's healthcare ecosystem, data is the new backbone of care. Hospitals, insurers, digital health platforms and telemedicine systems handle massive volumes of personal and sensitive health data every second. The DPDP Act marks a transformational shift in how personal data, especially patient data, is collected, processed, stored, and shared. And our expert for this fireside chat is a leader in cybersecurity, data governance, and privacy framework, Ms. Mini Gupta, partner cybersecurity, data privacy, and GRC technology, EY. A round of applause, ladies and gentlemen, to welcome Ms. Mini Gupta on stage, who has more than 2 decades of industry experience advises Fortune 500 companies, global enterprises, and governments on cybersecurity strategy, digital governance, and privacy compliance. She has led some of the largest data privacy transformation mandates in India, helping organizations operationalize privacy by design. And joining her for this conversation is a senior leader who understands care delivery from the lens of operations, governance, and corporate strategy. Let's put our hands together to welcome Mr. Atulya Sharma, Chief Corporate Affairs and Governance, Clear Medi Healthcare. He's a seasoned healthcare leader, brings deep expertise across hospital operations, regulatory strategy, medical partnerships, and corporate governance. Has worked across national and international healthcare enterprises, enabling integrated care delivery and organizational compliance frameworks. And as we dive into the conversation with our experts, I hand over to Ms. Mini Gupta to carry forward this fireside chat. Over to you, ma'am.
Thank you. Thank you so much. Good afternoon, everyone. Like my colleague mentioned, hospitals, of course, deal with a lot of data, and patient data differently. How many of you have heard of DPDPA, the Digital Personal Data Protection Act? Let's do a show of hand, maybe. Okay? Not too many, though. I was hoping a lot many hands to be put up. So if you look at it, this is an act that has been assented by the President on 11th of August 2023. So we're over 2 years since the act has been assented. But you would wonder what's happening, why have some of the people not heard about it? So we're still awaiting the rules, which will actually give us the enforcement timelines. And it's now about time that we should have the rules very soon, probably within this year itself or early next year, which essentially means that everyone in the country or dealing with data from the country will need to comply with this act. And imagine hospitals in that scenario. We're looking at personal data with respect to patients, of course, and that includes a lot of sensitive information because we're dealing with medical data. In addition to that, DPDPA is not just constrained on patient data, it's to do with any individual's personal data, which essentially means my healthcare provider's data. It means even my partner service provider's data that I have as personal data would come under the fold. And of course the employee data, right? So we kind of probably would not look at it, but employee data is also available in abundance, and we include financial information, all personal details, including family details, when it comes to employee and patient data. So with that as a background, every hospital needs to comply with DPDPA. And, trust you me, we've been through the era of GDPR, which has been the European Data Protection Act. Companies were provided 2 years to comply, and 2 years was not enough. And in a place like Europe, where there is a lot more discipline, a lot more structure, there were enough and more non-compliances, even till date, while it was enacted several years back in 2022, even till date, there are companies that are not compliant. So as hospitals, even if we get compliance time of 2 years, it's not enough. So if companies have not started, they really need to start now. And with that, I'll probably turn towards my fellow colleague, Atulya. Atulya, obviously now, we understand that companies need to really start addressing the agenda of DPDPA. But not many hospitals, and especially the medium and small, really understand what that means. So what do you think are some of the immediate tasks that the hospitals should undertake in this journey for DPDPA?
Yeah. So before I start on responding to that specific question, I think one of the important things that I need to point it out from your introduction was that the data is digital data. So not everything is protected, it has to be digitized. And digitization can happen in primary when it is digitized, or even other data once it is input into an electronic resource or it is subsequently digitized would be covered under the Act. The implementation of the Act itself, even though it has been enacted, is still sort of in some limbo because the relevant regulations have not come in. So that is why we still have the time. And that's why it is important for hospitals to understand, and there is some time for the hospitals to implement. I think now coming to the question itself, one will have to start this by focusing on consent. I would encourage the hospitals to actually do a full impact assessment of the act and the legislation itself to start with. And once that assessment throws out, I think you need to focus on fundamentals about where is the interface, where it all starts. For example, for a patient, it is consent. What are the various kind of consents? You know, there'll be treatment, there'll be consents in relation to third parties, there'll be consent in relation to insurance, there'll be consent for diagnostics, etc. And the consent has to be free. The consent has to be specific. It cannot be one form like we used to have it. Of course, there have been certain case laws that, irrespective of the data protection definition, which changed it, that you need to have specific consent. You can't have a consent which is generic and basically tick whatever requirement is there, and you have one form for everything. So you will need to have an informed consent. You will need to have the purpose for which the you need that consent. So I think that's one of the requirements. The other requirements will be to ensure that you have basically a robust system of security, because I think once the act kicks in, the maximum penalty is based on the security. I think it's 250 crores. So that's a huge impact in itself. And that system needs to be in place. Then there is, of course, reporting, which is again an important, if there is a actual personal data breach, then the board, which is under the act, needs to be informed, and the data principal, which in this case would be the patients, for example, will need to be informed. And, so that those are some of the things that I'll find, I think are relevant. I may have missed 2, 3. So back to you to cover the whole topic, please.
Sure, no, absolutely, Atulya, because, unlike GDPR, which has 6 lawful bases, Indian Act only has 2, which is legitimate use and consent, which is why, like Atulya mentioned, we will need to identify where all can we use legitimate use. So for example, for the purpose of employment, we still don't need consent, we can still leverage legitimate use. In the case of a hospital, if it's an emergency situation, then again, disaster relief kind of a situation, epidemic kind of a situation, we can still leverage a legitimate use. But everything else, when I do my IPD registrations, OPD registrations, consultation, all of those things, all the purposes for which data is being collected needs consent. So obviously having a robust consent mechanism is critical. But what is foundational that every hospital, because having worked with several hospitals, healthcare companies, I can tell you this, what is really foundational is gaining visibility into what the personal data is that we're dealing with, right? So patient data, obvious, but do you know where all this patient data exists? Where all does it flow? I mean, look at it. You have it in your HIS, you have it in your document management systems, you have it in emails, files, folders. You actually also have it in WhatsApp messages. We have medical reports going through WhatsApp messages, left, right, and center. So do we really understand as a hospital, one, what are all the various types of personal data that we're dealing with, whether it's related to patients, employees, third parties, partners, and what are the touch points? That becomes extremely important because one cannot comply if you don't have visibility. So that really is foundational. If nothing, like Atulya mentioned, start off with the impact assessment, assess where we are, what is applicable to us, and of course, start off with understanding or gaining visibility into what is the kind of personal data that we're dealing with and what are the touch points. And when I say touch points, it has to be both internal and external. So what are the third parties that data is shared with? I mean, there are cases where data will be shared with implant providers. There'll be cases where data may be shared with my diagnostic companies. I could be sharing data with other practitioners for probably some specific advice for a complex case that we're dealing with. So it's really important to understand all the touch points, internal and external, as we embark on this journey. And to be honest, if as a hospital you haven't started that already, then it's about time you do that, because that really needs time. So with that, Atulya, maybe, while we're talking about what one needs to start with immediately, how can hospitals really practically integrate the entire concept of governance around data privacy without really overhauling the entire IT setup, let's say? Right? I mean, I know we need to have a robust consent mechanism, but are there steps that we can undertake without really going too big bang on tech?
Yeah, I think it is essential that while we do, as I mentioned, we need to basically adhere to all the legal requirements of compliance, and therefore start from a point of a proper assessment. But it doesn't essentially mean that we need to mechanize and get the latest models or completely revamp our IT structure. So I think one of the important things is that everybody who is involved, the human resource, I think the first point would be to train them. It's not really a cost, additional cost issue. But I think that there is, of course, time and all involved in that. But I think training the people on what is required and what is sensitive will be a key action point. Secondly, I think all the systems that you have for data storage, HIS, etc., in an organization, you will need to assess basically the extent that you already are in compliance. Basically encryption needs to eventually be end-to-end. So, and both in terms of data which is saved on drives and data that is in a movement, and some of the movement, like you mentioned, included WhatsApp. And therefore, one needs to also plan the minimizing data itself, so that the impact of what you collect is limited for specific purpose only, and therefore the access, who needs to access, all of that control needs to be implemented. It's a need to know kind of basis, what a specialist surgeon needs to know. For that he will have access. What a nurse needs to know at a particular ward that she's treating has to be limited to that. So I think it has to be, you need to have controls around who accesses what, and it may not essentially require a lot of automation. There will requirement of process refinements will be there. The entire process, I'm going back to the consent, that needs to be revamped, relooked at. And it doesn't need that everything gets AI-driven kind of consent. I'm not saying that it will essentially mean that we have to completely get into automation. But, there can be physical specific consents that can continue. You could, as the organization, and depending on the budgets of various organizations, there can be automation, AI implemented models that can come in. So I think that's another area that can, and basically leveraging some of the existing technological, which are already there in the system, and the minimal refinements which are required in them. So that's my initial thoughts on it. Back to you, Vinay.
No, absolutely. I think it's foundational. Before even overhauling IT, there's enough and more that can be done, like Atulya mentioned. Probably I'll just add a couple of things to that. One is, of course, to identify who would be leading this governance agenda within the enterprise, right? You need to have identified someone who has the teeth, the authority, and will be able to drive this agenda. Of course, you can take help of specialists, but have that one person accountable within the organization. And then, of course, like he said, you really don't need to change IT. When you're taking registration, at the time when you have the registration form, probably update the format of the form to include your consent options so that that can be taken in. At the same time, when we're looking at extending access, like Atulya mentioned, if I'm giving certain access to a pharmacist, then we should only be able to see the prescription data and not really the patient data. Now, we've actually seen in many cases that when the registration was happening, a lot of additional data was being taken. Things like marital status, things like religion, family-related history. Now, not all of this is really required. So, like Atulya mentioned, assess, when we do that data mapping exercise, you will know, is this data really required? And then optimize it. In fact, as a byproduct, you will also save on probably storage space if there's enough optimization that comes into play. And the other element is, of course, your contracts with the third parties. So now that we know which third parties are accessing personal data on our behalf, without even touching IT, you can go ahead and say, okay, what changes do I need to bring about in my contracts? If not existing, then when I'm renewing contracts or signing new contracts, how do we bring in the privacy-related clauses also? Right? So even before we touch tech, there's so much more that can be done, and minimal cost, in fact, probably no cost also in some cases. So how do we look at those areas is important. So moving on to the next point, probably Atulya, could you share examples? So while we've said what can be done, maybe some sort of a live example to say what is it that certain healthcare service providers or hospitals have done in terms of operationalizing privacy compliance?
Yeah, I'm not in a position to give you exact examples that, the organizations that I'm associated with, but I can generally say that there has been an increasing amount of focus on some of the overall initiative under the Ayushman Bharat framework, which a lot of hospitals, including All India Institute and several other hospitals, have undertaken who participate in Ayushman Bharat. And there is some kind of a digital code which has been generated, and whereby patient data can be exchanged subject to the consent which is given. There is a consent management process which is a centralized repository thereunder, where the people who are subscribed to Ayushman Bharat can pretty much rely on, leverage on. So I think that's one of the areas that has been, to my knowledge, been utilized. Basically, I think that's broadly it. I think back to you, Mini. So maybe you can pick up from there the remaining points.
Sure. So of course, we work back with several hospitals, healthcare companies, diagnostic labs as well. And first thing that they've done is, like I said, they've done a quick scan of what is the data that they're dealing with. It's an Excel-based inventory. Again, not much of a cost, but it's like touching across every function within the hospital to understand what all personal data is being dealt with, and let's inventorize that. And as we inventorize, they've also done some bit of a classification to say, is this identifier-related data, is this health-related data, is this anything to do with financial information, etc. Right? Now, something that's very peculiar and particular in our Act is the children's data. Specifically around children's data, there are several additional obligations, and of course there is a penalty if one does not comply with children's data related requirements. Now that means a hospital, of course, is dealing with children's data. Patients are of all ages. So how do we deal with children's data? How do we identify who is a child versus not? So under the Act, anybody under the age of 18 is a child. Right? So having that also identified in the system is extremely important, because we need to ensure that, while the rules are alluding to the fact that I may not really need consent and I may be able to monitor the health of a child, but I still will have to ensure that the children's data is protected and is earmarked separately or identified separately. So that's what hospitals are doing. The other things that hospitals are doing is really around the awareness programs. So, we know of hospitals who run more than 100 awareness sessions across the board. This includes, their healthcare providers, this includes the nursing staff, the admin staff, including TPAs, and also, of course, the other employees at large. They've also, in certain cases, extended it to the third-party ecosystem to sensitize them, because, again, under the Act, if there's a non-compliance on behalf of a third party or a processor, as they say, the penalties are all imposed on the fiduciary, which is the hospital in this case, right? So it's in our interest to ensure that there is sensitization and awareness spread across. So those are some of the areas that they're doing. Again, limited budget. You can run this internally or with the help of certain specialists, but not something that's a huge cost as such. And of course, they've looked at revamping their privacy notices. So, when you walk into hospitals, some hospitals, you'll probably see notices put up clearly at the receptions, at the various places where registration happens, right? So those are again areas simply that some hospitals have already started, and all within limited budgets.
I think one other point, if I can mention, Minnie, is that using technology which is already available. For example, your Google, etc., QR code related consent forms which throw up, you scan it and it opens automatically, and a patient can populate that without having to spend on extensive, portals, etc., is also one of the things that some hospitals have tried. So, so basically using the existing technology which is already available to its maximum.
And I think coming to technology, possibly one of the last questions, Atulya, is how can technology be used in this entire agenda of DPDPA? And does this also give way or pathway for digital transformation within hospitals?
So I think technology is very essential. So I think a lot of systems are available where, as I said, automation of the consent forms is there, specific to each procedure or process. There is basically the masking of the identity of the patient, which can be easily done by the AI-enabled technology services, and basically access can be also monitored to ensure that the access is limited and is basically focused only the need to know kind of people can actually have access. So I think a lot of checks and balances can be technology driven. The IT team can completely take over that process so that the doctors and other people can focus more on patient care, etc. So back to you, Minnie, on
No,
more
absolutely.
details, yeah.
So while consent management, even data discovery, there are solutions, elements around rights management, data principal requests, all of these can be automated. At the same time, we have these physical forms for registration. You can digitize those. Increasingly, we're seeing maybe investment in portals, kiosks, tablets, where one can digitize the entire registration process so that it's easy to take consent and manage consent also from there on. Similarly, the HIS or the hospital information systems are now being upgraded to be able to have those right data protection measures in place, whether it's access control, whether it's encryption, whether it's the ability of masking or even anonymizing or pseudonymizing data. There is technology that can help with all of that. So this is the time when, one, you can use technology for compliance and governance. At the same time, use this as an opportunity to digitally transform the hospital, because the cost of compliance that we're looking at is quite huge. I mean, technically, if we add up all the penalties, we're looking at a number of around 850 crores, which is huge, and that is the last thing that you want to really bargain with. So obviously those are some of the measures, but just as closing remarks, Atulya, anything else that you would want the audience to be left behind with?
So I think the data flow process needs to be examined very carefully. we need to, and probably we need to have some parallel lines on primary data and secondary data. And primary data being the actual treatment-related data that is required, and a lot of that may be covered in the exception of medical necessity. And the secondary data is where you always will possibly need consent, except for cases where that secondary data is not used for research but actually treatment. So that will essentially also need specific consents. So that is broadly. So I think there's a, one of the things that I want to say is that since the Act is not fully implemented, there are few gray areas which will, you know, with over a period of time, create precedents and set the tone and the implementation. But I think it is essential that hospitals, they do have this headroom, should prepare to implement the Digital Data Protection Act internally and have some responsible people in their IT team or whoever it may be who can drive this.
Absolutely. So thank you so much, Atulya, for your views. And just to summarize, if you haven't started, please start now. The risks are huge, whether it's reputation, financial, or even competitive disadvantage. There are many things that you can do internally. There are several things that won't incur costs as such that you need to begin with. So time is now, and there are basics that you can begin with, foundational elements that we can begin with. So if you haven't started yet, please do embark on this journey because the time is now. Thank you so much, everyone. Thank you.
Thank you.
Thank you very much indeed, ma'am, sir, for that wonderful fireside chat conversation we had. Ladies and gentlemen, let's once again put our hands together as we close the proceedings of this session, thanking both our distinguished dignitaries here on the stage. Thank you very much indeed. And once again, requesting everyone to kindly remain seated. We will be straight away moving into the next. Have been informed we are planning to merge plenary 4 and plenary 5 together. I would request everyone to kindly remain seated with us, and as this would be finally the last session after merging plenary 4 and 5. Thank you. Thank you for being very patient with us. We will just take few more minutes to arrange the top table for the next session. As already informed, we will be merging plenary 4 and plenary 5 together so that we can conclude the proceedings at least half an hour before time. And just give us some more minutes before we begin with the proceedings of the next 2 sessions together. Plenary 4 was reverse panel, patients as partners, the rise of health citizenship, and plenary 5 was humans in the loop, delivering care with intelligent methods. So, ladies and gentlemen, both the sessions have somewhat similar themes, focusing more on the patients now than the doctors. Ladies and gentlemen, the topic for plenary 4 is Patients as Partners, the Rise of Health Citizenship. Traditionally, patients have been as receivers of healthcare services, but by 2047, India's healthcare vision demands something far more powerful. Instead of healthcare telling patients what is right, patients tell healthcare what they need. This transforming dialogue is being led by a distinguished leader and panelist, combining with the next session, which is titled Humans in the Loop, Delivering Care with Intelligent Methods. The session explores how intelligent systems and human empathy must coexist, not competing, but co-creating a healthcare structure. So, ladies and gentlemen, we are ready to go ahead with the proceedings of our final session of this summit, which is a combined session of plenary 4 and 5 for the combined topic of patients as partners, the rise of health citizenship, and humans in the loop, delivering care with intelligent methods. And first and foremost, I would like to invite both our moderators, Dr. Ratna Devi, CEO and co-founder, Dakshyani and Amravat Health and Education. A warm welcome to you, ma'am. Inviting our moderator, Dr. Rana Mehta, Senior Partner and Healthcare Lead, PwC, India. A very warm welcome to you, sir. I now have the privilege of inviting our eminent panelists. I invite Mr. Kiran Gopal Vaska, Joint Secretary, National Health Authority, Mission Director, Ayushman Bharat Digital Mission. I invite Dr. Krishnan Ganapathy, National Emeritus Professor, National Academy at Medical Sciences, India. Warm welcome, sir. Mr. Karthik Rajagopal, Group Chief Operating Officer, Manipal Health Enterprises. I invite Dr. Ashutosh Shukla, Co-Chairman, CII Committee on Senior Care and Founder and Medical Director, Prana Center for Integrative Medicine, Dr. Arjun Dang, CEO and Partner, Dr. Dang's Lab. I invite our panelists, Mr. Madhukar Kumar Bhagat, Joint Secretary, Ministry of Health and Family Welfare. He is on his way, would be joining us shortly. I invite Mr. Prashant Tandon, Co-Chairman CII National Committee, on his way. Dr. Shravan Subramanian, Managing Director, BPL Medical Technologies. Mr. Biju Dominic, Chief Evangelist Officer, Fractal. Dr. Kritika Rangarajan, Associate Professor, Radiology, Dr. B.R. Ambedkar Institute, Rotary Cancer Hospital, IRCH, AIIMS, Delhi. And I invite Professor Neetu Singh, Head of Department, Center for Biometric Engineering, Indian Institute of Technology, Delhi, and Mr. Ankur Jain, Co-founder and CEO, GVAI. So, ladies and gentlemen, we are now all set to go ahead with the proceedings of our final session of the summit. I hand over to our distinguished moderators, Dr. Ratna Devi and Dr. Rana Mehta. Over to you.
Hello, everyone. So this is a very unique kind of an arrangement which has been sort of given to us at the last minute. And both myself and Dr. Rana have decided to be very democratic. So instead of having one panel after the other, we are going to have sort of a combined panel. And I'll start with the introduction of my topic, and I will ask Dr. Rana then to introduce his topic. And then we will move forward with the discussion, as the organizers have already said that this is something that's quite common. So the theme is quite common. I'm representing here the patient voice, and I'm quite happy to see one more lady on the panel. Otherwise, I was going to say that there are two vulnerable groups here. One is the gender part of it, and the second is the patients who are often seen as the, end recipients of the value chain. So they are never asked what they want, they are just seen as recipients. So just to give you a little background on why this panel is important and why we think patients should be partners. In recent years, we have witnessed a powerful shift in healthcare, and from viewing patients as passive recipients of care and to recognizing them as active partners, innovators, and advocates in their own health journeys. This transformation, often called the rise of health citizenship, redefines what it means to belong to a health system. And I'd like to refer to two documents. One is the framework document for meaningful involvement of people living with NCDs by WHO that was released in May of 23. And this year there was something called the social participation, where WHO released another framework document which asked for people, not just patients, to participate in healthcare decisions. So patients today bring invaluable lived experience to design of clinical pathways, the development of technologies, and the shaping of health policy. And when we include their insights, we move closer to care that is equitable, personalized, and effective. Therefore, it means that how we design healthcare, whether it's technology or hospital systems, has to be relooked at and realigned to what patients want. So I'll hand over to Dr. Rana to introduce his topic, and then I'll go with my first question.
Thank you. No, it's a little unique, doing these together. But in India, I think we used to Mahabharata, so I thought this is a good example in action, right? But having said that, I think both the topics are very interesting. My topic, obviously, is how do you keep humans in the loop, right? How do you not become redundant? And predominantly, how do you keep the doctor in the loop? So I think, one of the biggest problems, and most people say, ultimately AI will take over. But what's happened on ground is actually very different. So one of the large academic medical centers in the US, they said, the radiologist will become an extinct species. Guess what? They have actually hired more radiologists. Because what happened is that a test which was done, say a CT, it was reported 3 days later. Now it's reported in 6 hours. So guess what? The doctor's ordering more tests and you need more radiologists. So sometimes it's very counterintuitive. The second component, I think, is that whatever AI does, right, it tells you there is a nodule in the lung, but it doesn't tell you whether the patient is a smoker, it's depressed, or he doesn't even have the money for the treatment, which becomes very relevant in an Indian context. So I think we have a very exciting thing about knowing, how do you keep humans in the loop? How do you make healthcare smarter, better, more accessible and affordable? So that's the panel I'll be talking about. Over to you.
Thank you. So I have 4 panelists, just to be clear as to who's asking questions to whom. My panelists are Dr. Krishnan Ganapathy to my right, followed by Dr. Ashutosh Shukla to my left, and Dr. Karthik Rajgopal to the right of Dr. Ganapathy, and Dr. Arjun Dang to the right of Dr. Karthik.
Yeah, but the answers are for everyone, don't worry.
Questions are for everyone. So my first question to all my esteemed panelists is, digital health and technology are growing leaps and bounds, with AI tools becoming increasingly popular for symptom searches as well as queries about health conditions. Given that low health literacy and even lower digital health literacy in our country, how do you see health data and health citizenship shaping up in the future? Over to you.
I take that question first? Okay. I think I'm particularly qualified to sit here because we are talking of patients. For almost half a century, I have been dealing with patients. But the more important thing is, the first 25 years of my neurosurgical practice, I call it the BC era. So not only the neurosurgeon himself, but the patients, we were all belong to the BC era. In the last 10 years, maybe more and more, digital health literacy has come. In the earlier years, it was not so difficult because it was a doctor-patient relationship. The patient would sit in front of me and I would explain to him there is a growth inside the brain. This growth could be malignant, it's pressing on this part of the brain, blah, blah, blah. Today, what I'm very concerned about is, particularly with AI and all these things happening, we are in an era of disinformation, misinformation, deep fakes, etc., etc. So today, the healthcare provider, in my days it was very simple, I only had to educate the patient. Today, I have to uneducate him. He has to relearn. He has to unlearn. And this is not only the patient, but the doctor as well. So talking of health literacy, it cannot be equated to equal to digital health literacy. Today, we have access, we have technology, and today, my patient has access to exactly what access I have to. He can get Journal of Neurosurgery published last month. But the only difference is I've been trained to understand what is written there. He may or may not understand it correctly. But I'm particularly happy you're having a session like this. I've attended many conferences, but do not recollect any conference entirely devoted to the importance of the patient. If I may just take one last minute, since you're all futuristic, I presume you're talking of the next 5 years, 10 years. Madam and Dr. Rana, I would humbly suggest that the word patient be removed. Patient in my generation was somebody having a problem, a health problem, a mental health problem or a physical problem and physical health problem, and going to a healthcare provider. I foresee that in the next 5 to 10 years, even the big corporate hospitals, Ayushman Bharat, everybody is talking of promoting being healthy. And I presume from a purely ROI point of view, the corporate hospitals of the future are going to make more money by keeping patients outside the hospital by promoting health. So please replace the word patient with healthcare beneficiary.
Thank you, sir. I think that's a nice segue to Dr. Shukla to answer the first question.
So, the healthcare models that we have today have, like the patient, the doctor knows best. That's the, yeah. But now with the changing paradigms, I think integrative health is the way forwards. And that's the only way to empower patients to be in control of their own health. And integrative medicine is a shift from the traditional system that, instead of focusing on the symptoms and relieving the symptoms, we are focusing on health and healing. And that can be best done if we involve our patients in the decision-making process and give more autonomy to our patients. And in that sense, I feel that, we need to have that kind of a shift, because these days we are seeing rising numbers of cancers, heart attacks, and strokes. But the root cause is way upstream. The diseases like chronic metabolic diseases, diabetes, heart hypertension, obesity, high cholesterol, they are the chronic metabolic diseases which, in today's date, more than 50% of adult, either one of the diseases is always there. So, and this number is going to rise with time. So, what we need to do is we need to work on the metabolic dysfunction that is happening to fix that root cause. And that root cause can be only fixed if we address it in a more holistic way.
Thank you. And Dr. Karthik, since you run a very large group of hospitals, where do you see health literacy taking patients? I mean, the first question that I asked about, given low health literacy and even lower digital health literacy in our country, how do you see health data and health citizenship shaping up in the future?
Well, see, with every industry, the consumer evolution is something that every industry is looking for. And in India too, I think once the Indian health consumer starts to get more and more literate, there would be demands on the industry to actually go ahead and, get completely transparent. And I think that's precisely what's happening here as well. And as far as hospitals are concerned, I think today we've actually started to go ahead and take, literacy to a very, very different level. And unlike some other, industry, in healthcare, we can't pinpoint a user profile because it actually transcends a wide cross-section of the society. So for us, in terms of, the way we're looking at literacy, it's both through digital means. The OP consultation room experience has started to become, more and more different. There are some patients who are extremely inquisitive about what's actually going to happen to them. On the other hand, there is a consumer base that actually doesn't understand what they're getting into. So to them, we've started to go ahead and look at digital penetration to be very high in the country today, especially tier 2, tier 3 cities, etc. So the vernacular bit of it, the video and the voice, those are the 3 V's that we actually go ahead and look at, because the consumption is, obviously a lot more easier when you're able to speak to them in their language and in, a video and a voice method. And, demystifying much of the healthcare conditions to make it easier for them to understand is something that we're actually going ahead and doing. It's not only us, but I think most of the hospitals across the country are actually going ahead and doing this, because the industry standard will only improve when consumers start to go ahead and get more mature. And unlike in the West, in India, the literacy around health has just started. And it's actually bound to go ahead and improve in the times to come, and the kind of noise that most healthcare providers are actually going ahead and making. So basically, it's the 3 V's that we follow.
Thank you, and that's a positive future that we look forward to. So, Dr. Dan, you are an early adopter of technology. Also, you are the young physician here. So, how do you see health literacy moving forward in the era of digital technology?
Of course. Thank you, ma'am. Thank you for that wonderful question, and truly a privilege. Although my first time being in a panel that's larger than a cricket team, but I think more the merrier. And of course, when we talk about data and digital health, I always remember one proverb that one wise man once told me, that a compass is useless for someone who does not understand direction. So when we look at India from a bird's eye point of view, today I see that our youth between the age of 15 and 30, about 97% of them are actually tech savvy. That means they know how to use the internet, they know how to use the mobile. But still, about 60 to 70% of the same youth actually struggle with basic medical knowledge about how basic diseases are spread. So I mean, when we talk about health literacy and digital health literacy, I think there is a huge gap that we need to bridge, where digital health literacy basically on top of health literacy would mean that you know how to find the same medical facts, use them, understand them, and of course leverage them for the better of your health. Like we look at other countries, like for example, we look at Estonia. They have 100% of all their citizens who have digital health records. You look at a state like Kerala as well, that has very high health literacy. So I mean, in that entire paradigm, I feel awareness, of course, is key. But even initiatives like the ABDM, where we have some 70, 80 crore records now. I mean, COVID was the backbone of billions of COVID vaccines. So I think that learning curve is getting sharper for us, and so are we. And of course, we'll learn and do better. But this is definitely a gap that needs to be bridged.
Thank you so much, and over to you, Dr.
Thank you. I think that was very insightful. So I think the area we're talking about is keeping humans in the loop. And I'd like to also welcome Mr. Madhukar Bhagat, who's just joined us. So I think keeping the humans in the loop is important because, you know, we don't want to become extinct as a civilization, right? I think one of the biggest component where it comes in, and we've always spoken about what's called the AI fallacy. So they say, you know, basically AI can't do everything because, you know, being a doctor, you require creativity, you require judgment, you require empathy. But I think more than that, data is taking over. But I think the biggest component with that is the safety and trust. So Shravan, I'll begin with you. So it probably take AI about 10 seconds to interpret a CT, but it'll still take you half an hour to convince your mother-in-law that's the correct diagnosis. And she may not trust you even then.
So thank you, Rana. That's a great question. And the day someone invents a chatbot to convince my mother-in-law, I'll pay double for it. But in all seriousness, you know, you spoke about humans going extinct. You and I are both clinicians, and the day is not too far that we might go extinct if we don't keep up with the times. But as a clinician, we're trained to weigh safety against efficacy, and there's always a balance. There are a lot of advantages to many of the tools that are available, whether it's you know, robotics or automation, and now, of course, with AI. And that needs to be balanced against safety. And I'll just share an anecdote. I think it was last year a JAMA article was published, which was comparing physicians versus AI chatbot responses to patient queries. And I'm sure our colleague from GB can relate to this. The chatbot responses rated higher in quality and empathy, right? So it wasn't just quality, it was quality and empathy than physicians in many of the cases. So this really raises a question about your patient trust and safety. I think in terms of technology, generative AI has created tons of new content, whether it's in pattern recognition or clinical workflows. You know, you said you can get a result out in seconds, in real time. But doctors need to find a way to explain this and make recommendations. We also need to secure audit trails and make sure everything is trackable, traceable, and we also need to make sure that a human override is possible. We do have a responsibility to avoid bias and hallucinations. I think that is something where we might be able to afford to take a chance in certain algorithms, like, say, shopping for trinkets, but it's not something you can do for a CT scan or an MRI. And I think we have an obligation to have regular clinical reviews, bias audits, performance monitoring, and so on. And ultimately, you know, patient comfort comes from, trust comes from transparency. You know, we have a radiologist in the mix here, Dr. Kritika, and you know, if I were a radiologist or a pathologist using digital solutions, like our friend Arjun here, we owe it to our patients to be transparent to them and say that we used AI in our diagnosis of your condition. And I think patients will be fine with it. Rana, you and I collaborated on a project 7 years ago on clinical utopia, and we envisioned a future in 2030 where AI was replacing a lot of functions. But here we are in 2025, and it's quite real. I'll just close with an example from a conversation I had last week. Actually, I asked a question in front of an audience to Dr. Devi Shetty of Narayana, and asked him if he saw a future where Devi Shetty, the cardiologist, the cardiothoracic surgeon, could be replaced by automation and robotics and AI. And I was surprised by the answer. To paraphrase, he implied that not only, yes, it's possible, but it's something that he would celebrate because it improves the quality of life and the outcomes for patients. So I think we are on the cusp of something very special. We have to embrace it, but not compromise even one bit on patient safety.
Exactly. So I think, you probably have the doctor who uses AI, obviously the doctor without AI would probably getting stinged. So I think it becomes one of the biggest empowering tool, I think clinical medicine has ever seen. Prashant, I'll go to you. You've seen this for a long time, being one of the largest technology healthcare firms, right? You have an online presence. But increasingly, from a digital, it's becoming a phygital because you see that need for people to interact over a period of time. Because, one of the things we've also seen the growth of telemedicine, but also the decline of telemedicines. Because I think as humans, we're social animals. Remember COVID? COVID didn't spread. We as humans spread the virus. So how do you see this going ahead?
So I think the consumers are not operating in one dimension. So as human beings, we operate in, of course, the physical world, the digital world, and multi-channel interactions is where we live, and wherever the consumers, how they live is how they would avail their services. So at the end of the day, there are certain situations where certain people find more comfort in the physical interaction. Certain situations, same people find more comfort in digital interactions. And then it's a very, I think the business models have to evolve to as we live as consumers. So look at most of us. For certain things, we do feel the physical interaction is actually value added for us. It's a social experience. It's a comforting experience at times. And in certain situations, it's just not. So now, as organizations, or at least a consumer-centric organization, our view is simple. We want to be available as the consumers would like to engage with us. So with that, when we keep that lens, when the consumer is at the center, then it's up to us to figure out how we can serve them whichever way they choose to be served. And consumers optimize for themselves, so they're very smart. So they know what works for them best under what context, and let it be. I think from our perspective, businesses have a simple job: know your customer and serve them. Try and understand how they engage, and the reality, as at least as we see it, is it's omni-channel, multi-channel, and it's that kind of the world we live in. So, and technology enables one to seamlessly move across these various channels now.
No, I think that's there because I think one thing which has changed is, we always spoke about the operating model. Today, I think technology drives how good your operating model is. But it should be an operating model with a human touch, at least in the healthcare space. Biju, I'll go next to you. So one of the things we always fret about whenever there's a new technology, and we have this Gartner's hype cycle, is how long will it take? Adoption is always not what we expect. In fact, now if you look at the US, the last couple of days, they're saying that we probably invested too much into AI. So the markets are falling. So how do you see this adoption happening in a human-centric way?
I think the moment we speak about human in the loop, there is a misconception more so when any new technology comes in and says, if I create a superior technology, of course, it would be adopted. Now, most of you are from the medical fraternity. Anesthesia was discovered within months. I think it just spread across Europe. Antiseptic was discovered almost at the same time. Now, almost 200 years later, how many of you can really say the adoption of antiseptic is perfect? One of the greatest technology that medical fraternity saw just before AI came in was wearable technology. I think from an adoption point of view, if you call it people buying it, millions have bought a wearable technology. But the question is, how many steps the world took extra once they start using a wearable technology? So creation is not equal to adoption. Adoption is not equal to behavior change. So I think we have to believe that, as we developing technology, we also need to develop all the other aspects to develop adoption of that, and not just for the consumers, even within the hospitals. How many doctors, how many of them would be willing to forego what they were doing before and they'll say, let me adopt this particular technology. So at Fractal, we have actually, for example, Cure.ai is actually possibly the most used AI product in the world. 108 countries use that today. But one of the things we have done for our teams is, along with the technologists, we have people with human behavior expertise and designers in the same team. Because for us, we know unless technology combines with understanding of human behavior and design, you're not going to create adoption. And one more point I just want to mention, especially when we're talking about AI and machine. Is the relationship that I have with a machine, is it the same as what I had with a human? More so when things go wrong. It is not. Because I judge a human because of the intention of that human. I always judge a machine because of the results. And that is why a machine, AI, cannot afford to make even one mistake, because that one mistake will be so magnified. It's just to prove that cut-pasting our understanding of human-to-human relationship in the medical world and then putting it into the human-to-machine world is not going to work. We have to think very differently.
Excellent. I think those components become, and the whole idea is, are we becoming more machine-like? Because, you hear the word longevity. Longevity was only used for inanimate objects till somebody picked it up and say, durability and longevity were for inanimate objects, but now we are saying, okay, we all want to live long, right? Obviously, if you have $1 trillion paycheck, you need to another 100 years to spend that. So, unfortunately, most of us don't have that problem. Ankur, I'll go to you. So, I think in healthcare, we have a very peculiar business, right? While we say it is a B2C business, it's actually a B2D2C business. In a way, when I ran a hospital, and Karthik will bear me out, our customers are actually the doctors. The patient tends to be an incidental consumer. How do you empower him with this new technology so that he really knows that when he's part of the system, it's a balanced relationship, not an information asymmetry?
Thank you, Rana. Just to give you context, I'm the founder of GV. It's a new startup. At the core, we are building a health superintelligence where we are creating a digital health twin, taking a lot of data that you are generating, including variables, including your diagnostic reports, and we are creating a picture around it. And then we are creating a health plan based on your real-time data. So what we are seeing is that that data is very useful for the doctor also. Because right now, doctor-patient conversation happens only once, right, when you see, or over telemedicine. After that, there is no conversation. Many times doctors want to follow up, but they don't have time. So the way, our approach is that doctor should be in the center, but patient is not the periphery. They should be treated equally. And then they are having a meaningful conversation. And that is what we are building at GV. As Prashant said, that consumers are smart, right? So patients are smart. They know what to do. They can extract information from the doctors also. Right now, it's only one way, like a doctor's giving information or prescription to patients. With what we are seeing at GV and with millions of users, there is a healthy dialogue between doctors and patients.
No, I think that's, how does this digital twin work for you? I mean, how successful? Because this was being tried everywhere. It's been a bit patchy. What makes you different?
First of all, we don't have the baggage. A lot of people have tried and they have done a lot of work. the technology was very different. 10 years ago, 20 years ago, 30 years ago. We started from AI era, right, last year. So we are using some of the cutting edge work. In fact, our accuracy of digital twin is the highest in the world with close to 95% accuracy. Means whatever doctor is saying, our digital health twin is also saying the same thing, right? And the earlier approaches of digital health twin was is one way. You have to put a lot of devices on a person's body. Right now, we already have many of those devices, either in phone, in our smart ring, or wearable watch, or on their phone. So, in 2025 or 2026, it will be much easier way to build a digital health twin, which will really impact the outcome of the user. Earlier, it was more of a research or a PhD topic. Now we are seeing this creating big impact everywhere in the world.
No, that's great. So it'll be great to have a twin with you to know what's going to happen to you next 5 years. Kritika, I think, one of the things we spoke about, they always have spoken about the demise of the radiologist. Fortunately, unfortunately, it's not happened, right? So you're still there with a job. So how do you see this working out? And then, at AIIMS as an academic institution, we have very few academic medical centers in India because the private sector just limits itself more to the delivery of care. So truly, there are very few academic medical centers which have both the delivery, education, and research. What are those areas which you're looking at as you go ahead?
So to your first question, thanks for that, because I'm often reminded of this meme that shows how we all thought 10 years back, maybe 5 years back, that radiologists are going to be extinct, and with self-driven cars, drivers are going to be extinct. And then 5 years on, you see enough radiologists driving to work. So neither really happened. So yeah, of course, I come from an area of work which was declared dead about 10 years back. Right? So, but then so many years on, it's also interesting that radiology has also been declared dead about 6 times in the past. So if you look at the history of radiology, it's not an old subject, right? It's about 50 years old. But when you look at when MRI came in, for example, people believe that now you can see images so well that why do you need a radiologist to really interpret these? But cut down to now, 20 years later, there is so much more information. So I think the first thing that I want to say here, the point I want to make, is that when you add more data and you add more data points, it becomes more complex, not less complex. So what I do today is very different from what I will do 10 years later. So we need to evolve. But does that put us out of job? I think we are very far from that point in time. So, and that's true across the board. It's not just radiology, it's spread to so many other areas of medicine, so many areas of general life in general, right? So we must really embrace technology and, again, keep the patient at the center, or keep the world and the community at the center of what can be achieved, and that's when we'll create a system around it. On the second question, thank you for that, because, yeah, absolutely, so we are trying to create a whole environment around really we need to educate our younger generation, and their education needs to be very different from the kind of education that we've gone through. So what is it that they need to know, and what is it that they don't need to really know? I think we need to define that first, and that's something that we're working on. And again, on the piece on, how can it really reach out to patients? How many of all of us have undergone any radiological modality, right? Almost all of us. How many of you have really met a radiologist? Probably none of us, right? You just get this paper full of jargon, medical jargon, which is uninterpretable, and then you're often Googling it. So we said, why don't we change that? And why don't we do a doctor-patient conversation, record this, transcribe it, and then the report gets auto-generated. But we've utilized the radiologist's time in explaining the findings to the patient. So that can we give the patient some face time with the radiologist. So it's not necessary that technology is taking you away from from humanity. If we use it well enough and innovatively, we can actually restore that human touch to medicine. that
And I
possible.
think more than anything, restore the trust which gets lost because, healthcare has its various paradigms, including commercial areas, which needs to exist. But, over a period of time, I think that trust has got lost in the last 3 decades. Professor Neetu, I'll go to you next. I think one of the things, again, you're from IIT, is that people think even in India, we are really not there where others are. Everything either originates from the US, or suddenly you got DeepSeek in China, and we say we are the superpower of the world. So how do you look at, as we are going ahead, what are those building blocks which are being put in place so that, 10 years later, we don't think that a Chinese patient has a better algorithm than we have?
I was hearing all the conversation and, it was very interesting that wearable electronics was talked about. And the way we look at it as a technologist who's actually behind the scenes of whatever the doctors are using is we're building technologies, we're building algorithms, and what is the source that we are feeding in is data. So the biggest challenge for us is actually getting good quality data. And when I say good quality data, remember, all the countries are quite sensitive about data. Everyone is now thinking that they have a lot of data, of course, thanks to wearable technologies that we've collected a lot of information about people in the past decade. We have longitudinal data also for some aspects. So we feel we have very good data. The reality is we do not, because we do not have multi-parametric data for the same patient. There are a lot of complexities which are involved in the data. So we cannot actually take technologies or algorithms which are written on, say, different populations, because we don't understand whether it will work for our patients, right? So that's one challenge that we are facing as technologists, because we don't have even data to train our algorithms. And if you don't train them, of course, you're not going to get the right output. The second thing is that, what are the scientists looking at? We are trained engineers, scientists. We are looking at engineering features. We are looking at scientific features in the data, which is not as simple in biology. Biology is more complex. I think medical data is more complex than just slopes and, like patterns, some patterns, right? MRI image is going to give you different patterns, different diseases, and that's where the human comes in. It is actually not, you just cannot replace the intuitiveness of the doctor, which the person has gained from their experience. The best doctor actually is very intuitive, looking at multiple data, like multiple imaging scans, family history. They always look at multiple parameters. We don't have those in our algorithms. So there is no way we can actually put it, because we don't have the starting point. We don't have those data at this right now. So I think India is moving forward with collecting the data. I think most of us, the hospitals, the companies, what we are very happy about is we have a lot of data. So, which is good, and now they can be given to the scientist, and we can actually prepare our algorithms. We need to train our engineers to talk to the medical doctors to understand what features should we be looking at. Remember, the algorithms are being written by computer scientists, the algorithms are being written by electrical engineers. They probably don't understand biology that well. And it's, as I said, it's not just slopes and patterns, right? So I think that language learning in terms of just talking to the doctor is very important. And today it's the most important, critical part. Talking, the doctors and the engineers working together is very, very important. It's not like wearable technologies where the doctor said, I want the signal, and can you give me the signal? That's the conversation we always had with them. Here we have to sit down, and this is the pattern we are seeing. What does it mean? That kind of conversation needs to be done. So I think that's the challenge we're facing right now.
Yeah, and I think they're the biggest challenges that healthcare is also very siloed. It's private sector, public sector, it's urban, rural, and you'll get very different data from every data set. The accessibility, the affordability, all those are components which go into treat. Yeah, so I think it's very siloed in a lot of ways. I think this has been great. I'll ask Mr. Madhukar Bhagat, he's been listening patiently. And so I think a lot of areas of what we need to do as we go ahead, because this becomes very important. Because if you look at, and I often get asked, what's the whole business model of healthcare in India? Models are at private sector, public sector. But in India, we have probably every model of healthcare which exists. We have components of the NHS, we have components of the US healthcare system, we have Europe. But again, I think if we were to put it together, ultimately we need to have a technological access to care. I mean, it won't be a good generalization, but something like a UPI of healthcare, where ultimately an empowered patient knows what he wants.
Thanks for the remarks, but what's your question?
No, I thought you've listened to everyone, so I would want you to just put your views of how the government is looking at this component.
So the larger objective of today's discussion, I think, is the human in the loop and how government is looking at. See, government is an institution, government is a ministry, government is also a department, and at the end of the day, the government is also a set of institutions and individuals like me and like Kritika who are playing a role in the government policy formulation. Now, if I talk about a bit in detail about this concept of human in the loop, how is it affecting or how it is being absorbed in the system, let me give a relative example. I walked in, saw my watch, and I told myself I'm 20 minutes early because my session is to begin at 5. But then I'm told that the sessions have been merged and therefore I'm late. So there is a concept of relative. I thought that I'm going to be the opening batsman, giving the analogy my friend used of a cricket team, but here I enter as a 12th man, despite being early. So therefore, it's a relative. Now, the very concept of human in the loop and whether humans are going to be replaced by technology, we have to see from the perspective of relative. There are 4 relative parameters which are involved, and be it the government, be it the private sector has to take that into account. The first relative parameter is the relative efficiency. And you would agree that whether today AI has a relatively more efficient diagnosis as compared to the best humans or not, that is a factor for consideration, whether humans will remain in the loop or not. Second factor of consideration is the relative trust and therefore relative acceptability, as my learned friend over here decided to point out. If there is an increase in the efficiency, then there is a automatic trust which is generated, and there is an acceptability. Initially, that acceptability is based on the trust, and then later on the trust becomes automatic, and we start accepting without even questioning the system. Let's take example, the search engines. Today we search whatever is thrown by Google. Okay, this must be fine, but there are biases in it. And if you go through the competition law, the Googles, the search engines, it is indicative of the biases which has been created by the variety of search engines. The third relative parameter is the relative parameter of availability and affordability. And affordability brings us to the fourth parameter, which is the cost parameter or the relative cost. And therefore, when we talk about human in the loop, all these 4 parameters have to be considered. There may be a situation where there is a AI which is more efficient and you would like to adopt it. But supposing the cost is so prohibitive that I would like to go to Kritika, right? And I will still think that the AIMS radiologist is my best because not only the cost, because of the fact of trust. I trust her. I still have not enjoyed the trust of that particular machine because I don't know what is going behind its development. Has it been developed? Has it been developed by using a model which is based on 1,000 data sets? Or has it been developed by using a model which is based on 1 million data sets? Ask any expert and the results will be different. Who is having a look that whether the model has been developed correctly, right? The data sets, they are not just numbers, but there is a geographical spread. There is a spread across time, across various ethnic groups. So who is going to verify to gain my trust as a user that data sets are fine? Is it just because it has been developed by Google or GVAI that I should trust it? So from the efficiency, I move to the relative parameter of trust, because that is going to begin and incorporate acceptability. But availability has also to be there. How do I access it? Accessibility and availability, both are interlinked. And the relative accessibility and relative availability, that has to be taken into consideration. If I can access a doctor, which is very easy, but I have to download an app, I have to have a high-end device, which may not be correct in the future, then as an ordinary patient, what am I going to prefer? And last but not the least, the cost element is always there. And the cost, we don't have to see only in terms of the direct cost, which is the consumer cost. We have to see in terms of the indirect cost, the social costs. And all these parameters must go in mind of a policy planner like me, who's entrusted with this responsibility. Now, what are the 4 other parameters that I would like to have a look as a policy? Today, if I look at my AI solutions, which I am developing along with AIMS and 2 other centers of excellence, humans are in the loop. For example, we have the eSanjeevani, on which the clinical decision support system is there. 20 crore clinical decision support systems diagnosis have been given. If we have a look at the diabetic retinopathy being developed by AIMS Delhi, then again humans are loop. They are actually consuming, the doctors are consuming the data and then telling the patient as an aid. If I look at radiology solutions, the chest X-ray, etc., it may be a situation that maybe some years down the line they become more efficient than the humans. Today, in all the solutions, humans are in the loop. But if I take all these parameters together, then what is the government has to do and what is the private sector has to do? The first of all, there has to be legislation and regulation. That is the first aspect. Because as I said, efficiency will also depend on the factor that how the model has been developed. Second thing is ethical areas of regulation. Which are the areas where you can press in, you can come in? Who is competent enough to enter that particular area? And here again, the humans in the society have to be in the loop. Third area is the area of security. Now, when I talk about security, it's not just about the pre-development security, the threats which are ominous as far as any IT platform is concerned. And by the way, AI is definitely an IT platform. There is no doubt about it. And also, there are issues pertaining to post-model corruptions. Data poisoning issues are there. Again, the humans have to be very much in the loop of correcting. I should have a separate model which has not been used. That's how I would like to design my system. And 3 years down the line, I'd like to compare its results with a model which is already in my use. So that there is a comparison whether my model has been corrupted or not. And these are some of the areas where the society and governance has to come in picture and where private sector has to come in picture. Which are the ethical areas that you have to decide? How much is that particular data which has to be consumed? If I have a model which has been developed in Europe, should it be suo motu and ipso facto be applicable in India? Because it's developed by Google. That's a valid question. Who's going to answer it? Is government going to come in between each time? Is all the responsibility of the government? Or do we have that private institutions can develop like the Slow Med cities or the ISOs which can guide and regulate the society? So these are some of the questions which I am leaving before this August gathering to ponder over. Humans in the loop does not just mean the fact that eventually between the AI solution and between the patient there is going to be human. The system is developed by humans. It is by the humans, for the humans, and of the humans to sum it correctly. Thank you.
No, excellent. I think we're very good insights on, the building blocks which the government is putting into place. Because I think, and like Professor Neetu also said, I think you really need the public-private to be together in this because, otherwise it would diverge. Because we're seeing, as long as the services are concerned, they go on different tangents. But here, I think what you really said, ultimately we owe it to 1.4 billion Indians to have an impact on basic thing on healthcare. So I think, thank you very much. I think that was really very, very insightful. Do we have time for another question, or should we open it to the audience?
I think we have tested them enough. They are very patient. We should allow, them to poke some questions at us.
Yeah, so we can open it up to questions from the audience. Please, if you can stand up and identify yourself, and then
Otherwise, they'll start interacting with the AI.
yeah, if you feel you don't have a question, just check it out on ChatGPT. Yeah, why don't you go ahead, right?
Hello. Yeah, I'm Dr. Santosh. I represent the Health and Mental Health Subdivision of National Human Rights Commission. And a very interesting double panel here. So my question is basically to all those of you who are designing these very, very large AI platforms. And of course, we're talking about futuristic health. Most of the times, the most underprivileged and at the bottom of the pyramid, those people don't get represented in many, many voices. Their voices are unheard. Even in the AI, it might not be unheard of. And when we are building these tools, many times, and I really appreciate the government representative, Mr. Bharat, that until and unless your database is quite large, diverse, geographically relevant, you don't get these very, very representative. How quickly are we implementing these AI platforms into business and also for implementation before testing it enough? And we are seeing many, many AI platforms now already in business, getting funding and also taking diagnosis into their hands. So is there any system or is there any regulation, and how strong can we have this regulation until and unless it reaches a representation? Yeah. And
I think we got that question. So I think you're right. One of the things, and I'll ask Mr. Bhagat only. See, I think one of the things as it's happened is, and post-COVID, we've clearly seen that the Gini coefficient in India and globally has changed, right? The richer become richer. Now, the access to technology is also a component which can actually keep you healthy but make you even live longer. So what are some of the safeguards? Because if AI is for public good, it should be for every citizen.
So you're quite right on that. If you see the government initiatives, I initially thought that it was a monologue lecture that I would bring a PPT to show what are the government initiatives. But I would just like to share that through public-private partnership and IT support of Vadvani, incorporating the inputs we have from the IITs and IISc, government is definitely in the health sector developing AI models. There are 3 centers of excellence, AIIMS Delhi, Kritika is working over there and she's the lead over there. We have AIIMS Rishikesh and PGI Chandigarh, where various models are being developed. And these definitely take into account the social inclusiveness. I mentioned about the clinical diagnosis support system, which is on eSanjeevani. Diabetic retinopathy developed by AIIMS Delhi. This is launched as a pilot in 11th stage, and it will be a part of the National Health Mission. That is the objective. We have 3 AI solutions, which include Cuff Against TB. We have 2 other TB solutions, which are already integrated. We have other solutions which are already in the way, which include breast cancer solutions for radiological diagnosis, as well as for macular degenerative diseases, as well as areas like ophthalmological solutions, as well as dermatological solutions. The idea behind these is that eventually at the government level, these are wholly funded by the government. These are established as digital public goods. And through the government mechanisms, these are available to the public as a standalone projects or through the national health missions also. So to that particular extent, yes, inclusivity remains at the cornerstone of every work that government is doing. And that can be taken as given that definitely that element will be taken care of.
So just to follow up, Ankur, you're building a platform. Has this come to your mind that it should be inclusive over a period, because, it's not the accessibility should be limited by affordability?
Absolutely. I think that is one of the reasons why I changed industry from fintech to healthcare, because we wanted to democratize healthcare. Right now, all of us will have access to very high quality doctors. I come from family of doctors. We can easily reach out to anyone, but people all over the world don't have that. For example, in US, it can take 60 days to get an appointment. In India, in rural areas, it's not that easy to access high quality. So to answer your question, right, we are working on the inclusivity or localization from day zero. You can't build a scalable platform without taking all possible factors. So it's a given, right? It may not be perfect right now. It may take some 1 year time, 2 years time, but you have to give us that time. It's a new technology, right? I think the expectation is, oh, this is not working right now, so this must be bad. We need support from everyone in this room, right? And government is doing amazingly well. For example, till last year, I didn't know about eSanjeevani, but I would say eSanjeevani is the best healthcare program or AI program in the world. Not like we may not have used it, but millions of people use it every day. So that is AI, right? So inclusivity is very important, and all of us are thinking it from day zero.
Biju, you wanted to?
Since we are talking about inclusivity, I just want to remind, as government is doing some brilliant work, institutions obviously are doing some amazing technology, but what is the final interface that we have with, which is extremely exclusive? And that's where India has a huge advantage. We have the largest penetration of possibly the smartphones in the world. And I think the more we understand the smartphone as a medium, which is for the first time an always on, always with you medium, we will be able to transfer a lot of some of the brilliant technology we make into a very accessible, inclusive population scale part of it. I can go on, and we do a lot of work in that area. A lot of people think it is another television screen, small. No, it's completely wrong. We can't cut paste our understanding of television onto the smartphone. The more we understand smartphone, better will be our inclusivity for a lot of the work that we're doing.
No, I think that's important. And one of the things which is coming out is that we're not only building for India, I think we're building for the global south, because, this is replicable. Ultimately, entrepreneurs here have a boundless opportunity in a borderless world. Yeah, the next question.
Yeah, Dr. Rana, just 1 minute. I mean, we talked about inclusivity, but I think we need to talk about, care continuum pathways and integration of healthcare services as well. I mean, the examples that we heard just now is about vertical silos where certain solutions work. And human beings are not homogeneous. They are all different, they are all unique, and each one's journey in their healthcare pathway is very different and unique. And at the end of the day, when you make platforms, it's data that you're using. It's not patients driving those solutions. So I think somewhere we have to bring the patient into the drawing board, not as the end user of the platform that is made from data points that are collected because they are users who are giving data to the healthcare system. And, moving on from that, how do we get integrated healthcare solutions? And it's not just modern medicine. We also have very good Indian systems of medicine that could bring good benefits. And maybe Dr. Shukla could add a little bit to that.
We at Prana run a very unique system. We have a joint meeting of the allopathic doctor along with the Ayurvedic doctor and the mind-body medicine doctor with the patient. And along with it, we bake in Twin Health and we capture their data points And this journey through the year is a very handheld journey wherein we are constantly in touch with our patients. And believe you me, the patient outcomes are fabulous. In the last 1 year, we collected 1,853 patients, and we published this data in Nature. And we found diabetes reversal in 89%, and we found diabetes remission in 94% patients. So it's all about, partnering with our patients, giving them full autonomy, and also letting them understand where we are heading and what is right, what is wrong. So it has to be done very meticulously and very carefully because every individual is different. The biology and the behavior of every human being is totally different. How he reacts to a particular food is different. What are his likes, dislikes is also different. Some people don't like yoga, some people like more aerobic, some people like more yoga. So you have to literally go into the depth and then craft out a solution for him. And because the food industry has advanced, there are so many changes happening, and in fact, the genetic chromosome of people has changed over time because of the fast lifestyles that we lead. So it needs a lot of inputs and wisdom to understand and help our patients reverse these chronic lifestyle diseases.
So we're talking of patients owning their health and making solutions based on their ownership of health. So Dr. Dang, you said something about Alzheimer's and how patients can self-test themselves. So can you speak a little bit about that?
Of course. Thank you. Thank you for that very interesting question and something that I'm very passionate about. And inspired by my last days with my dadu, my granddad, when he had dementia. And that time I decided I have to do something cutting edge in this space. Because, when we look at dementia and the lion's share of that, of course, being Alzheimer's, there is absolutely no way of screening or diagnosing it unless it's a CSF analysis or say it's one of those amyloid PET scans that are hardly available in India. So what our team set out to do was create an ecosystem where it's just not one test just giving you values that you don't know what to do with and the medical jargon that comes with it, but to create an ecosystem that starts in the palm of your hand. This starts with a simple 15-minute quiz where you join some dots and it tests your memories and your memory and basically gives you a brain age score based on 3 broad verticals. The first one being attention, memory, and your executive function. So if your brain age is more than your chronological age, that is when you go on to the next step of testing for Alzheimer's, and that is India's first FDA-approved biomarker from a simple blood test. That is the ratio of p-tau 217 and AB4042. So then basis that, you get a result, and then basis on that result, you are diagnosed if you have Alzheimer's or not. The thing about this test is that it has a very high negative predictive value. So to rule out someone who has a mental cognitive decline, if they have Alzheimer's or not, it's really helpful. But also we go one step beyond. If someone is positive and needs to confirm that, then we also have an exclusive test that is based on a proprietary algorithm that gives you a definite answer about a yes or a no, all without any kind of CSF analysis. And basically there was a publication in JAMA that talks about how primary and secondary healthcare physicians could diagnose Alzheimer's at about 60 to 65% without any such diagnostic tools, and this goes up to 75 to 80% with the use of these blood-based biomarkers. So I think this is very transformative in the space of Alzheimer's, and I think in India the narrative has always been post the pandemic that check your liver and check your kidney and check your heart. Our narrative is what about brain? It's the most important organ.
Thank you. And I think somebody had raised a hand for a question.
सर मैं नमस्कार, मेरा नाम वैद्य दीपक है। सर मेरा एक क्वेश्चन है कि राइट नाउ 2025 के अनुसार WHO के डाटा के अनुसार कि अभी हमारी ऑल ओवर इंडिया की एवरेज एज है 29 इयर्स और 2047 में हमारी इंडिया की एवरेज एज 49 इयर्स राउंड होगी। तो जो एक रिसर्च रिपोर्ट भी ये बताती है कि स्ट्रोक जो है कॉमन एज 49 एज के पास होता है। इट्स मीन्स 2047 में तो हमारा जो इंडिया की जो सब पॉपुलेशन में सबसे ज़्यादा स्ट्रोक होने की संभावना ज़्यादा है। तो मैं सर से भी सभी लोगों से जानना चाहूँगा कि स्ट्रोक को रोकने के लिए हेल्थ केयर या वेलनेस में क्या क्या तैयारियां की जानी चाहिए कि जिससे कि आने वाले समय में भारत को स्ट्रोक के आने की सुनामी से बचाया जा सके?
So actually stroke is the end result, it's the complication. We need to work backwards. We need to do a lot of wellness and prevention, leading healthy lifestyle, having good sleep habits, exercising well, eating a balanced, nutritious diet. All these things consistently over a period of time, they will help us prevent diseases like stroke, making sure your sugars, pressures are absolutely fine. So it's a kind of comprehensive thing.
So, sir, absolutely agree. Just one line. So, there's a blood test again, and this is not marketing, just awareness, but it's called an LPPLA2. That's called a plaque test that we just launched a few months back. And basically, it's a simple blood test where it tells you about the inflammation inside your arteries. In other words, how unstable are the plaques inside your arteries. And we hear of all these horror stories where someone young went to the gym and completely collapsed. I mean, there are other modalities, but of course, from a blood test to know what is your predisposition to having such an event would be the LPPLA2 test. And I think anyone with a genetic history or anyone on statins or with overall clinical indications, such as what you were just saying, sir, I think they should go on for this test, and that would be very precise preventive care in the case.
If I can just add one point as a neurosurgeon, taking off from what you said, it is very sad that today, every day, at least a few hundred strokes are occurring purely because the public and doctors, many doctors think blood pressure should be 120 by 80. The most disastrous thing you can do for an 80-year-old or an 85-year-old is to reduce his BP to 120/80. The most disastrous thing you can do is to reduce the blood sugar to 100/120. An 85-year-old, you do not call him hypertensive unless his blood pressure is consistently above 150 diastolic and 104, 106 diastolic, 150 systolic, etc. Similarly, blood sugar of 140, 160, 180 does not require to be treated in an 80-year-old. Medicine has to be personalized, customized for the individual. And this is where health literacy comes, digital literacy comes. Medicine is not mathematics, it's not black or white. It's various shades of gray, and I totally agree with you. It has to be personalized for the individual.
I salute you, sir. You are right.
I think, we are running a little out of time, so the organizers, would you want to give the concluding remarks, and then I'll say.
Sir, one last question. One last question. Yeah, one last question, sir.
Yeah.
So, as a human being, getting easy medicine access is the biggest thing. But nowadays, we are getting everything in minutes, but not medicine. So, what fundamentally wrong with us? Like, everything we are getting in minutes.
Yeah,
so,
ask Prashant, he'll get it for you.
So, this question is for everyone. See, we talk about AI, we talk about data, but no one talks about supply chain, because that is the main crucial thing for any organization to run.
Right. So we'll take that point. I think we've run a little out of time. Would you want to conclude, and then I can say something?
Thank you. And we started with, patients driving their decisions, and then we moved to humans in the loop, and how humans have to be there embedded at every decision stage. What I would like to the audience to take away is humans are still not in the loop, at least not at the drawing table, at least not at the ideation stage. They are still consumers, and I think we need to move away from that consumerism, because at the end of the day, whenever you make technology, it is for markets, it's not for humans. So let's look at humans and then make the technology. We don't need so many apps. I think it'll work better and much more efficiently.
Yeah. No, I think that's true, but the economic imperatives have driven clinical care, so we need to also be cognizant of something which is scalable, replicable, because it's not a utopian world. But I think the takeaway for me basically was, if you look at the future of healthcare, I think it's greatly amplified by AI, empowered, it makes it faster, sharper, more precise, but let's all hope it's still deeply human with a human touch. I think that will really count as success for India. I must thank everyone, all my panelists. I know we have a Mahagathbandhan here, but it's the first time I've seen so many people, but I think we really enjoyed. I think all the insights were great, and thank you for being a wonderful audience.
Thank you.
I think this was the most homogeneous cricket team, and the captain and the vice captain did not disagree. So thank you all for staying with us.
Thank you very much indeed. And ladies and gentlemen, before we close the proceedings, we had the privilege of having with us in this session Mr. Madhukar Kumar Bhagat. He is the Joint Secretary, Ministry of Health and Family Welfare, and I would request Dr. Rana Mehta to kindly do the honors of felicitating Mr. Bhagat with a small token of our gratitude and appreciation. I would request you, sir, to kindly come forward and kindly receive the small token of gratitude from us. Ladies and gentlemen, a huge round of applause for that. And we would request all our dignitaries to come together for a group photograph. That's a big group, certainly. And ladies, kindly step forward, everybody, if you could. If everybody could kindly step forward, please. So, ladies and gentlemen, as we come to the close of today's event summit, we extend our heartfelt gratitude to all our distinguished guests, eminent speakers, partners, and delegates for making this day insightful, inspiring, and truly, truly meaningful. Your presence and your participation has shaped powerful conversations that will continue to influence the future of healthcare in India and beyond. As we officially close today's program, we invite you to continue the conversations, this time in a more relaxed and joyful setting. We invite you to join us for gala dinner, which is served outside in the lawns. And once again, on behalf of CII, we thank you all for your time. Ladies and gentlemen,